Good morning, everyone. I would like to call to order this public hearing of the Committee on the Judiciary and Public Safety. I am Councilmember Brooke Pinto, representing Ward 2 and Chairwoman of the committee. It is 10:31 a.m. on Wednesday, April 10th, and we are conducting this budget hearing in person in the Wilson Building in room 120 and streaming on the DC Council's website and at Channel 13 and on X at @CM Brooke Pinto, as well as YouTube at @CM Brooke Pinto. The Committee on the Judiciary and Public Safety has oversight responsibility for matters affecting the district courts, criminal law, procedure and justice, public safety, including policing, violence prevention and intervention, civilian police oversight, access to justice, including victim services and justice grants, fire and emergency medical services in the district's 911 and 311 services, forensic science, fatality review and medical examinations, homeland security and emergency response, adult corrections, family law, probate and estates, child support, and women's and gender policy. Today, the committee will continue its review of the mayor's proposed fiscal year 2025 budget and financial plan, discussing the proposed budgets for the following 5 agencies: the Criminal Justice Coordinating Council, the Deputy Mayor for Public Safety and Justice, Fire and Emergency Medical Services, the Corrections Information Council, and the Department of Corrections, in that order. We're going to take each of these agencies in turn, starting with the public witnesses and then the government witness for each agency, one at a time. We're scheduled first to hear from the Criminal Justice Coordinating Council, otherwise known as CJCC, an independent agency that serves as a forum for identifying challenges and generating solutions to enhance public safety and the fair administration of justice for DC residents, visitors, victims, and justice-involved individuals. The CJCC facilitates information sharing and collaboration between agencies, conducts research and analysis, and provides training and technical assistance on behalf of its district and federal member agencies. The mayor's proposed FY25 budget proposal includes $4.4 million for CJCC, which represents a roughly 10% decrease as compared to FY24. The budget does not include funding for a number of new data reporting requirements that the council imposed on the CJCC in the hope of improving transparency and public understanding of the criminal justice system. And I'm hoping that we can work together to identify additional funding for the very hardworking CJCC staff. Second, we'll turn to the Deputy Mayor for Public Safety and Justice. The Deputy Mayor is responsible for providing direction and support to and coordination of the district's public safety agencies to develop and lead interagency public safety initiatives to improve the quality of life in the district's neighborhoods. The Deputy Mayor provides oversight of the district's public safety cluster agencies, including the Metropolitan Police Department, the Office of Neighborhood Safety and Engagement, Fire and Emergency Management Services, and the Office of Unified Communications. The mayor's proposed FY25 budget allocates approximately $15.5 million for the Deputy Mayor's office, which represents a 25% increase from last year. That substantial increase reflects a continued expansion of the duties of the DM's office. Last year, we shifted safe passage from the Deputy Mayor for Education's office into the Deputy Mayor for Public Safety and Justice office. The council also added the Safe Commercial Corridors grant program that I started last year, which became permanent in my Secure DC bill and expanded to commercial corridors throughout the city. And the mayor's budget proposal would shift another program, the ONES Leadership Academy, into the Deputy Mayor's office from ONES. I'll be interested to hear about each of these programs and how the shift of Leadership Academy is going to help that program and how the expansion of that office is going overall and why it is needed for improved public safety. Next, we'll hear from the Fire and Emergency Medical Services Department, or FEMS, whose mission is to preserve life and promote health and safety through excellent pre-hospital treatment and transportation, fire prevention, fire suppression and rescue activities, and homeland security awareness. The mayor's proposed FY 2024 budget provides FEMS with approximately $370 million, which is a 13% increase over last year. I have questions for the chief today about how the mayor's proposed budget will impact the quality of life and safety of firefighters, service provided to residents, and maintenance of the department's fleet and facilities. I'm pleased to see an additional $200,000 investment to establish a paramedic training program to support the workforce pipeline and provide district residents easier access to these good paying jobs. I look forward to discussing this program and its timeline today in more detail. Next, we'll turn to the Corrections Information Council. The CIC is an independent body responsible for inspecting, monitoring, and reporting on the conditions of confinement at any facility where district residents are incarcerated, including DOC facilities, Federal Bureau of Prisons facilities, and private facilities. CIC's inspections include direct assessments of facility conditions, interviews with incarcerated residents and facility staff, as well as community outreach. The mayor's proposed FY25 budget provides CIC with approximately $1.2 million, a 7% increase over last year. This increase appears to primarily relate to salary increases for staff, as well as an $88,000 increase for the Prisoner Wellbeing Program, which provides inspections of correctional facilities to assess conditions of confinement. The budget includes a total of 11 FTEs, which represents a reduction of 1 position from last year. And I intend to ask Director Isaac about this reduction, as well as what the agency's plans are for the Prisoner Wellbeing Program's funds in the upcoming year. Finally, we'll hear from the Department of Corrections, or DOC. DOC is responsible for providing a safe and secure environment for individuals in custody at the district's correctional facilities, which include pretrial detainees and sentenced inmates. In this role, the department manages the DC jail facilities, including the Central Detention Facility and the Correctional Treatment Facility, as well as overseeing the range of programs and services offered to residents at these facilities, including educational, workforce development, and other programs focused on residents' successful reentry following the completion of their sentence. The mayor's proposed FY25 budget provides DOC with approximately $220 million, a 12.5% increase from last year. The budget proposal also includes 1,231 total FTEs, representing no change. Last year, there was a robust conversation about the reduction in FTEs for the department, and I highlighted concerns about overtime pay for staff and having too few uniformed officers at the jail and overworking those staff, which can cause well-being concerns as well as safety concerns for both employees and residents at the jail. Today, 21% of positions at DOC are vacant, and I intend to continue this discussion on the impact of staffing, especially with the proposed increase to the jail's population that we are seeing this year with Director Faust today, as well as on other barriers to recruitment, hiring, and retention facing DOC. Council also passed, as part of Secure DC, improvements to the health standards of the food provided at DC jail, as well as setting up a hospitality training program at the jail to better equip residents there for success upon their reentry. Those provisions are not specifically funded in this budget. And so I plan to speak to the director today about how we can implement both of those important missions with this budget this year. Finally, I plan to ask Director Faust about the status of a new annex at the jail that is currently in the design phase. I'm hoping to get some specifics about the plans for this facility and how it is going to incorporate programmatic space to support reentry services. I believe the new jail is very important, a critical investment to support habitability and success for reentry. And I also believe a similar project is needed at the central cell block, and I am very disappointed to not have that budget reflected in the mayor's proposed budget this year. All right, I don't think we are joined by any colleagues at the moment. I can't see the screen, so okay. So we're going to turn to our first agency on the agenda today, the Criminal Justice Coordinating Council. We have no public witnesses for CJCC, so I'd like to call our government witness, Christy Love, the Executive Director of CJCC. Welcome, Director Love. And if you have staff joining at the table who will be answering questions, can you state your name and position for the record, please?
Good morning, Free Hewitt Dereso, Agency Fiscal Officer.
Great, thank you, welcome. And as you know, it is the tradition of this committee to swear in all government witnesses who appear before it. So if I can ask you both to turn your microphones on and raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you. Please take a seat, and Director Love, I'd like to invite you to make any opening statement that you may have.
All right, good morning, Chairwoman Pinto. I'm Christy Love, Executive Director of the Criminal Justice Coordinating Council. and I'm joined here by Free DeResso, our agency fiscal officer. As you shared, CJCC's mission is to serve as a forum for identifying challenges and generating solutions to enhance public safety and the fair administration of justice here in the District of Columbia. The CJCC, the council, is comprised of 19 members, and those members are supported by our 22 agency staff who are in 3 divisions: the information technology team, the statistical analysis center team, and the policy team, along with executive and administrative staff. CJCC agency staff have 4 core functions: to facilitate automated information sharing, conduct research and analysis, facilitate interagency collaboration, and provide training and technical assistance. CJCC's approved budget for fiscal year 24 was $4.92 million. The mayor's proposed budget for fiscal year 25 is $4.41 million, which is an overall decrease of 10%. This includes a 17% reduction in local funding, primarily due to the removal of a one-time enhancement. We understand that due to the projected revenue shortfall for the district over the next few years, the mayor and council will have to make some very difficult budget decisions. Therefore, we are especially grateful that the mayor included a $160,000 enhancement in CJCC's FY25 budget to help cover costs due to the agency's increased responsibilities under Secure DC. I would like to mention, however, that even though the fiscal impact statement for Secure DC indicates that this additional funding would be for a new position, the proposed budget categorizes this as non-personal funding, and this precludes us from using the funding to hire additional staff. I look forward to working with either council or the mayor's budget office to hopefully resolve this issue. As stated, while we appreciate the mayor's enhancement, given that Secure DC has more than doubled the workload of CJCC's Statistical Analysis Center staff, and considering the task force that CJCC is required to convene per Secure DC, we are seeking an additional $170,000 beyond the mayor's enhancement to help ensure CJCC is able to meet its legislative responsibilities. The additional funding will be used to hire staff to conduct analysis and to lead the task force. Secure DC requires CJCC to convene a pre-arrest diversion task force that is responsible for identifying best practices and also making recommendations regarding eligibility and programs, facilities, personnel, funding, and legislative changes needed to support pre-arrest diversion. The task force is also required to identify potential improvements in police training and procedures for persons affected by homelessness, substance use, and mental health challenges. Additionally, the task force is charged with actually implementing a pre-arrest diversion program. Given the operational function of this task force to not only make recommendations, but to actually implement a program, CJCC will need additional policy resources to manage this new responsibility. Secure DC also requires the CJCC to conduct one-time analyses, including a report on juvenile and adult pretrial detention, as well as a report on witness assistance in the district. Considering that these are one-time analyses, we are able to carry out this responsibility with existing resources. However, for the witness assistance study, we are seeking clarification from council regarding the scope. Is the focus of the study intended to be specifically on witness assistance that is distinct from victim assistance? If so, then based on preliminary discussions with the agencies listed in the legislation, and that includes MPD, OVSJG, OAG, USAO, and DC Superior Court, only USAO provides assistance specifically to witnesses who are not also victims. In addition, our understanding is that USAO's Witness Assistance Program is based on policies and procedures that apply to the entire U.S. Department of Justice. Therefore, requiring CJCC, a district agency, to evaluate and make recommendations regarding policies and procedures of a federal department seems beyond our jurisdiction. Instead of being evaluative, perhaps the CJCC could provide descriptive information regarding USAO's Witness Assistance Program, type of assistance witnesses have requested and that USAO has offered, and then a general review of the literature on best practices. While we can absorb costs associated with the one-time analyses, we will not be able to do so for the routine analyses required under SecurityC. The Act requires the CJCC to issue the following reports for the foreseeable future: monthly reports on violent crime incidents and adult and juvenile arrests for violent crimes, quarterly reports on the full spectrum of the criminal and juvenile justice systems, including diversion, pretrial supervision, detention, prosecution, sentencing, commitment, incarceration, probation, parole, supervised release, deferred agreements and consent decrees, and bench warrants. And then an annual report on felony crime statistics, including arrests, convictions, and characteristics of suspects and victims. Complying with the legislative requirement for these routine analyses more than doubles the number of analytical products the CJCC issues. For example, in FY23, CJCC issued 68 research and analytical products, whereas under SecurityC, CJCC would be required to issue an additional 117 products a year for a total of 185. In order to meet the monthly and quarterly reporting requirements, the CJCC has already had to cut back on other analyses. We've discontinued the monthly gun violence dashboard and justice system operations dashboard that were provided to our members. We've had to decline, in some cases, requests from our partners to conduct ad hoc analyses to support their decision-making. In the absence of additional resources, CJCC may have to discontinue or scale back other routine analyses for our various committees. We are considering opportunities to create more efficiencies to manage the workload from SecurityC, and that includes working with partner agencies to provide data feeds that would enable us to automate the creation of the quarterly dashboards. However, even establishing these data feeds would still require additional IT resources in the short term. We do respectfully ask Council to also consider whether other legislatively mandated reports that the CJCC is required to generate, such as the Human Trafficking Report and the Youth Rehabilitation Amendment Act report, continue to be a high priority, and if they are, whether the scope could be modified. In addition to SecurityC, in December, Council also passed the Crime Victimization Survey Amendment Act, which requires the CJCC to engage a contractor to conduct a district-wide biennial survey on crime victimization. The act also requires the CJCC to convene a crime victimization survey task force to advise on the goals, focus, scope, and theme and design of the survey, among other things. The fiscal impact statement estimates that the cost of the survey will be $400,000 for FY24 and $415,000 in FY26. However, we recognize that this legislation has not been funded, and we look forward to beginning this work if the funding does become available. So in closing, beyond the need for the additional funding to comply with SecurityC, the proposed budget adequately supports CJCC's ability to carry out its other core functions of automated information sharing, interagency collaboration, and training and technical assistance. And as I close, I just want to take the opportunity to thank the CJCC staff for their incredible work and dedication to the mission, and also thank you to our diligent and responsive OCFO colleagues for their ongoing budget support. That completes my statement, and I look forward to responding to questions you may have.
Great. Thank you very much, Director Love. And you know, I'm moved when I hear you list out so many of these reporting requirements, because we have a tendency, and I am among them, to want more data. And I think that data used well can really drive policy improvements forward. And when it comes to the public safety space, you and your team have done such an excellent job of collating otherwise inconsistent data. And so it should be taken as a compliment that colleagues continue to look to you for additional data production. However, we have to be reasonable with what we are asking. A number of these data reporting requirements were included in Secure DC as we initially contemplated it, but many others were added at later amendments that I opposed. And I just want to say again, for the record, part of the reason that I oppose some of those things is because we have to consider how all of these reports are working in concert with one another and the real demands that it has on limited staff. And so those decisions and conversations should always happen before legislation is passed. With that said, the law is an iterative process. And so we're happy that you're highlighting some of these gaps. So I want to start with the dashboard of the quarterly reporting that you and your team have gotten off the ground. This was a requirement that was put in place from the public safety emergency that we passed in July of 2023. And with a lot of effort and work by you and your team, you have gotten that dashboard up and running, which has been extremely useful to me and my team, and to the public to have a better transparent look and glean insights from what's going on across our public safety system. Do you have the funding currently to continue that effort for that dashboard that you've already set up? Oh, no, it's not. It should be red. Thank you. Good reminder.
Okay.
There we go.
And so, like I said, it's a all hands on deck proposition really for us. And we want to have the bandwidth to be able to conduct analyses that are requested by our committees. And at any point in time, we have about 15 committees and work groups that we facilitate. And I have found that since we've been doing work on the dashboards, which has become our priority because we do understand the importance of it, the legislation and transparency for the justice system, I will say that we have not been able to be as responsive to some of the requests that have come from our committees. So in order for us to do everything, be responsive to our committees, as well as meet the legislative mandate, we currently do not have the resources to do that.
What are some examples of things that the subcommittees ask that are the biggest draw on staff time and resources?
Sure. So we've done over time a number of ad hoc analyses. So if something comes up, and maybe a good example, before he left, Chief Conti had made the point that they were observing that a lot of the juveniles who were being arrested for violent offenses, this was actually their first arrest. And so that may have been anecdotal on his part. So anytime we sort of hear, a statement like that that's based on anecdote, we are often asked, okay, CJCC, can you run the analysis on that to see if the data backs it? The data did indeed back it. It was about 50% of the kids arrested for violent crimes. That was their first DC arrest. But we want to be able to be responsive and do things like that. So we're not just making decisions on anecdote, we're making decisions on data.
Okay, thank you. And can you remind everyone for the record what those subcommittees are?
Yes, it's going to be a challenge. So we have 4 priority areas that the CJCC members identified. So they are juvenile justice. And so we have 3 juvenile justice groups. We have the Umbrella Juvenile Justice Committee, and that's co-chaired by Attorney General Schwab and Judge Soltis, who's the presiding judge of the family court. And then we have a Juvenile Justice Data Committee, and we have a monthly data report. A lot of our ad hoc analyses that I mentioned comes from that data committee. And then we have a joint supervision work group that's looking at youth who are dual jacketed, or also youth who are in both the adult and juvenile systems. So that's 3 juvenile justice work groups. We have 2 violent crime work groups, the Violent Crime Committee, and also the Gun Stat work group. And it's Gun Stat that focuses on the 200 or so high-risk individuals identified through the gun violence problem analysis that NICJR conducted for the CJCC. And then we have the substance abuse and mental health priority area. And under that, we have, it's a long acronym, but it's the SAMHSA committee, and that's chaired by Dr. Bazran and also, and also by the court and Judge Brandt. I apologize for blanking on her name. And under that, we have a familiar faces work group, which we are considering sort of the kind of the predecessor of the pre-arrest diversion task force, which was really aiming to identify individuals who are cycling through the justice system, perhaps in large part because of substance abuse and mental health issues. And then we have the incarceration and corrections, community corrections committee. And that's where we focus on people who are detained, those supervised in the community, and also reentry. And then we run the system justice. And so with respect to justice, we actually have 4 groups that help oversee that. We have the Information Technology Advisory Committee, and then 3 subgroups. And then we have our Interagency Research Advisory Committee. And so it's really all the researchers from our partner agencies participate in this committee. So anytime the Statistical Analysis Center embarks on new research, we pitch the methodology to this group. They give us feedback. We pitch the dashboards and kind of let them preview the dashboards before they were issued, and they gave us feedback. So those are all of our committees.
Okay, thank you very much. And numbers question. So as we kind of get prepared for that, as I said, there are some reporting requirements that I think possibly are too overburdensome given all that you're working on. There are some that I do think are really important. And a number of those include reporting requirements that we initially included in Secure DC, which includes reporting on bench warrant enforcement, annual reporting on felony crime statistics, and monthly reporting on violent crime incidents. Do you have the estimates of what those total costs would be for those reports?
I think it's difficult to speak precisely about the cost of each report because it's really staff time. And I have to say, not just CJCC staff time, it's also our partner agencies staff time. I'd have to go back and think about that if you're looking for an estimate, and maybe we can do a calculation where we factor in the staff time required to do those reports and can get back to you on that.
Okay, thank you. Because we haven't gotten the updated FIS from the CFO on that, and we want to be responsive to what you're saying, that it's going to cost you to do these analyses, but some of them I do think are really important to have an accurate reflection of the data. When you talked about kind of automatic processing, this is of particular interest to me because one of the things that I hear the most from partner agencies about the pull on their resources is that everyone pretty much has a different system for maintaining information. And some of those systems, as you know, are very archaic and are based on manual inputs. And as we, try to move our government technology into the 21st century, is that a better focus of investment on time and resources this year to update the technology and get things to a place where ultimately they can be more automated?
I think, well, automation is certainly great. And I'll give an example of how it's helped. And MPD, I would say MPD and the court just overall are the biggest suppliers of data used in CJCC's analyses. So we were able to make an arrangement with MPD, and this was maybe a year and a half ago. Instead of every time we're asked to do an analysis that involves crime incident or arrest data going to you and your team having to do a data extraction, we were able to establish an arrest data feed with MPD and a crime incident data feed with MPD. And I think we get that refreshed on a weekly basis. Therefore, we no longer have to go to MPD's data team to ask them to extract data. That data comes to us automatically. And we are respectful of their data. If we're going to do new analysis, we go to them and we ask for permission, but they don't have to do the work of pulling and extracting the data. So I think for the district agencies that we're getting data from, I do think trying to pursue data feeds would be valuable. We have to talk about, certainly if there are any legal issues involved, and like you said, some of their data systems may be outdated and maybe not suitable for a data feed, so we'll have to work on that. The federal agencies, I can imagine that some of them, it may be a challenge because of the Privacy Act. And so right now, we know the Federal Privacy Act, the way it's interpreted by most of our federal partners is such that they don't feel that they can share personally identifiable information. And certainly if we were getting a data feed, it would have PII. So right now, I would say probably the greatest burden in terms of these dashboards and on our partners is with the federal partners, because they are having to pull the data and in some ways do analysis themselves and then turn the aggregate information over to us, and then we generate the dashboards. So I think automation would be great, but since most of the data is coming from federal partners, I still think we have the Privacy Act hurdle.
Okay. Well, as this is a year where there has been more interest from our federal government in safety in DC, I think as we contemplate ways that would actually be constructive for the federal government to be helpful, the Privacy Act is one such way that we could use their support and re-looking at so that we can all keep moving towards data-informed policies. As you consider, and I will ask you, Director Love, I think it would be useful if we could have a one-pager just listing out all of the studies and reports that you've been asked to do. I think that would be useful for me and my team, and certainly to talk to my colleagues about the litany of things so we can collectively have a discussion about the top priorities that we really need. But from your perspective, if we were able to identify some additional funding, what do you think is some of the most useful data sets as you look at the entire ecosystem, and from your role of working with all of these partners?
Yeah, I actually think the data, the quarterly and monthly data that's being asked of us in Secure DC is very beneficial, because I think this is the first time, even among the CJCC, that we're getting a look from a data perspective at the entire system. And so that's why even without the funding, we've still been trying to make this work, because we realize how important it is. And it's given all of us, even those, like I said, those of us involved in the system, just a really helpful look to see how things are going. So, you know, we want to continue to be able to do those, and we want to get them on time. And we also want to be responsive to our committees. So I do hope additional funding will become available so we can do all of those things.
Understood. Okay, thank you. So I want to ask you about the pre-arrest diversion task force and kind of how you contemplate getting this off the ground or expanding some of the work that is ongoing. So as it relates to the funding that's provided for this provision of Secure DC in the mayor's proposed budget, what will that funding be used for, and what will the makeup of that group look like? So we had contemplated that the funding would be used to hire a person. Like I said, right now in the budget, it's categorized as non-personnel funding. And the reason for it is, you know, it's one thing to have a task force that gets together and there's sort of a task, you make recommendations, and you do a final report, and then it sunsets. But the way I am reading and understanding Secure DC, yes, the initial task is to make recommendations on criteria for pre-arrest diversion, you know, recommendations on funding and programs and that sort of thing. But when I also read it, it says then identify the individuals who would, you know, be eligible for pre-arrest diversion. And then it says to implement pre-arrest diversion.
And so my understanding is that whoever we would have assigned to this task force would essentially be a project manager of sorts when it comes to implementing pre-arrest diversion here in the district.
Thank you. And do you have a timeline that could get off the ground, assuming this budget passes with the funding for this intact, that wouldn't effectively start until October 1? Is that still work that could get going before October 1?
Yes, because my understanding is that if, the FY25 budget is passed, then we can start recruiting and hiring with the knowledge that the individual would not start until October 1st, but we could start our recruiting and hiring efforts as soon as the budget is passed.
Okay, great. Thank you so much. And I think it is a really exciting area for the district to lead on. We've been looking at what other jurisdictions are doing in this space, and there are a large number of individuals who have substance abuse issues, mental health challenges, who need support and need follow-up. And our carceral system might not be the best avenue for that. And it's often not the best avenue for that, but it also can't be that we don't do anything and that we don't have that follow-up. And so I'm really eager to see what this group recommends so that we can provide both true care and treatment and accountability for this population when crime does occur and when there are public safety challenges. So thank you for your focus on that.
Sure.
So I want to ask about a couple of the other specific studies just to get a better sense of your thinking. So for the crime victimization survey, am I getting this right that you believe that would cost about $400,000?
Yes.
Okay. And is that because of the task force component of the crime victimization survey?
No, so this is based on estimates. It's really the cost of doing the district-wide survey with a representative sample. So under the NEAR Act, CJCC was required to do a district-wide survey on police community relations. And so we based this current estimate, and that was back in 2018, I think we did that survey. We know cost of doing these things has increased, and understand what the level of effort will be. And we've looked at there are about 4 other states that we've looked at that have done similar studies. So that's how we came up with the estimate that we offered to OCFO. But yes, we'll have to use, multimodal methods. Last time around, the contractor we hired did phone calls, we did texts. And so when you do that individual outreach to try to get a really good response rate, that can become costly. So that's the basis of that estimate.
Okay, that's helpful context, that the survey itself, because
Yes.
if we're thinking about other ways that we could possibly limit the impact, but if it's the survey that is going to be that costly, that's helpful. So the human trafficking report you mentioned, or the youth rehabilitation report, do you have or know the costs associated with those?
Again, that's mostly staff time. I will say the human trafficking report, that has been fairly manageable. At some point, I think we were being a bit ambitious trying to do it annually. I think the legislation requires us to do it every 3 years. So again, that's one of those things we said, okay, we're going to just stick to kind of what the law requires and step back a bit and just do that every 3 years. The YRA report, that does require a significant amount of time. We have a number of data sharing agreements that we have to enter into. And most of the agencies that we get data from, their preference is to really, do a new agreement for each time we do the study. And so we have to re-enter into those agreements. And we're getting pretty extensive data. And we honestly are running into a few roadblocks because we're gearing up to do that next biennial report now, because it's due, I think, this October. And so with YRA, many of the cases or some of the cases end up being sealed or set aside. And so trying to get historical data on cases that are now sealed is challenging and in some cases not possible.
Hmm.
So we're also having concerns about the validity of the analysis if the sealed cases under YRA are now hidden from us. And then there are other parts of the analysis that asks us to do an analysis. Well, the YRA amendment requires the court to provide a written justification for why it offered this person a YRA sentence. And so it's really challenging. And that's something that we kind of had to leave on the table and we weren't able to do last time around. It would have required us to.
Sorry,
Yeah,
Director,
sure.
excuse me one moment. Welcome, everybody. Thrilled you're here. Feel free to sit in these chairs in the back as well. Yeah, no problem. Welcome on in. Hi.
Me.
Sorry to interrupt you, Director. Go
No
ahead.
problem. I'm glad to see them here. So yes, getting that written explanation, the judge's written explanation, that would require us to pull individual PDF documents from the court and review them all and extract that information and then try to summarize the judge's explanation. So that's something we just didn't have we have one statistician doing this and we just didn't have the resources to do that part of the work.
Okay, and so just to make sure I have the number, do we have a range of what we think?
We'll get back to you on that. And we're going to give you the range. Like I said, we left some things on the table because we just couldn't do it. We're going
Right.
to give you the range if we were to do everything that's listed,
Okay.
how much it would cost.
Okay,
Yeah.
that would be helpful to the extent we have that for each report. So we can
Okay.
then have a follow-up conversation with you all about which should be prioritized.
Okay.
I also understand that effort is also gonna require some
Right.
staff time, but I think it will be worth it to kind of address some of your concerns here. And even if some of them are ranges, we'll follow up with our budget office and the CFO as well, but would be helpful ranges from your perspective.
Sure.
So Councilor McDuffie introduced an amendment to Secure DC around studying the juvenile and adult pretrial detention. I thought at the time that these did have a fiscal impact because of the work that it required CJCC to do. Am I understanding this correctly, that you no longer believe those would have a fiscal impact?
No, because I think the original amendment was asking us to be evaluative and saying, evaluating the impact that I think the pretrial detention provisions had on, I would say, public safety. And so we did communicate that we didn't think doing an impact assessment would be possible, given all the other efforts the city currently has underway to reduce violent crime and enhance public safety. So the current legislation just has us providing descriptive information. So what did pretrial detention rates look like prior to the July legislation, and then what did they look like? I think it's 180 days since Secure DC. So since it's that straightforward and descriptive, that is something we can do with current resources.
Okay. Okay, great. Thank you. So you expect those studies to be more descriptive of a kind of a snapshot?
Yes. Yeah.
Okay. So you mentioned a similar distinction for the witness assistance program, that if it was descriptive and not evaluative, it would be more feasible. Do you have a sense of what cost savings you could glean from that distinction?
That's a challenge. And so that distinction, we're suggesting being more descriptive, more from a jurisdictional standpoint. I think it's a little challenging for CJCC to make recommendations of a policy made by Main Justice. So that was more of our concern there. But again, I think we have to go back and come up with estimates if we were to do this analysis as written, you know, how much it would cost versus maybe the descriptive version that we're offering.
Okay. Let's follow up about that
Okay.
too, in our next conversation. So for the transition away from justice that we included in last year's budget, how is that transition process going?
It's going well. We're excited to say that we completed phase 1 earlier this year of the cloud migration, and we split it up into 2 phases based on feedback from both OCP and Octo. So phase 1 was working with a vendor. They would do a deep dive assessment of justice and then give us recommendations for how we could most efficiently migrate to the cloud. So the vendor completed their work, provided all the deliverables, gave us several recommendations. And so we have decided which one we want to go with. And so now we are in the process of working with Octo. They're reviewing our statement of work for phase 2 of this project. Fortunately, because my concern was just, you know, the procurement process can be lengthy. Fortunately, there is a master agreement that covers cloud migration services that the district has available. And so we actually will not have to solicit this in a traditional way. So we understand that once Octo completes its review and they have it this week, we hope to follow up with them and understand how long it will take for their review. They'll communicate to OCP that they approve it, and then OCP will be able to develop a task order based on the master agreement. So with that, I'm expecting that we'll be able to start phase 2 in May. One of the first deliverables we're going to ask the vendor is a timeline. Because we run justice, we've kind of supported partner agencies in this cloud migration process, and we've seen it take months, and we've seen it take, you know, over a year. And so we anticipate that the timeline we receive from the vendor will help us plan things out, but it's on track.
Okay, thank you. And is that the one-time enhancement that you mentioned in your testimony?
Yes.
Okay.
Yep.
Just want to clarify. All right, great. Well,
Okay.
thank you very much, Director. That concludes my questions today. I want to give you a chance if you have any closing thoughts or anything that you want to highlight that we didn't have a chance to talk about today.
Yep. No, and I just, again, and I agree with you, just the vote of confidence for CJCC and the staff through SecurityC and having us do the additional analysis. We really want to do it while also still being responsive to our partners. So we really do hope the additional funding is available. And we will certainly follow up with you on trying to come up with cost estimates for our research and analytical projects.
Okay.
Thank you.
Sounds like a good plan. Thank you
right.
very much, Director. Thank you to you and your entire staff. We really appreciate all of the hard work that goes on through the year that we have come to depend on greatly for our need to improve public safety in the city over the long term. So thank you.
Thank you.
All right, that concludes the Criminal Justice Coordinating Council. We are going to turn to our next agency on the agenda today, the Office of the Deputy Mayor for Public Safety and Justice. We're going to follow our normal practice and hear from public witnesses first. All public witnesses today have 3 minutes to present their testimony. We're so glad to have so many folks in the room and look forward to hearing your testimony. Also, due to the fact that we have 5 agencies today and many public witnesses, I'm probably going to limit my questions a little bit, but look forward to hearing your testimony to share today. So I'm going to call our first panel, Dr. Jessica Henderson Boyd. You here, Dr. Boyd? Okay, Dr. Boyd, we will call you virtually and hear from you first. Dr. Boyd is going to be testifying on DOC, and then we will move to our in-person witnesses for DMPSJ. Dr. Jessica Henderson Boyd, President and Chief Executive Officer of Unity Healthcare.
Good morning, Chairperson Pinto and esteemed members of the Committee on Judiciary and Public Safety. My name is Dr. Jessica Henderson-Boyd, and I'm the President and CEO of Unity Healthcare, the largest network of community health centers in the district, serving 1 out of every 8 DC residents. We've had the privilege of partnering with the Department of Corrections since 2006 to deliver comprehensive healthcare services to justice-involved individuals, ensuring continuity of care upon release. And I want to express my deep gratitude to Director Faust and the dedicated team at the Department of Corrections, as well as Mayor Bowser for her commitment to the well-being of district residents, including those in government custody. On one of my visits to the Department of Corrections, I had the opportunity to consult on the care of a young man with sickle cell disease who was frequently hospitalized and at high risk of death. As I accompanied the primary care physician in the room, the patient shared with me that the medical team at the Department of Corrections represented his medical home. They were the ones who knew his medical history best. They understood the barriers that he faced in the community, and they knew him as a whole person. The team advocated for him with specialists. They optimized his treatment regimen, and they partnered with the patient on a care plan for reentry. And I think this really illustrates the value of a community-based model for healthcare at the DOC. Today, I wish to emphasize 4 critical priorities for improving patient care. Firstly, it's critical that funding is maintained for a comprehensive correctional healthcare service. We know that the overall healthcare costs have been increasing across the country and in the district, and this is especially true in congregate settings like the Department of Corrections, which require even more infection control measures to reduce the spread of illness, something we learned from COVID. Secondly, the Department of Corrections more generally needs funding, and it's critically important, whether it be for staffing or maintenance of the facility, even as they plan for a new building. That appropriate staffing directly impacts the safety and well-being of residents and other staff members in the building, including our clinicians. Staffing also supports increased healthcare access by ensuring that residents can attend their appointments as necessary. Thirdly, it's imperative to sustain and expand substance use disorder treatment, behavioral health services, and trauma-informed care. The ongoing opioid crisis in the district underscores the importance of expanding SUD treatment services within the DOC. We currently treat almost 400 patients per month, and only a portion of that which can be supported by the State Opioid Response Grant, which is supported by SAMHSA and the Department of Behavioral Health, particularly in the face of a growing census. And we've seen significant success in treating residents with SUD, reducing recidivism, and promoting community safety. Finally, continuity of care and reentry support are vital for individuals transitioning from correctional facility. Continued and expanded financial support allows us to enhance post-release care coordination for patients, reduce those long-term healthcare costs, and promote community health and wellness. Unity is dedicated to collaborating with the DOC and other stakeholders to deliver compassionate healthcare services to justice-involved individuals. Together, we can improve health outcomes, reduce recidivism, improve healthcare costs, and promote community safety. To adhere to the time constraints, we invite you to review our written testimony for further details. Thank you very much for your attention, and I welcome any questions.
Thank you very much, Dr. Boyd. And thank you for all of the work that you do to provide healthcare in this contract and around the city. I want to ask you if you all have noticed any distinctions between the physical and mental health care needs of the population at DOC and how Unity is accommodating for those increases.
Yes, I mean, I think you're raising a really important point, which is that holistic care is essential. And we like to integrate behavioral health into physical health, and they go together. I would say we found the behavioral health needs of the population to really be growing and a critical component of care. This is taken on right at the time of intake. So many times when a resident is coming in through intake, they get a full behavioral health assessment, they get a suicide risk assessment, they get a full, physical set of risk assessments. So really, I think that the integration is clear. But expanding behavioral health, thinking about trauma-informed care, and approaching substance use disorder is also going to impact physical health because we know that the two are interrelated.
Okay, thank you. And do you feel that you currently have the staff necessary at DOC to provide the services that the residents need there?
I think we have faced staffing shortages, I think similar across the healthcare industry, and we need more mental health clinicians that are really dedicated to this community. I do believe that we have the support of the Department of Corrections team to be thinking creatively about how we can expand access access. And we are really proud of the programs that we've done around substance use disorder, utilizing a team-based care approach, which includes psychiatry, it includes mental health clinicians, licensed clinical social workers, certified addictions counselors, peer navigators. And I think that that's going to be critical, just like it is in the community, to be thinking about how we can expand services and reach more people.
Okay, thank you very much, Dr. Boyd. Appreciate it.
Thank you.
All right, I'd now like to call our panel of in-person public witnesses for the Deputy Mayor for Public Safety and Justice. Maya Martin Cadogan. Okay. Okay. Carrie Savage. I'll fully introduce you once you're seated. If you can, the first person can sit on my right, your left. Yolanda Corbett. Okay, no worries. Naya White. Sure. Zyvion Murphy. Mania Pearson. And Khalil Cook. Welcome. And first, we will start with Carrie Savage, Senior Director of Policy and Advocacy at Parents Amplifying Voices in Education, or PAVE.
Good afternoon, Chairperson Pinto, members of the committee, and committee staff. My name is Carrie Savage, and I'm a Ward 1 resident and the Senior Director of Policy and Advocacy at PAVE. Today, I will focus on the aspects of the work around safe passage that fall under the Deputy Mayor of Public Safety and Justice. We sincerely appreciate Deputy Mayor Appiah and her team's engagement with PAVE parent leaders, who are overwhelmingly Black, many are Native Washingtonians, the majority live in neighborhoods that wrestle with community violence, food and housing insecurity, and a lack of excellent school options. We've done this through DC Parent Voice and Choice Week meetings, small group follow-up meetings with the Deputy Mayor herself, along with Nicole Peckham, Siada Rambo-Simboy, Jasmine Banab, and more. Their teams also participated at both the Center City Congress Heights Safe Passage Summit, and I'm excited for you to hear more from those students today, as well as Thurgood Marshall Academy. I really just want to emphasize how appreciative we are for their continued commitment to conversations with parents, school leaders, and others in our coalition. Now I will move to budget. We were very excited to see continued investments in the Safe Passage program in the mayor's FY25 budget. It is absolutely critical, and we should continue to invest in programs that ensure students are safe as they travel to and from school. While most of our priorities are budget neutral, we do have a few additional budget asks. First, we would like to see additional capacity to execute the roving teams program so that safe passage workers can travel across the city to communities with more immediate needs based on incident data. This is a great creative strategy, but it will require resources to be effective. Second, ensure the program's budget includes resources to follow through on Deputy Mayor Appiah's commitment to host at least one in-person citywide convening with all DCPS and public charter school leaders and safe passage stakeholders, including the Deputy Mayor of Public Safety and Justice, MPD, WMATA PD, and Safe Passage program leaders. This in-person engagement is essential for building effective working relationships. Third, we'd like to learn more about the criteria for which schools in priority areas receive safe passage support, since not every school in those zones is covered. While we understand that expanding resources may not be possible in this fiscal year, we should identify that number and work towards it in the future. I also want to discuss 3 critical aspects of safe passage programs that will increase the return on our investment: training, clear expectations, and program evaluation. High-quality training is key to successful safe passage programs. Safe passage workers need to know how to engage with children, what the school's protocols are, what to do, and who to contact should an incident occur. However, we have heard from school leaders that training, and therefore the experience of working with safe passage workers, can often be consistent. In addition to citywide training for all CBOs, doing that learning in one place, we also want to see school leaders host school orientations for their safe passage workers so they can learn meet the school team, their safety protocols, and understand the school culture. And then for the sake of time, I will just also note, we want to make sure that the evaluation metrics for the Safe Passage program are done and revised in partnership with students, parents, school leaders, and community members to make sure they are aligned to what Safe Passage workers can truly do, and what's the responsibility for school leaders or other safety entities. Thank you for the opportunity to testify. I welcome any questions.
Thank you very much, Ms. Savage. Zyvion Murphy, public witness.
Good morning, Councilmember Pinto and Committee on Public Safety and Justice. My name is Xavier Murphy, and I'm a seventh grade student at Center City, Congress Heights, and Ward 8. Today, I will be talking about the things that happened while taking the Metro and my overall experience. Something that I've seen while taking the Metro is a group of middle school students arguing and fighting. Instead of someone taking the initiative to break up the fight, they decided to record and laugh. I've seen people who are just waiting for their stop to arrive get injured by a group of people fighting. Many people who get on the bus are very loud and obnoxious. People who aren't stable mentally or physically are allowed on the Metro. When these people get on the Metro, it makes me feel uncomfortable because I don't know what their intentions are or if they want to harm somebody. Some days I don't come to school due to how high the crime rate is in DC. Buses get overly congested, and when the bus is going through regular traffic, people are bouncing off of one another, which causes arguments and leads to conflict. This conflict can lead to people on the bus getting harmed that has nothing to do with the situation. Additionally, there's not too many buses in service or delayed. This can also lead to conflict because when buses are delayed or not in service, it causes a group of people to crowd at one place. Crowding at one location can also have people bounce off one another, which leads to arguments and conflict. A solution to this is making a different bus for students only that goes to every stop that the Metro buses do. This could help resolve most conflicts on the Metro, but minimizing the number of people that are on the bus at one time. Thank you for the opportunity to speak with you, and I'm welcome for any questions.
Thank you very much. Mania Pearson, public witness.
Good morning, Councilmember Pinto and the Committee on Public Safety and Justice. Thank you for the opportunity to be here today. My name is Mania Pearson, and I'm a Ward 8 resident and a seventh grade student at Center City's Congress Heights campus. Today, I'm here to testify about the Safe Passage Program. The Safe Passage Program presents multiple issues, ranging from the ambassadors being under influence before or during shifts, having personal conversations on the phone, falling asleep during shifts, ambassadors not being consistent doing their jobs, while some don't even make any effort to show up, outside of them not having any authority to break up fights. Safe Passage ambassadors being under influence poses a threat to our safety. Those working under the influence are not in the right headspace to give out orders or to make the right decisions. My recommendation for the Safe Passage workers being under the influence issue is that a restriction should be made not allowing them to smoke before and during shifts. Safe Passage ambassadors not paying attention and being on their phone having personal conversations is the issue, because the language they use is inappropriate for children, and they are not 100% paying attention to the kids. My recommendation for this issue is they could receive work phones to only communicate with other workers with certain restrictions on the phones. For example, app restrictions, and not having the ability to add any phone numbers unrelated to work. Or they could receive a radio with a separate 911 channel in case of emergency. Safe Passage ambassadors not being consistent in doing their job and not putting any effort in doing their job poses a threat to student safety. My recommendation for this issue is to hire new workers with some sort of experience, and also for the ambassadors to take pride in doing their job. This includes firing the ones who are not doing their jobs or putting any effort into their job. My recommendation for the Safe Passage workers not having any authority to break up fights is for the Safe Passage workers to be granted that authority so they could be able to step in before things get worse and before the situation escalates into something bigger than it needs to be. If all these issues could be resolved, that would give every student guaranteed safety. Thank you for the opportunity to speak to you all today, and I am ready to answer any questions.
Thank you so much, Ms. Pearson. Khalil Cook, public witness.
My name is Khalil Cook. I ride on DC Connect buses and shuttles. I am a Ward 8 resident, and I'm a 12-year-old student at Congress Heights campus of Center City Public Charter Schools. I am here to state and share my opinions about DC Connect to better improve your understanding, which I hope will better our community. DC Connect picks up and drops off students at their designated areas daily. They foster and maintain a good, close relationship with all students and make sure their passengers get home safely. DC Connect also drops students off closely or directly to their house to ensure student safety. DC Connect gets rid of the risk of students getting harmed or wounded through regular Safe Passage program by minimizing or eliminating students from having to be present in highly tense or volatile situations. The staff of DC Connect know how to de-escalate a situation and has never made me late for school. They know how to do their job and how to do it fast. Violence unfolds every day on my way home, from fights, physical altercations, shootings, and other violent acts on the streets, at the bus stops, on the metro buses, or in the subway. With DC Connect, they helped me reduce or completely stop the chances of me getting harmed or endangered as a student. There should be no reason why I should be scared or worried about my safety while walking or taking the public bus. I believe DC Connect should stay with our community and expand to more schools and neighborhoods for not only my future, but for others as well. For me, there should be no reason why I have to wake up every day and worry about my safety and fear whether I'm going to make it to school or not. That's why I believe DC Connect should get more funding and to expand and bring this type of peace to as many students as possible. I hope my voice was heard, and I thank you for giving me the opportunity to testify today. I welcome any questions.
Wonderful. Well, thank you all so much for being here. And I am really moved by your suggestions, actionable suggestions. I hope you all are very proud of yourselves for showing up and making your voices heard. This is how we have change and improvements in our communities. And so thank you so much. We have to hear from you. And this is one of the best ways that we have to do it, which I know isn't always convenient. So thank you so much for being here. I want to ask you, you all kind of in different ways talked about fights that you're seeing, and that there's not really someone there, an adult there to break up the fight. And so when you talked about the fights that you're seeing on the metro, are those often fights between other kids or just other metro riders, which is why you think it should be separate route for just kids?
Sometimes it's between adults fighting, arguing over things, but most of the time it's kids from different schools fighting with one another because they have a problem with someone, but it can be resolved.
And do you ever see safe passage workers on the metro?
I see some safe passage workers on the metro taking their kids to school, but after that, I don't see them.
Okay. Did you have something you wanted to add to that?
I don't really see safe passage workers too much, and I don't have a good relationship with any of them because there isn't any safe passage workers that really talk to me if I do see them. So I really just think they should get a better relationship with students to like stop fights and altercations between other people.
And Manaya, you talked about the authority for safe passage workers to be able to break up fights. Is there something that you think would lead to the most trust between students and safe passage workers? Is that more of them? Is that knowing them better, who they are and who has the authority?
I feel like the safe passage workers try to build a relationship with them so they can get to know them, like by name and everything, so they can feel comfortable with them and trust them. So like it can be easier for everybody.
Okay. Thank you. Thank you all so much. We're going to call our next panel of in-person public witnesses, Precious Adebisi, Gabrielle Gilbert. Precious, okay, sit on the right chair. Gabrielle, here. Mecca Venable and Aaliyah Barnes. Wonderful. Precious Adebisi, public witness, please go ahead.
Good morning, Councilmember Pinto and the Committee on Public Safety and Justice. My name is Precious Adebisi. Thank you for the privilege to be here today. I'm a Ward 8 resident and 7th grade student of Center City's Congress Heights campus. Today, I'm here to testify about the School Resource Officers Program. Before the program was ended, resource officers showed up to schools when they needed to, and they kept both students and staff safe. When resource officers were defunded, the number of officers in schools gradually decreased until there weren't many left. As resource officers leave school, an extent of the school security also leaves. Resource officers play a crucial role in maintaining a safe school environment. Without them, the school community will lack the support necessary to build a healthy school community. The absence of school resource officers from schools creates several problems. Without SROs, schools lack the expertise necessary to handle certain situations that may arise. Additionally, students and staff may feel less secure and safe with SROs absent, which can negatively affect their well-being and learning. When I was still in kindergarten, there was a resource officer in our school. Although I may not have remembered his name, I still remember my experience with him. He always smiled and greeted my class, came in to talk to us or check in to see if we were having a good day. He gave us motivation to be good people. We no longer have that SRO, but my sister has someone in her high school, which makes me wonder why I'm deprived of this experience now. SRO's presence in schools is a necessity and everyone should benefit from it. My recommendations for the program would be to have 4 SROs circulate every 8 schools and to do this every 2 weeks. Not every school requires an officer present on site during every moment of the day. For example, my school doesn't require an SRO present always, but my classmates and I wish to build a relationship with the same officers that we see on our way to and from school daily. To ensure the safety of everyone, the SRO's program shouldn't be withdrawn. It isn't acceptable for a student to feel unsafe going to and from school. School buildings are meant to provide a safe environment for students to learn, but without the right safety precautions, students can be assured a safe learning zone. Another recommendation would be to cut funds away from the Safe Passage Ambassador program and make it solely volunteer-based. Although the Safe Passage has its benefits, it isn't as effective as the SRO's program was. Safe Passage workers don't fully give their attention to the students who cross the street, and they are very distracted and most of the time disengaged. Resource officers are a better fit for the protection of students because while they are connected with schools, they gave students their undivided attention and were able to handle any situations that arose. My final recommendation will be to allow retired officers to become SROs. It will be a great opportunity for officers looking for duties outside of normal police calls. This will give them exposure to the school community, and their experience in the field will be a great help in ensuring the safety of students in the community. Put yourself in our shoes. If you had to fear going to and from school, and maybe even being in school, would that not be on your mind always? The safety of every student and staff can be guaranteed if school resource officers are brought back into schools. Thank you for the opportunity to speak to you today, and I'm open for any questions.
Thanks very much, Precious. Gabrielle Gilbert, Public Witness.
Good morning, Councilmember Pinto and the Committee on Public Safety and Justice. My name is Gabrielle, and I'm a student at Center City Congress Heights, and today I will be talking to you about the School Resource Officers Program. To start, I would like to commend these officers for being well experienced and trained in stopping things before they can escalate. Their ability to problem solve using their training skills has been underestimated and undervalued. There are also some things that I think should be taken into consideration. The SROs being able to jump in or stop a fight if one was to ever happen and break out is very beneficial and helps minimize chaos and casualties, but the SROs not being present or near isn't good because they're not there, God forbid, something was to ever happen. Now that SROs have been depleted, they don't get to circulate schools, so that once strong bond with the students is starting to fade. And we are seeing the effects of this play out in schools and especially during safe passage to and from schools. To fix this problem, I think SROs should circulate through schools at least every 2 weeks just so they can get to know the students again and the students can build a bond with them. As much as we are relying on the Safe Passage ambassadors, my peers and I feel much better and safer with the school resource officers since they can act faster and quicker for faster and quicker outcomes and resolutions. Thank you for this opportunity to speak with you today.
Thank you very much. Mecca Venable, Public Witness.
Good morning, Councilmember Pinto and the Committee on Public Safety and Justice. My name is Mecca Venable, and I am a student at Center City Congress Heights who rides the Metro bus every day. And today I will be talking about Metro problems as it relates to safe passage and things I suggest be taken into consideration. Firstly, I think to ensure safer buses, we need to be very mindful of who we're letting on the bus. Very often, someone who's clearly overdosed with drugs will get on the bus. They are not always a threat, but sometimes there are some who like to argue with other passengers, make threats, or attempt to sell cigarettes to other passengers. I've actually had an experience of 2 passengers on Metro Transit arguing. Luckily, everyone on the bus got off safely because the situation did not escalate as bad as it could have, but threats to harm each other were made, such as pulling out weapons or fighting on the bus. Even though my brother and I were unharmed, it definitely left us completely scared and nervous during the moment. Something else I would like to mention is that those who are overdosed can potentially be carrying diseases that could harm others around. I am not suggesting to leave anyone who you would assume is under the influence of something, but to take closer observation before leaving them, so we can be alert or aware if they do potentially have negative intentions towards someone or everyone. This may be easier if a Metro Transit officer rode the buses to help with this decision-making and protection. Secondly, I think limiting bus capacity is a good idea. Normally, the bus tends to get crowded due to the amount of people the bus driver allows on. This can also lead to people getting hurt due to the amount of people falling into each other. Something that can be done to fix this is the bus letting people be aware of the fact that the bus is full instead of telling people to move back to create space. And another solution for this would to have another bus not too far from the first one that came. Maybe send 2 buses out at the same time. That way people do not have to stand outside for too long, but can have another bus right behind to pick up passengers that were left behind. Thank you for giving me the opportunity to speak here today, and I look forward to your feedback.
Thank you so much. Aaliyah Barnes, public witness.
Good morning, Councilmember Pinto and Committee of Public Safety and Justice. My name is Aaliyah Barnes. I am a student from Center City, Congress Heights. I am here to talk about Metro and what happens on it as it relates to safe passage. My recommendation for Metro is they need to add 2 to 3 security guards on the bus to protect others from violence and crimes that can unfold on the bus. For example, people sometimes bring weapons or other items that can possibly hurt others in a situation. There needs to be a capacity limit on the buses because buses can get packed badly and bus drivers keep putting people on the bus and it crowds throughout the bus. There is not a lot of room for others to sit down, or people are taking up 2 whole seats for themselves and no one else can sit down, or they have to stand up on the bus. Overcrowding causes extreme stress on the Metro buses, and it always leads to extreme behaviors and consequences. Secondly, the Metro should add metal detectors on the buses. People are not only capable of bringing weapons and more items on the bus that can harm people, or even the bus drivers. People are actually doing this daily. Daily, I watch with my little sister people getting disrespectful with the bus drivers. That's not right for the bus drivers because most bus drivers don't say anything back or just let it slide. Some other people that get on the bus either drink or smoke, and it stinks a lot, and they should get them off of the bus. And because they get loud and they disturb other passengers' peace, and also gets really annoying. People are most likely to bring any loud audios on the bus and train, and it disturbs others whenever they are trying to focus on other things. It even disturbs me because it's very loud and distracts me from either talking to my mom or sister or simply being able to think. It would be great if every bus had a Metro Transit police officer riding it, especially the high traffic lines. Thank you for this opportunity for me to be here to testify, and I look forward to any questions you may have.
Wonderful. Thank you. And thank you all for your testimony and being here. I think these are really important ideas. And one of the things that is standing out to me is whether it's the ideas for Metro Transit police on the buses or the SROs in schools or the safe passage workers. It seems like there's a consistency for a desire to have a trusted adult kind of at every stage of getting to school and being in school. And I'm wondering if there's a benefit to having that be the same person, so that instead of having all of these different programs, you know who you're going to see every morning on the bus, and that same person is going to go all the way with you, up to the school building and get to know each student in the school. And so I'm wondering kind of what you all think about that, if we were to have more consistency in the same person versus just having more SROs or more Metro Transit police on each bus.
Personally, I believe with consistency, there will be a form of trust between students, because if you see a different person every day, you won't become fully adjusted to that person. You will just, because everyone is different with everyone. And if you're consistent and have the constant same person, you would actually know that you can depend and rely on them
Mhm.
based on what you see with your experience with them.
Thank you. Anyone else about that? Okay. Well, thank you for your testimony. I really appreciate that, and we will keep that in mind as we move forward and try to make sure that all of you can be kept safe as you go to school and stay in school. So thank you. I'm going to call our next panel, Tyron Shumate, Zamari Kalaham, Aaron Brown, Martez Irvin. Welcome, welcome. And as a reminder, please make sure to turn your microphone on when you're speaking. It'll light up red when you click the button on the bottom. Go ahead, Tyron.
Good morning, Councilmember Pinto and the Committee on Public Safety and Justice. It is a pleasure to be with you today. My name is Tyron Shumate. I am a student at Center City, Congress Heights, and I am here today to share my ideas regarding the DC Connect program. DC Connect is a very good program with a very good community. Although when taking the DC Connect bus, we have realized that the vehicle that is used to transport students to and from school has reached a capacity limit. Most students have to squeeze into the vans and feel very uncomfortable. To fix this problem, we can use a bigger and better vehicle. Now there was a bus, but it would constantly break down, so we had to convert back to the vans. Another solution would to have more vans, so more students could ride DC Connect without being cramped and feeling uncomfortable. I have never ridden DC Connect, but my friend tells me how wonderful it is. I would love to have an experience to ride it. A change I would think that would be really helpful is adding car seats so younger people can have an experience this wonderful program. I would love to ride it with all my siblings, but since my sister is under 3 years old, I cannot ride it because I don't want to leave my sister alone considering I'm her big brother. This change will really impact the DC Connect program for the better because more students will apply for DC Connect, considering there's more vans and more open spots for toddlers. Thank you for this opportunity to testify today. I'm free to answer any question.
Thank you. Zamari Kalaham, public witness.
Good morning, Councilmember Pinto and the Committee of Public Safety and Justice. My name is Amari Callahan, and I'm a student of Center City, Congress Heights, and also a rider of DC Connect. Today, I will be giving you my recommendations for the DC Connect program. DC Connect has been doing a great job picking up my siblings and I and dropping us off for school, but there are some issues. The capacity on the bus is too small. If there were bigger buses, it could pick up more children to get them off Metro and keep them from walking home where danger lurks. Often on the pathway, my family and I travel from various other schools and corners. DC Connect has the potential to get most kids to and from school safely if given additional funding. There should be assigned seats on DC Connect so that kids of ages 3 and 4 can ride the bus with their siblings or by themselves. If there are assigned seats, there could be booster seats added to allow the 3 and 4-year-olds to ride buses. DC Connect should also pick up riders from extracurricular activities like they have used to in the past, so riders don't have to walk home while it's even more dangerous at night. This allows students to participate in extracurricular activities while still being watched over as they travel home. Thank you for letting me have the opportunity to let me testify today. Please let me know if you have any questions.
Thank you very much. Aaron Brown, public witness.
Good afternoon, Councilmember Pinto and the Committee on Public Safety and Justice. My name is Aaron Brown. I am a Ward 8 resident, and I am a student of Center City, Congress Heights, here to talk about Safe Passage. The Safe Passage does not stand up to its name completely because of their lack of effort, of full potential work, effort, and ethics. Improvements should be made to make this program worthwhile. My experience with Safe Passage isn't great. I've heard kids robbed on their way to school. I've seen Safe Passage workers miss smoking, sleeping, and I have seen arguments on the phone and in person. My life or any other child's life should not be in the hands of a person that has or still does anything I highlighted while on shift. You want me to trust the person who is asleep that they are watching out to protect my travels to school and home? These experiences bring me here with my recommendations to you. First, we need a better working system, such as workers that show 100% effort, body cameras, non-smokers, and work phones for emergencies to call police or for engagement with other workers and kids. Safe Passage could be a great and better organization if we can make a better community with it. My peers and I cannot respect the Safe Passage program if the program does not show that it deserves to be respected. Thank you for letting me have this opportunity to support every child throughout this community.
Thank you. Martez Irvin, public witness.
Good morning, Councilmember Pinto and Committee on Public Safety Justice. My name is Martez Irvin. I am a middle school student at Center City Congress Heights, a Ward 8 resident and a student who walks or takes the metro to and from school. I am here to talk about DC Connect's role and safe passage, what works for the program and what I recommend as a change for the better. What works for the program for the DC Connect program is that it assures safety. DC Connect always shows up to take kids to school and home every day. Consistently, the DC Connect buses bring you to school on time. Also, DC Connect has good bus drivers and there are no fights on DC Connect buses. My recommendations for improving this program is to ensure that the DC Connect buses receive regular maintenance to prevent them from always breaking down. Also, I strongly recommend that DC Connect needs to add seats for 3 and 4 year olds because 3 and 4 year olds presently are not allowed to ride the buses with their siblings. This blocks an entire family from being able to travel to school safely using this service. The recommendations are that they should add booster seats and use bigger vehicles to accommodate more students. Thank you for your opportunity. Thank you for the opportunity of speaking with you today.
Thank you, Mr. Irvin, and thank you all for your testimony. And Tyron, I want to commend you for your focus and attention on being such a great big brother. I think that's really, really important. And I love the ideas about making sure siblings can travel together. Do you all think that, and those of you who have siblings, that if your sibling is 3 or 4, you'd be able to help them get to where they need to go safely without an adult?
I personally think that I need an adult there so I could feel more protected because a kid like me and my younger sister, anything could happen. So that's why I think I need an adult so they could protect me.
Anyone else? One of the earlier panels, some of your classmates were talking about kind of kid-only transportation, and wondering what you all think about that.
For kid-only transportation, I think that it's a great idea towards kids because sometimes there's like consequences when it comes to like adults and kids on the same bus. But it's also kids, it's not just adults. I can't just say it's adults, but I think it's a great idea.
Okay, and maybe with kids only, still making sure, as some folks were talking about, that there is an adult present to help keep things safe and people need to get where they are on time, but in terms of other passengers. Okay, thank you. Thank you all for your testimony. I'd like to call the next panel of in-person public witnesses: Skylar Green, Emanuela Tagafo, Daniela Tagafo, Mikkel Gordon. Okay, who are we? Danielle, okay, great. Damari Lomax. All right, Skylar Green, public witness. Skylar, can you make sure to turn your microphone on, please? It's the button on the bottom. There, right, and when it lights up red, you can start again. We'll start your time over.
Good morning, Councilmember Pinto and Committee on Public Safety and Justice. My name is Skylar Green, a Ward 7 resident and 7th grade student at Center City, Congress Heights. I'm here to talk with you about safe passage and specifically the level of authority that the ambassadors hold and what's to change about it. The authority that safe passage ambassadors have isn't much and doesn't make for the overall feeling of safety and security for my peers and I. On the way to and from school, a lot of incidents such as fights and arguments happen that aren't always resolved or prevented in the first place. This is because none of the ambassadors are really allowed to do anything about these conflicts. I recommend giving them more authority by allowing them to maybe physically move, grab, or hold back anyone entertaining the use or act of violence. When school resource officers were present and more heavily involved in safe passage, we experienced fewer of these incidents of school-age violence because they were trained to intervene and not just stop and text if there was a problem. As well as being able to step into any fight or argument and physically stop it as well, we're not just looking for people to start grabbing on students and residents, but for those who can be actively preventative and hold a presence to deter the action or thought of violent and disruptive behaviors. I would just like to be able to walk with my little sister to and from school without the fear of this happening to either of us. Thank you for the opportunity to share my voice. And if you have any questions, you're welcome to ask.
Thank you, Skylar. Emanuela Tagafo, public witness.
Good morning, Councilmember Pinto and the Committee of Public Safety and Justice. My name is Emanuela Tagafo, and I'm a Center City Congress High student. I'm here to give recommendations for the city metro system as it relates to safe passage. Some problems that occur on the metro rail and buses are that too many buses are not in service, and there are many delays to people who are originally going around on the bus or train can't get where they need to be on time. Sometimes the times aren't accurate, so the buses either come late or early. Another problem is that the bus driver and the conductor let anyone on the bus and train not knowing if they have anything on them that could be a threat to others. Lastly, too many people are allowed on the buses, which causes too much crowding and congestion. I recommend adding metal detectors on the side of the doors of the bus and the metro station. We don't know the type of people who come in and out of the bus and metro that could be a threat to others and bring any sort of weapons inside that could harm others. Anybody could walk in like a normal person, but could have something on them that's harmful to people. And if somebody does have something on that makes the alarm go off, that could be a weapon. There should be 1 or 2 police officers near the metal detectors ready to pull the person aside to check if the person has a weapon. This process shouldn't take long and should be short to deal with. To make sure the alarm is just being set off by an accessory, the items must be taken off and given back to after going across. Another recommendation I have is to limit the capacity of the people who enter on the bus. When it's too crowded and nobody can just on the bus, a lot of commotion happens. People start bumping into each other, which eventually leads to arguments and then fighting. Many bystanders get caught up in the drama, which puts them at risk of getting hurt. Additionally, when it's too overcrowded on the bus, all the seats are occupied, which means that some people have to stand. Having people stand blocks the path to enter and exit, and it's also unsafe. My classmates and I have witnessed too many altercations due to overcrowding that resulted in verbal, physical, and weapons-involved altercations. All we wanted to do was get to school and home safely. Therefore, we should limit the capacity of people who enter on the bus. Thank you for the opportunity to testify and share the changes that I have that I think are suitable for improvement. I welcome your questions.
Thank you. Mikkel Gordon, public witness.
Good morning. Good morning, City Council Member Pinto on the Committee on Public Safety and Justice. My name is Mikkel Gordon. I am a student of Center City, Congress Heights. I'm here to testify about the metro system as it relates to safe passage. I ride the metro rail and bus every day from Northwest DC to school every day with my younger sister and grandmother. I've experienced so much over the years, you would not believe it. I have witnessed numerous fights and physical altercations, variable confrontations of all kinds. I have been in the front row of frustration when the buses are overcrowded, and I have been present when someone chooses to reveal a weapon on the metro bus. Metro is one of the few places where anyone can enter and exit without any questions. There are regular citizens like my family, unstable people, and violent people are all allowed on the metro without anyone knowing what they're capable of doing or what they have on them. I want all people to have the metro. I want all people to have I want all people that use the metro to be safe and have good experiences. On Monday, someone got on the bus, sat in the middle of the bus, and started rolling and smoking marijuana. The smoke and smell were everywhere. No one ever asked them to put it out because they were afraid of what someone is going to do or say in return, which is not safe and not okay. I feel like I should be testifying about how I feel and what needs to be done based on what I have experienced. I recommend that metal detectors should be added to the buses so that we can catch people who have weapons or anything harmful on them before they get on the metro. This will add an additional level of safety to this transportation system. Yes, a metro transit police officer will need to be present, but it could start on the most violent lines like the W4. Thank you for this opportunity. This is the end of my testimony. I am open to any questions.
Thank you. Damari Lomax, public witness.
Good morning. Councilmember Pinto and esteemed members of the Public Safety and Justice Committee. It's a pleasure to meet you all. My name is Damari Lomax, and I am a resident of Ward 8 and student of the Center City Public Charter School Congress Heights campus. I am here to talk about my concerns regarding the Safe Passage program. Safe Passage is supposed to make sure kids and or adults get from point A to point B safely across the street or in a different scenario. I've seen Safe Passage workers not being fully focused and distracted, having arguments on the phone and engaged in personal events. Therefore, my recommendation is for Safe Passage workers to have work phones with limited access or walkie-talkies for emergency use only. Having these type of devices forces the ambassadors to be 100% attentive to the students so that they can build and maintain trust and levels of comfort with all of the many students they serve. Thank you for the time and letting me speak or share ideas on the topic of Safe Passage. Feel free to ask any questions.
Thank you all. I'm interested in this idea about walkie-talkies. How do you think that should work best?
On the idea of walkie-talkies, I believe that they should have a radio channel for only emergency like 911 or some type of higher level or people with more authority.
Thank you. And the instances that some of you talked about on the buses, have you ever seen one of the bus drivers get involved or try to tell someone they can't bring a weapon on board or can't do drugs on board?
No, I rarely see it, and I don't see them interfere in what they're doing. So yeah, that's it.
Go ahead.
Most times, bus drivers really don't care about what goes on within the bus. They'll let anyone on. And if something were to happen, most times they're disengaged and not concerned about it.
Okay. Thank you all very much for your testimony. I'd like to call the next panel of in-person public witnesses, Lanaya Payton, Steve Park, Roger Marmette, Peter Anderson, Lanaya Payton. Okay, great. Steve Park. Okay. I don't see Roger Marmette here. Oh, yes, thank you. Peter Anderson. Okay, if you could sit here. And then Nia White. Great, thank you. Lanaya Payton, public witness.
Good morning, Councilmember Pinto on Committee Public and Safety Justice. My name is Anaja Payton, and I'm a middle school student from Center City Congress Heights campus. I am here to share my experiences regarding the Safe Passage program and its ambassadors. Not all, but most of the people in Safe Passage do not do their job well or correctly as it is intended. Ambassadors are normally on their phones, holding personal conversations, smoking during before their shift, or you just do not see them on a consistent basis. My experiences with Safe Passage so far have not been pleasant. I'm supposed to trust them with my safety and the safety of my younger siblings, but most of the times they demonstrate and model exact opposite. You cannot protect me from the problem if you're resembling the problem. One day I saw an ambassador who was distracted on her phone and not paying attention to the group of kids crossing the street. That group of students almost got hit by oncoming traffic because they were crossing against the light. Had the ambassador been paying attention, she could have let them know to wait so she could cross them across the street safely. Not many ambassadors were engaging with us like the school resource officers did, leaving a huge empty space for what once was and could be a great relationship. My suggestions are for the ambassadors to have work phones with restrictions to prevent off-task behavior and to actually hire people who know how to do their job and want to do their job well. Thank you for this opportunity to testify. Please let me know if you have any questions.
Thank you. Steve Park, Executive Director of Little Lights.
Thank you, Chairman Pinto, and to this committee. My name is Steve Park. I'm the founder and executive director of Little Lights Urban Ministries, also a current resident of Ward 6, and previously lived in Ward 8 for 18 years. Both my children are products of DC public and public charter schools, and my son will be graduating from a wonderful high school named Washington Latin, where coincidentally, Mr. Peter Anderson next to me is the head of the school. Little Lights has served under-resourced youth and families in DC for over 28 years. I started Little Lights in a lower income neighborhood where my parents, as Korean-American immigrants, ran their small business in Northwest DC. We currently work in 3 public housing communities in Ward 6 and 7, Potomac Gardens, Hopkins, and Benning Terrace. The vast majority of our youth and families we serve live in deep poverty with an average annual household income of less than $17,000 a year. Little Lights has a holistic approach to our work, providing wraparound support to students and families we serve in our community. We've had a long-term partnership with DC Housing Authority and currently have multiple spaces on public housing sites. We currently work with 250 youth ages 3 to 22. During the year, we provide individualized academic assessment and curriculum customization for our students, in addition to one-to-one tutoring and helping them with their homework. In addition to our out-of-school time programming, we offer a free 5-week day camp throughout the summer that includes recreation, art, field trips, and academic enrichment to reduce summer learning loss. We also have a one-to-one mentoring program where you spend time on weekends with a committed, caring adult. And Little Lights also provides jobs to more than 30 adults in the communities we serve, primarily residents of public housing, including our landscaping social enterprise, which is called the Clean Green Team. Additionally, 3 of our current full-time salaried staff members are alumni of our program who grew up at Potomac Gardens Public Housing. And one of the programs we're most excited about now is our new college and career program, which began in January of 2021. We currently have 70 middle, high school, and college students enrolled in the program, almost all living in public housing. In a relatively short time, we've been able to help 14 young people make it to college with little to no student debt, helping them navigate the complicated college and financial aid process. Little Lights recently has purchased a 6,000 square foot church building in Ward 7, for which we are seeking support to transform the space into a community and learning center where students and families can thrive for decades to come. So we're going to raise about $3.5 million private dollars, largely from individual donors in DC and this area and throughout the country to support DC students and families. And so we're asking for support for our project. I know it's a difficult time for the budget, but any support that the council and DC government can provide to make this center a reality would be much appreciated. And yeah, I'll take any questions that you may have. Thank you.
Great. Thank you, Mr. Park. Peter Anderson, I have you as public witness, but representing Washington Latin.
Good afternoon, Chairperson Pinto, members of the committee and committee staff. My name is Peter Anderson. I'm a Ward 5 resident, and I happen to serve as the head of schools and CEO for Washington Latin Public Charter Schools. Today, I will focus my testimony on safe passage as it relates to the work of the Deputy Mayor of Public Safety and Justice. First, I'm very glad to see the mayor's FY25 budget maintains a $9.7 million funding, for the Safe Passage program and includes additional strategy of the roving teams program, where Safe Passage worker teams will deploy to areas with short-term increases in crime. Unfortunately, Washington Latin does not have Safe Passage workers stationed near our schools because we're not located in Safe Passage priority areas. While I hope to see the Safe Passage program expanded in the future so we can have a more full-time presence at our campuses, I appreciate that the roving leaders strategy offers a more nimble, data-driven approach in the short term to help address often rapidly changing dynamics and needs. This is critically important given the increased number of safety incidents that occur near our buildings, especially in and around the Fort Totten Metro. Excuse me. I also want to see DMPSJ work to improve coordination between schools and Safe Passage CBOs. In particular, I recommend that DMPSJ play a centralized convening role and bring together key stakeholders and all DCPS and public charter school leaders at least once a year and in person so we can build relationships and proactively coordinate on safety protocols and responses to incidents. Also, I recommend that we restructure the Safe Passage CBO grant selection process to include input from school leaders. Given the current wide range of quality and safe passenger worker programming, input from school leaders will go a long way toward ensuring that awardees have trusted relationships and proven capacity to engage with school communities. Further, recommend that we share clear expectations regarding training and orientation and the scope of responsibilities of Safe Passage workers, particularly the ways in which school leaders and school support personnel can have an impact in supporting the Safe Passage worker professional development. Finally, I'd like to see DMPSJ improve how they share information about their programs, especially career opportunities. The Safe Passage program website is currently very sparse. I encourage DMPSJ to aggregate all relevant Safe Passage information in one single place. I have several alumni who are passionate about public safety and want to get involved in violence prevention and interruption work, but it is very hard to find information about what opportunities exist and where to apply. Former students with lived experiences and a connection to the community are excellent candidates for these roles, but we need the information and infrastructure to support that pathway. Thank you so much for the opportunity to testify today, and I hope that we can count on your leadership.
Thank you, Mr. Anderson. Nia White, Head of School of Center City Charter School, Congress Heights.
Good morning, Councilmember Pinto and council members of Public Safety and Justice Committee. My name is Nia White, and I'm the principal of the Congress Heights campus of Center City Public Charter Schools located in Ward 8. I appreciate the opportunity to speak here today and most importantly, to follow behind my students. As you have heard, we are very much so hurting from our school resource officers being ripped from our school communities. These women and men built strong relationships with students that I watched them use to diffuse a great deal of altercations before they became tragic or physical. Now, anyone I ask or speak to states emphatically that the Safe Passage ambassadors were not a replacement for SROs, but for my own eyes, seeing that the immediate regression of SROs starting to fade when they phased out, and the phasing in of Safe Passage ambassadors linked up a little too closely. My students and I strongly advocate for the return of school resource officers because they have an unmatched level of pride with their jobs, and that they were not able to consistently see with our Safe Passage ambassadors currently. On our route, there is one main ambassador that we see always fully active and engaged with her role and work with Safe Passage, and that is Ms. Brenda. If proper training and management were actually being executed and managed not only by the CBOs, but by the Deputy Mayor's office, there would be a streamlining of training for Safe Passage ambassadors to ensure my students, my staff, myself would not see ambassadors asleep at their posts, hanging out on the corners with their friends, or keeping a far distance between themselves and the very students that they are there to support in the first place. The best part about Safe Passage that needs more funding to expand is the DC Connect program. This is by far the best manner to solve so many issues plaguing Safe Passage overall today. We see so much overcrowding on the W4 line, which serves over 10,000 students daily, not to mention the everyday students that ride, citizens that ride that bus line. An expansion of DC Connect would help drastically alleviate the overcrowding on this particular bus line, which sees a number of violent crimes and acts from its overcrowding. DC Connect should also be a service for school-age children, which now for the city includes students in pre-K 3 and pre-K 4, allowing all school-age families to ride together instead of forcing a 3 or 4-year-old to see and experience some of the chaos that unfolds on our metro system daily is reckless and irresponsible. I know that there are approximately 70 Safe Passage ambassadors that are supposed to be in the Congress Heights priority area, and that goal has not and will not be met. I recommend that those funds clearly, those unused funds for this staffing clearly get diverted to the DC Connect program so that they can in fact expand to keep more students safe from harm, maintain a direct path to getting them to and from school, which would also have a positive impact on truancy and chronic absenteeism rates for everyone overall. I also recommend that the Safe Passage program be placed back under the Deputy Mayor of Education's umbrella. Safe Passage works well when schools are coming together to triangulate information and share practices. It works better when schools are collaborated with to determine the best approaches to help students and families understand Safe Passage aspects and details. Schools connect the Safe Passage work for students and families, and thus far, schools have been seemingly phased out of the communication and collaboration, which weakens the potential of the program even more. The Deputy Mayor's Office of Public Safety and Justice hasn't looked at this program as one that directly involves and impacts schools primarily, but as an overall crime issue, which misses the mark. The faces that you saw testifying in front of you earlier are my kids. And I expect to see them walk through the doors every day, and I can if we achieve the goals made in some of our recommendations. Thank you for allowing me to testify.
Great. Thank you all so much. And thank you for all of your work as a student and all of your work with kids. We really rely on your leadership and know that it has been a frustrating year of a lot of improvements that we need to see to support our kids getting to and from and staying in school safely. So thank you for all that you do. I'm interested in this kind of consistency piece that's come up with a number of the witnesses today of whether it's DC Connect, making sure there's a trusted adult on board, the connection with either Safe Passage or an SRO, and kind of what you think from the perspective of your school communities of having those people be more consistent as opposed to half a dozen separate programs managing different components of this.
I would say that we had consistency with the school resource officers. They were the same individuals that were in that cluster for 70 or Ward 8 that we got to interchange with on a regular basis. The Safe Passage ambassadors, it's running into a little bit of a different clip. While I understand that there's some work trying to write the people who are there, which means that some days you see someone and the next day you won't. There's a lot of fluctuation about who's there and then what they're going to do when they are there. The one constant we have has been Miss Brenda. Our students see her every day. She engages with them every day. She is one of like 8 ambassadors that we pass that is very consistent, that there is trust with, because she actually talks to and engages with the students. Everyone else, that is a miss.
You go ahead, Mr. Anderson.
So certainly we have a preference for consistency. And when we had our SROs, particularly, I would say we had a little bit more consistency about 4 or 5 years ago. And we got a chance to actually know those people. They knew our students, they knew our community, and they knew our culture. We're at a bit of a disadvantage, as I said earlier, that we are not in a Safe Passage priority area, so we don't have anyone. And so that's the reason why the roving program seems to be appealing to us. But if there was a possibility for us to have consistent support, that would be preferable.
Thank you. Any other thoughts on that? Okay. And Mr. Park, you mentioned funding for a new center. How much would that cost?
So the whole project is $4 million for our capital campaign. And so, vast majority of that will be private funding, including majority being individual donors from even across the country who are supporting DC students and families. So that's the total amount. But any amount of support from the council would be very appreciated.
Thank you. Thank you all very much. Is there anyone else who's signed up to testify who is in the chambers that has not testified in person yet? Okay. Were you all signed up as virtual witnesses initially? Okay, great. We can welcome you then to the table. And come on up. And then I'll ask that this is for the Deputy Mayor for Public Safety and Justice. Okay. Thank you. So we're doing one agency at a time. All right. Welcome. Thank you so much. Please go ahead.
Committee here. My name is Catrice Fuller. I'm a native Washingtonian, a current Ward 5 resident, a proud mom to 4 boys in the District of Columbia, ages 14, 13, 6.
Ms. Fuller, I'm so sorry to interrupt you. I just want to say thank you so much to all of our student leaders for being here to testify. It means a lot. We really, really appreciate your perspective and we'll keep it with us as we move forward. Thank you all. Keep it. I'm sorry, Ms. Fuller. Please go ahead.
No. Anything for the babies. I would like to also say that I do serve as the Chief of Family and Community Engagement at Monument Academy Public Charter School in Ward 7. So babies such as those are the reason why I'm here testifying today. I want to begin by expressing my support in the mayor's budget for the $7.2 million to maintain the DC School Connect program and the $6.5 million increase for the Aussie Special Education Transportation Program, as well as the $8.7 million to create 40 new community safety officers and fund new civilian positions within MPD to free up sworn officers for more critical tasks, which I hope can at least partially be used to hire for more school resource officers. Over the past few weeks, I have been testifying in several hearings to speak to our experience at Monument Academy and how we took our macro teachings within our school leader safety calls and convenings that we have on a school leader side and made it a more micro experience for us by connecting with our local LEAs. We are within a 2-minute walk from 4 other schools in our neighborhoods. And in the Rosedale and Kingsman Park area, we have seen an uptick in crime. Just this past week, this past Friday, 3 of my students were robbed at gunpoint walking from the school, not even 2 blocks. And if we were to have our school resource officers like we had in the past, they would have been able to intervene on the criminal aspect of that altercation versus us, even though we have convened together, Monument Academy, Blow Pierce, Public Charter School, Minor Elementary, to be our own safe passage workers, and we are not in a safe passage zone. We were very limited in that situation to intervene in the ways that we wish that we could have for our students. So I say all of that to say, as the leaders of public safety, we need you to collaborate with us to ensure the safety of our children when they travel to and from school. Because of all of what I just shared above, myself and other paid parents would like this office and the members of this committee to, 1, partner with the Office of the Student Advocate to add information on all safety opportunities, resources, LEA security contacts, and services that are available for school leaders on their respective websites. Work with DCPS and public charter schools, the DME and MPD to review the structure, re-implementation, training, and hiring of the school resource officer program together. Again, us having our school resource officers was a true blessing to us. They were a part of our school community. They attended our professional development opportunities. They even named our school pet. So it was someone that the kids within our neighborhood really trusted, and they also help them within the community. And lastly, to regularly aggregate and release public data on Safe Passage program effectiveness and usage, including but not limited to Safe Passages, Safe Blocks. It is our collective responsibility to ensure our children are safe at all times, especially when doing something as trivial as going to school is becoming a danger zone. My eldest son is a son with autism. He's going to high school next year, and I'm very concerned about him transitioning by himself. But I feel that with the help of the Deputy Mayor for Public Safety and Justice, and with mutual coordination with parents, students, school leaders, safe passage workers, and more, that we can make safe passage for all of our students a reality in our city. I thank you for your time today.
Thank you very much, Ms. Fuller, and thank you for highlighting the really important work of our SROs. We know how important these are to our school communities, and we're going to keep working and fighting to build them back up. So thank you. Thanks for being here today. I'm now going to turn to our next panel of virtual public witnesses for the Deputy Mayor for Public Safety and Justice. As a reminder for everybody, it is the tradition of this committee. We do one agency at a time. So we hear from all the public witnesses first for a particular agency and then the government witnesses. And so that's why we're sticking to the Deputy Mayor for Public Safety and Justice as our second agency for today. So I'd like to call Taisha Andrews, Dominique Moore, Sharnetta Boone-Ruffin, Nicole Walter, Michaela Deming, Bill McLeod, Natalia Otero, and Jake Emerson. Please accept your invitation to join as a panelist. All right, we can start with Taisha Andrews, parent leader from Parents Amplifying Voices in Education, or PAVE.
My apologies. I'm sorry. Give me one moment.
No problem. Take your time.
My apologies. Am trying to multitask here. However, I am prepared. Here we go. Hello, Councilmember Pinto and DC Council staff. My name is Taisha Andrews. I'm a Ward 8 resident and I serve as a PAVE citywide and Ward 8 PLE board member. I'm also a parent and my children currently attend Murray H. Plum. Thank you for being here today and holding this hearing. I want to start by saying that the $11.6 million in funding cut from the Department of Behavioral Health in the mayor's fiscal year 2025 budget needs to be given back immediately. I believe that to function to its total capacity and serve DC students, DBH needs all the funding and support it can get. Student mental health and recruiting and hiring of mental health clinicians and social emotional learning are so important. Not only do these things, when implemented correctly and continuously, make kids feel and cope better, but they also help decrease absenteeism and peer-to-peer violence. I'm testifying today to advocate for school-based mental health program funding. My advocacy for school-based mental health support stems from personal experience. As a native Washingtonian growing up, I felt high levels of stress and anxiousness, especially when in school. Despite these feelings being very apparent, visually apparent, my family, teachers, and schools did nothing to help. This is why I fight for kids in the district as a PAVE parent leader. I want all of our kids to receive the mental health support that I never did. My advocacy only grew stronger following my oldest son's high-functioning autism diagnosis. When he was first diagnosed, the specialist explained that he was reaching all his developmental milestones. However, aspects of his behavior needed to be addressed with the help of mental health professionals. Approximately 7 years later, I was told yet again that my second son was also a high-functioning autistic. While I'm fortunate that my husband and I are working alongside both my son's teachers and schools and staff to manage their behaviors, and the resources to do so are very limited. Due to the recent pandemic, mental health will continue to be the core focus for families and teachers to provide a successful educational experience for all students. Funding for mental and behavioral health services in the city needs to increase. Mental health supports come in a wide variety of ways, and all children's mental health issues are different, which means that their reactions to similar situations would be different as well. As of now, both of my children's schools do not have enough mental health clinicians or support to meet my children's needs, and my sons are two of many students in their respective schools with learning disability and IEPs. The school-based mental health supports other families' need is beyond what many of our schools can provide. This is why we need a change. Providing children and youth behavioral services is essential in the city. We must provide increased access to mental health professionals locally. PAVE conducted a 2021 fall back to school survey where we learned that 55, oh, I'm sorry, I didn't realize I was over. I had 2 paragraphs left if you want to give me 30 seconds, if possible.
Or if you can kind of summarize and wrap up would be helpful.
Okay, so back in 2021, they did a fall back to school survey where we learned that 55% of caregivers were unsatisfied with the mental health and social emotional support that DC gives their children with IEPs. And outside of that, the National Survey of Children reported that almost 50% of the children in the US had experienced at least one type of severe childhood trauma. So mental health clinicians are instrumental elements of a child's education and development. Many parents across the district and I have advocated for years about the needs for providers in DCPS because of their positive impact on students. I urge you to reconsider the budget cuts to DBH and mental health clinicians and to find a better way to expand and protect these programs. Thank you.
Thank you, Ms. Andrews. And as a reminder, if you're not testifying, if you can make sure you're on mute, please. Ms. Otero, you are, there we go. Thank you. All right, Dominique Moore, parent leader from PAVE. Okay. Sharnetta Boone Ruffin, parent leader from PAVE.
Hello, Councilmember Pinto and DC Council staff. I am Sharnetta Boone Ruffin, a Ward 8 resident, PAVE PLE citywide member. I am also a Dunbar High School Engineer Academy and Eagle Academy Public Charter School parent. First, I want to uplift several items in the mayor's budget, like the $7.2 million to maintain a DC School Connect program and a $6.5 million increase for RC Special Education Transportation Program. I fully support the $8.7 million set aside to create 40 new community safety officers, fund new civilian positions within MPD to free up sworn officers for critical tasks. I and other paid parents create few asks, many of which are budget friendly, that we want the Deputy Mayor of Public Safety and Justice to implement moving forward, such as regularly aggregate and release public data on safe passage programs, effectiveness, and usage like Safe Passage, Safe Blocks, as well as collaboration with MPD, Safe Passage Workers, WMATA PD, DCPS PD, and all public charter school leaders to convene in person for a citywide meeting to build relationships and discuss safe passage solutions. I cannot stress enough the help our students need. The crime and violence today in these in district youth is far too high. Each of us have seen and heard about the repetitive cycles about violence and about murders and about killings and things of that nature. We need it to stop. I, as well as other paid parent leaders, are looking towards the deputy mayor, who is the huge leader for the city, for the entities that we need to be done. For example, Dunbar High School has a 22-minute walk for those that live in Ward 7 and Ward 8 communities. And the reason why is because a total of 43 minutes is spent getting to and from school. So 22-minute walk is from the Mount Vernon train station to Dunbar High School. And again, I cannot stress enough about the crime and violence rate from the District of Columbia students and how it's too far and too high, and about everything that is, again, a repetitive cycle. So to avoid this, I have asked, and I will ask again, for DC Connect or a private WMATA bus to take certain students from Ward 6, 7, and 8 to high schools that are in other communities because of neighborhood beefs or turf wars, or to avoid any and all traumatic events that may happen on public transportation. This way we can indulge and allow our students to grow up with the sense of pleasancy and a sense of urgency and a sense of a community of the safety while they're going to and from school with MPD cars or with MPD presence, SRO presence, school safety passage people actually working and not smoking cigarettes or texting on their phone or arguing with family members instead of doing their jobs. So we need everybody to be on hands on deck to help alleviate a lot of the crime that is in the area. I'm here for any questions.
Thank you, Ms. Boone Ruffin. Nicole Walter, Supportive Advocacy Services Director from DC Safe.
Hi, good morning. Good morning, Chairperson Pinto and the esteemed members of the committee. My name's Nicole Walter. I'm the Supportive Advocacy Team Director at DC Safe. You'll hear from Natalia Otero a heartfelt testimony, and I stand before you with a heavy heart to address the urgent need for both ideological and fiscal commitment from the Deputy Mayor's Office and the DC Council to support the High Risk Domestic Violence Initiative, also known as the HRDVI. As the district's only 24/7 crisis intervention agency for survivors, DC Safe has been at the helm of the HRDVI for over 15 years. The HRDVI is filled with hardworking, dedicated public servants from 17 district and federal government agencies and nonprofit organizations. I can assure you from this group, it isn't being stifled by a lack of innovative ideas or commitment on the ground, but by a lack of political support from the top. Regarding the ideological commitment we're calling for, DC Safe testified on the same issue a couple months ago at the Performance Oversight hearing. To be extremely clear, we're simply asking for the city administrator to sign an updated and expanded order that governs the HRDVI. The order has not been amended in any way since it was first signed in 2009. We've already co-created the new order with the city administrator's general counsel so that we can take the next steps in collaborating on this already established district-wide response to high-risk domestic violence cases. That's all. The explicit endorsement of the administration is paramount at this point in ensuring that the participating government agencies can move forward on our collective plans to refine and improve the processes within the HRDVI. Secondly, regarding the fiscal piece of our ask, I want to be clear that we're not bringing this issue forth simply to argue for additional funds. In fact, we've been building this project with highly variable funding for 15 years, though we do make a specific request of the OVSJG every year and are currently attempting to apply for additional federal funds. However, post-2020, we've been operating in a new environment of help-seeking patterns, virtual contact, and changed needs that we've not reverted to pre-2020 baseline and likely won't for the foreseeable future. We've also seen the impact of this change in the domestic violence homicide rate. Ultimately, the pandemic forced us to take a critical look at how we as an organization and as a community are structured and what we have the capacity to provide and what we really need to be sustainable, effective, and innovative. DC Safe supports the Victim Assistance Network's ask of a $51 million baseline funding level for OVSJG, knowing that this is a leap from where the city has been in terms of what they are capable of providing to its residents from the past. We feel this is necessary to properly support the reality of our new normal. If not achievable this year, it must be a long-term goal that we commit to meeting. Additionally, we support the Victim Assistance Network's secondary ask for $21 million to support new and expanded programs. Without either or both funding asks prioritized in the fiscal year 25 budget, will continue to be both unsustainable and stagnant on our growth. I thank you for your time and attention.
Thank you, Ms. Walter. Michaela Deming, Policy Director of DC Coalition Against Domestic Violence.
Good afternoon, Chairperson Pinto, members of the committee and staff. I'm Michaela Deming, the Policy Director of the DC Coalition Against Domestic Violence. We are the federally recognized statewide coalition of domestic violence service providers here in the district. Domestic violence prevention and intervention are key to addressing community violence. DCCADV has submitted testimony on the centrality of domestic violence as both an indicator for and a cause of violence, including those that might be quick to label as a separate community violence issue, for example. We have been disappointed with the lack of coordination and cross-training of overlapping issue areas and expertise in community safety conversations. Furthermore, our district's budget does not reflect a priority for this cross-system collaboration to address violence and stop violence before it starts. We cannot fully separate and silo truancy, gun violence, homelessness, substance use, maternal mortality, and health outcomes, or a host of other issues from domestic violence. Children experiencing domestic violence in the home are more likely to be truant. People who have perpetrated domestic violence with a firearm are more likely to use those firearms in other contexts. Domestic violence is a leading cause of homelessness for single women and families in the district. Women in the U.S. are more likely to be murdered during pregnancy or soon after childbirth than to die from the 3 leading obstetric causes of maternal mortality. And Black women specifically are at a substantially higher risk of being killed by partners around pregnancy. In the brief time that we have today, I want to just highlight a couple of things for moving forward. First, we will remind you that, of course, DC does not spend local funds on domestic violence prevention. And the small amount that is administered from the federal government is done through DC Health. Second, we have referenced our training efforts with the violence interrupters that was started in the fall of 2022 and has hit a roadblock. And our goal, again, is not for violence interrupters to be domestic violence experts, but to have a greater information and understanding to identify intimate partner violence involved contexts and situations and link resources. Ultimately, these efforts must be fully embraced and incorporated into the violence interrupter training so that they have the understanding and tools necessary to identify the underlying dynamics in many violent and potentially violent relationships. DV is undeniably a key factor in solving violence in our communities, and DCCADV and our member programs like DCC have programming and expertise in domestic violence fatality and lethality, prevention and intervention, legal options for victim protections and removal of firearms, culturally specific community services, and safety planning. And as the council proceeds with structuring and funding violence prevention and intervention efforts, it is necessary that the plan truly integrate the expertise and partnership. We also support the Vance ask for $51.87 million in the victim services line and the Fair Budget Coalition's full platform, including revenue raisers, and are asking for funding for $355,000 in prevention funding. I have much more in my written testimony that I will be submitting and appreciate the time here to testify today. And I'm here to answer any questions that you might have. Thank you.
Thank you, Ms. Deming. Bill McLeod, Executive Director of the DuPont Circle Business Improvement District. Mr. McLeod, are you here? Okay, we'll come back to you. Natalia Otero, Executive Director of DC Safe. Natalia, it looks like you're off mute, but we can't hear you.
Hi, I'm sorry. Can you hear me now?
Hi, yes, we can.
Hi, I don't know if you can see me either, but I am here. Good morning, Chairperson Pinto, members of the committee. My name is Natalia Otero, and I co-founded DC Safe in 2006 with my friend Elizabeth Olds. I'm sure you know her from her advocacy on the Savor Continuum. In my tenure at DC Safe, I have personally supported thousands of survivors of domestic violence. I've ridden along with police officers as they responded to DV calls, and I have met clients at any time of day or night to place them in hotels for their own safety. I want you to know this because I want you to know that I walk the walk. I have stood next to clients in court. I have stood by families of homicide victims as they seek justice, and I have stood next to clients' hospital beds as they heal. And today I am here to stand up for them. Last time I testified before this council on this particular agency, I said that I was here to sound the alarm bells. Since then, I'm saddened to report that we have lost another person to homicide. Anisha Isaacs sounded the alarm bells herself. She did everything she could to stay safe and hold her aggressor accountable. I was so impressed by her tenacity and composure. I had the pleasure of meeting her family, and their love and support for each other and for her was overwhelming. Ms. Isaacs' family would like you to know that their daughter was a strong and brave woman who fought to the end with all she had to keep herself safe. Their daughter made sure that she had a protective order in DC, Maryland, and Virginia. Their daughter was a loving and caring young woman with a blessed and great future ahead of her. They will cherish the years and memories that they have in their hearts for her forever. I'm immensely proud of the work that we do, but it comes with a tangible toll. Her advocate, Carissa, knows her stuff. She is competent, she's smart, she's a senior advocate, and she has 20 plus years of experience. She wanted me to share with you that losing someone at such a young age is never easy, but losing someone to domestic violence makes it much harder. Domestic violence is an epidemic, and yet we don't address it until someone gets murdered. Survivors of domestic violence deserve better. They deserve to be heard, helped, and maintain their safety and dignity. We knew that Anisha Isaacs was at high risk even before the tragedy, and if we didn't do everything we possibly could to help her, then we failed her. And by we, I mean you, and I mean me too. When I sit here and I ask you for a political commitment, I am asking you to show up for all of us. I'm asking you to make a strategic investment in money, yes, But more than that, I'm asking you to listen to advocates, families, and victims themselves. Because unfortunately, hindsight is 20/20, and they leave a brutal recounting of what happened to them. I ask that you follow up with us after the hearing and try to dig into what we are asking of you and what we're seeing on the ground. So often advocates have a reputation of constantly criticizing efforts, policies, and practices and never being satisfied. That is not how we see our work. We are grateful for the partners that we have in this work, many of them district government agencies that are managed under this particular office. They work tirelessly with us and at our side. As you listen to my colleagues, try not to just think of us as coming here to ask for money, but think of us as people who have dedicated all of our brains, hearts, and souls to empathizing and dissecting these tragedies in hopes of preventing the next one. I had planned to ask for a minute of silence for Ms. Isaacs and for all others like her, but our time was cut short, and so I ask each of you listening to honor her life by supporting the work. Thank you very much.
Thank you very much, Ms. Otero, and thank you for the work that you do. I hope you and other advocates know by now that my team and I certainly honor and appreciate all of the hard work of our advocates and never view your testimony as just asking for money, but we know that you are experts and identifying the continued needs of the victims that you support.
Thank you. I can certainly vouch for that. I appreciate you.
Next, we will hear from Jake Emerson, Board Treasurer from DC Safe.
Thank you, Chairperson Pinto and esteemed members of the committee. My name is Jake Emerson, and I'm DC Safe's Board Treasurer. Professionally, I'm a Senior Vice President at Capital Bank, a community bank headquartered in Montgomery County, Maryland. I became involved with DC Safe in 2021. I participated in financing the construction of the organization's new shelter facility, which delivered last summer. Since then, I've been an avid supporter of the organization, and I was honored to join the board in 2023. I have chosen to devote a tremendous amount of my personal resources to DC Safe because of the undeniable impact of the organization has on our community. In many of DC's peer cities, the government is responsible for the services that DC Safe so excellently provides here in the district. DC Safe provides a cost savings for the district in two specific areas. First, the district is not responsible for providing direct services to domestic violence survivors. Second, DC Safe is actively preventing crimes that have a high fiscal impact on the city and its residents. For example, we estimate that a single homicide in the district from arrest to incarceration costs the government $2 million. For context, DC Safe's entire annual operating budget is approximately $7 million, and we achieve an incredible scale of impact. The following are some impressive statistics regarding our work in 2023. We effectively handled 42,840 incoming calls from public safety cluster. We provided critical intervention for 12,328 domestic violence survivors. We guided 3,759 clients through court processes. We provided 712 nights of safe shelter, and we trained 2,200 MPD officers. 70% of DC Safe's annual operating budget is funded by district grants. The primary sources are OVSJG and DHS. While that percentage may seem high, I want to reiterate that if not for DC Safe, the district would be responsible for providing these services. A primary goal of DC Safe's board is to diversify its funding sources. We have recently increased our private revenue by over 300%. However, this impressive growth has not kept pace with the demands for our services, which increased significantly during the pandemic and have not decreased post-pandemic. Unfortunately, the current level of funding we receive from the city is inadequate. The city has recently taken steps to invest significantly in crime reduction, homicide prevention, and gun control. It is concerning to DC Safe's board that domestic violence services have not been included in this modified strategy, despite it being clear that reducing domestic violence will make our community safer. Thank you for your attention, and we look forward to our continued partnership to improve public safety.
Thank you very much, Mr. Emerson. Bill McLeod, are you here? Okay. Well, I want to thank all of the witnesses on this panel for your testimony. A number of disparate and important topics, which I think exemplifies the breadth of the work that the Deputy Mayor for Public Safety and Justice's office is involved with, and the additional coordination needed, whether that is for our students and the Safe Passage program, or for OBSJG and the sexual violence work and support for victims. I want to ask you, Ms. Deming and Ms. Otero, when it comes to violence prevention and investing more dollars to this important need, what do you think the best avenues to do that are, in addition to training that is still underway? And if Ms. Deming, you can also talk to kind of the hurdles of getting that up and running with the Deputy Mayor's office.
Absolutely. I can talk about primary prevention, and then I'll kick it over to Natalia. So for primary prevention, I think that there are a number of ways that can be done. There are efforts to do increase education in schools for young people, and that can look like healthy relationships. That can look like also strategies for folks who might be thinking about using violence in their relationships and building skills to do something different and healthier to manage that in those relationships. There are also really promising practices in communities. It kind of looks like the credible messenger style programming, where you have trusted leaders in communities, especially culturally specific communities, to really talk about and expand information and awareness. And so those are some efforts that can be done. There's also home visiting programs that I know we've talked about, and the MAP program that can be expanded to include domestic violence prevention. And each of these things, I think, crosses over to different agencies and different committees. And I think that really highlights some of the core opportunities for a position like the Deputy Mayor to help bring all of those folks together. And Natalia mentioned, and I also mentioned, the connection with gun violence and community violence, and how all of that is interrelated. And so I think that these prevention efforts really bringing together the resources from those disparate agencies and council committees across government can really be influential there. And I'm sure Natalia has more to add.
Yeah, thank you, Michaela. When I'm thinking about violence prevention and homicide prevention, I think that one of the things that's really important is looking at infrastructure. So actually investing in looking at and tweaking our city's infrastructure, like how a lot of the agencies that have contact with clients and survivors of domestic violence are actually doing their work and what those interventions look like. So I would say infrastructure, sharing of information, timeliness of that, exchange of data, and then really in terms of survivors, looking at what it actually would take to have a coordinated continuum of care. So a lot of the work that we do is focused on collaborative and multidisciplinary teams that are able to share information in real time to be able to prevent further harm. I think it is also a really smart idea for the cities to start looking into alternatives to critical interventions, meaning, is there something that we can do when we know that a family is struggling with domestic violence, for example, and is calling the police many times within a month, sometimes even 20 to 30 times a month, to alleviate the violence. I question whether or not there is a more efficient way to intervene with that family, since we've already identified them, not in a situation where they're actually critically in crisis, but in a place where they can actually engage with advocates and multidisciplinary teams to resolve the underlying issues that are creating the unsafe situation, if that makes any sense. So a lot of what we're looking into really is structured. How do we do that in an effective way so that we can actually prevent these tragedies?
Thank you so much. Thank you both. That's very helpful. Okay, well, I want to thank this entire panel for being here today and the work that you do throughout the year to improve safety. Mr. McLeod, I see that you are off mute. Are you here? Okay, if you'd like to present your testimony, you can go ahead now.
Good morning, Commissioner. My name is Bill McLeod. I am the Executive Director of the DuPont Circle Business Improvement District. I want to apologize for being late. Recently, the DuPont Circle bid was awarded a Safe Commercial Corridors grant from the Office of the Deputy Mayor for Justice and Public Policy. This grant provides money for safety ambassadors and security cameras for retailers within the bid boundary. Last month, the DuPont Circle bid was able to hire 4 safety ambassadors to work from 5 p.m. to 1 a.m. through this grant. And we believe that a uniformed presence can make people feel safe in public space. While our safety ambassadors are not police officers, they are the eyes and ears of the street, sending a message that others are watching. And our safety ambassadors wear bright orange jackets, so they are highly visible. This is based on what the downtown bid did 20 years ago when the MCI Center opened. In the next few months, we will roll out a security camera program for retailers, which will be modeled after the DC Crime Camera Rebate Program. We hope to deliver $1,500 to 60 businesses around DuPont Circle to help them cover the cost of cameras and installation. Ideally, each camera will be accessible to MPD if a crime occurs and evidence is needed. I urge you to support the Safe Commercial Corridors Grant Program in the FY25 budget. This valuable program helps reduce crime in the commercial areas of DC. Safer streets encourage people to shop and dine, spending money in small businesses and generating sales tax for the DC government. Thank you for your time. And again, I apologize for being late.
Thank you very much, Mr. McLeod. And I'm so thrilled to hear the improvements that you and the businesses in the DuPont Circle bid are expecting. This is what we hope to hear when we started this as a pilot last year in the current year's budget, and why we expanded it and Secure DC to all commercial corridors in the city, because this is a really important piece of our crime fighting strategy. So thank you. Thank you for all you do. And thank you again to all of the witnesses on this panel. I'd like to call our next panel of virtual witnesses for the Deputy Mayor for Public Safety and Justice. As a reminder, again, please accept the invitation to join as a panelist. Patrick Powell, Dominique Heflin, London Ward, Darius Armwood, Antonio Nelson, Kayla Franklin, Kennedy Dudley, Terrence Jackson, Hillary Actor, and Christopher Wolf. We will start with Patrick Powell, Chief of Staff at the Golden Triangle bid. Go ahead.
Thank you, Councilmember Pinto, members of the Committee on Justice and Public Safety. My name is Pat Powell. I'm the Chief of Staff for the Golden Triangle Business Improvement District, or BID. The BID is a nonprofit established by DC law to provide a safe, clean, and vibrant environment in our neighborhood. And our overall mission is to retain the businesses that are the core of the District of Columbia's Central Business District. The Golden Triangle bid frequently hears from businesses of all sides concerning the impact on the health and safety of their employees and customers, as well as their ability to successfully operate their businesses in our neighborhood. Like many neighborhoods, the bid has seen increases in many crime categories. The district needs every tool at its disposal to address those real safety challenges and their impacts, while also increasing the perceived safety downtown. I'm happy to be testifying today in support of the Deputy Mayor of Public Safety and Justice's programs, namely the proposed expansion of the Safe Commercial Corridors Grant Program. The Golden Triangle bid is a recipient of the inaugural Safe Commercial Corridors Grant. This grant program will fund 4 safety specialists in our neighborhood. These positions will provide our businesses, workers, and visitors with a direct safety presence. These safety specialists will offer an alternative to a traditional law enforcement presence and help to fill the gaps left in police staffing in our neighborhood, which previously benefited from regular MPD business beat patrols by foot and bike officers. These officers knew our business owners and our neighborhood's specific challenges, often at the block and business level. Our safety specialists will provide a direct contact with our many restaurants and retailers on a regular basis with in-person visits to share information, provide security assessments related to lighting, camera use, tree trimming, and any other practical steps that need to be taken to create a safe and welcoming environment. All of these positions will be trained in basic first aid, CPR, Narcan use, mental health first aid, and other vitally important skills to address today's new safety challenges. Further, they will serve as a key point of contact, checking on those experiencing homelessness and connecting them to our longstanding homeless outreach team. And in closing, we look forward to continuing these strategic investments in safety, specifically in downtown, as we look to reimagine the Golden Triangle. Thank you for the opportunity to testify, and I'm happy to answer any questions you may have.
Thank you, Mr. Powell. Hillary K. Actor, public witness.
Thank you. Hi. Yes, please. Sorry, just trying to join. I didn't realize that I was the second one up. Hi, thank you so much for this opportunity. My name is Hillary Kaxer, and I want to talk about an issue which definitely comes under the purview of this committee, but it is also something which relates to agencies outside of this committee. And so I'm testifying regarding the Office of the Deputy Mayor for, I'm going to garble the name, sorry, Judiciary and Public Safety, in the hope that we can get both you, the council, this committee, and also the executive branch to facilitate interagency collaboration to address a severe unmet need and service gap which affects public safety and affects agencies under your purview directly. But I'm talking about the diagnosis. So it's a behavioral health issue, and I'm testifying at the Department of Behavioral Health Committee on Health hearing as well about this. It's hoarding disorder, right? It was defined as a diagnosis over a decade ago. It affects FEMS so badly, right? Because I have statistics here, and I'll include all this in my written testimony, but here's an article from the Firefighter Quarterly. Containing a home in a fire where hoarding is an issue can take twice as many firefighters and twice the time. And I've had wonderful interaction from our Department of Fire and Emergency Medical Services, but ultimately they cannot really provide the solution. It's likened to a situation of how many car wrecks does it take before you put in a traffic light? So I'm asking you to, as the Deputy Mayor's Office and this council, to interact with the Deputy Mayor's Office, this council committee, to figure out a way to facilitate, because frankly, in my opinion and my experience advocating on behalf of behavioral health challenges and people who live with those diagnoses, my experience is that DBH is really not providing services. Callers to the DBH Access Helpline refer out to Adult Protective Services. That's yet another committee, right? That's Anita Bonds, and I'll be testifying there too. But can we get some cohesion? And guess what? I'm not asking you, I am asking you, the government, the city, the taxpayers, us, to spend a little more money for a behavioral health service which is not being provided, but it will save countless dollars for FEMS, for adult protective services, not to mention the lives and limbs of our emergency workers. Thank you very much.
Thank you very much. And for the other witnesses on this panel, I don't see you on here, so I'm going to call your names one more time. Dominique Heflin, London Ward, Darius Armwood, Antonio Nelson, Kayla Franklin, Kennedy Dudley, Terrence Jackson, and Christopher Wolf. Welcome, Mr. Wolf. Go ahead.
Thank you very much, Chairperson Pinto, members of the committee and staff. My name is Chris Wolf, and I'm a board member at the Lillian and Albertine Fall Capitol Jewish Museum located in Capitol Crossing downtown. I'm also a proud resident of Ward 3. Thanks very much for the opportunity to testify. The Capitol Jewish Museum opened in June 2023 to great acclaim, with a mission centered on exploring the Jewish experience in the nation's capital and inspiring personal and collective connection, reflection, and action. The museum has swiftly attracted residents and tourists alike. The museum is still in its first year of operation and is working diligently with the museum's board, community leaders, and stakeholders to establish itself. And of all the operational costs we have, security is a paramount concern. Ensuring the safety of individuals who enter our premises is a serious duty. While many organizations face similar challenges, the Capitol Jewish Museum's identity as a Jewish institution located mere blocks from the National Mall, with the word Jewish prominently displayed in the name and on exterior fixtures, make these challenges very real. Further, in light of growing anti-Semitism in society today, the museum is a target for extremism and hate groups. Sadly, the museum has had to hire additional guards, off-duty police officers, and even bomb-sniffing dogs for certain events to ensure the safety of its attendees. Maintaining the safety and security of our visitors is a paramount concern, yet it means that operational dollars are being directed towards the significant security expense instead of mission fulfillment. This is not a sustainable arrangement. We urge the committee to consider the safety concerns and needs of the Capitol Jewish Museum when working through the budget, and if the council can invest $500,000 in the Capitol Jewish Museum for its operational costs to be put towards security personnel, the district would be supporting the continuity of the museum as a newly opened downtown attraction and as an important cultural institution. Considering the district's persistent efforts to combat crime and rejuvenate downtown, we firmly believe that investing in the museum in this way aligns seamlessly with the mayor and council's priorities for FY25. Such an investment not only enhances the safety of our residents and visitors, but also contributes to the economic growth of downtown organizations. Thanks for the opportunity to testify, and I'm happy to answer any questions you may have.
Thank you so much, Mr. Wolf. And I must say I am a huge fan of the museum. I think I was there for the day the building was moved down the street, for the day the concrete was laid, for the groundbreaking, for the exhibit opening. So I am a huge supporter of what you are trying to accomplish there with the museum. And as we think about these safety grants, I share your frustration, although you didn't present it that way, of the need to have a greater level of security for our religious institutions and community organizations. And I'm wondering if you have had any experience in applications with HCMA, and if you think that an expansion of the existing grants are the best vehicle to apply for that, or if you think it should be a separate grant pot.
Sadly, I'm not all that familiar with those details, but I can get you a response to your question, Councilmember Pinto. Delighted you visited us. Thank you for being there at every stage of our growth. We hope you'll come back along with other council members, and thank you for appreciating our security needs as well.
Absolutely. Thank you, Mr. Wolf. And Mr. Powell, I want to ask you, as part of the inaugural class of safety grants, how you envision the coordination component of the grants working in practice with the people doing the work, with their relationship with the bid, and how ultimately that relationship is streamlined through the deputy mayor's office.
Yeah. Yeah, I think we're in a very good position based on our programming. We've had a safety and security program for the last 17 years. So we have an operations center, and all of our safety specialists will report back through our operations center. They'll be connected by GPS enabled radios. They'll have smart tablets for gathering information, for keeping statistics on their day's activities. We have 2 in-house safety and security positions that can help us coordinate with MPD, coordinate with the Real-Time Crime Center, coordinate with other district agencies. And so I think our primary mechanism will be working everything through our operations center, which can connect to our homeless outreach team or our cleaning ambassadors, or connect to those safety specialists.
Okay, thank you so much. And is that right? You said you'll be able to hire 4 individuals?
Yes, ma'am. We'll be able to hire 4, and the first 3 actually started today.
Wow, congratulations. We're thrilled to hear that.
Thank you.
How did you find the application process for that grant out of the deputy mayor's office?
I think the application process, I think it was helped by our history and having that kind of expertise in-house. I think it may have been challenging for smaller organizations, but it was a very detailed application process.
Okay, great. Well, thank you very much, and congratulations again for receiving the grant and for the new specialist starting today. We look forward to supporting their work. Thank you to all of the panelists on this panel for your testimony and for all of the public witnesses today. We really appreciate hearing your perspective. And I especially want to thank our students who showed up today in force to share their desires for a safe travel experience to and from school and while they're in school, and want you to know how seriously we take your concerns and appreciate your perspective. Thank you very much. We are now going to turn to our government witness, Deputy Mayor for Public Safety and Justice, Lindsay Appiah. Welcome. And back again. That's right. And Deputy Mayor, if you have anyone on your team who will be testifying or answering questions, can I ask that you please share your name and your position for the record? Make sure to turn your microphone on. We can start with you.
John, it's Agency Fiscal Officer for DMPSJ.
Thank you.
Hey, good afternoon. Nicole Peckham, Chief of Staff for Deputy Mayor Lindsay Appiah.
Great. Thank you both. Welcome, and welcome, Deputy Mayor. Deputy Mayor knows the drill.
First, nor 5th, nor 10th.
That's right. It is the tradition of this committee to swear in all government witnesses who appear before it. So I'll ask you to turn your microphone on. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Yes, I do.
Thank you. Well, welcome. And now, Deputy Mayor, I'd like to invite you to make any opening statement you may have.
Good afternoon, Chairperson Pinto, members and staff of the Committee on the Judiciary and Public Safety. I'm Lindsay Appiah, Deputy Mayor for Public Safety and Justice, and I'm testifying today on Mayor Muriel Bowser's proposed fiscal year 2025 budget and financial plan, a fair shot, strategic investments, and shared sacrifice. In building the FY25 Fair Shot budget, we were guided by our values, protecting core city services and preserving programs that protect the health and safety of our community, prioritizing programs that focus on equity and have a track record of success, and investing in the pillars of long-term growth so that we can change the trajectory of our out-year revenue estimates. The Office of the Deputy Mayor for Public Safety and Justice, DMPSJ, provides oversight of 12 district agencies in the DC National Guard to ensure they are efficiently and effectively meeting their core critical agency mission and functions, working together across our government to advance public safety and justice priorities, and coordinating with our local, regional, and federal partners to enhance the safety of our city. The missions of the agencies of the Public Safety and Justice Cluster are dynamic, complex, yet interconnected. Each plays a critical role in the overall health and functioning of our public safety and justice ecosystem, which is centered around prevention and intervention and enforcement, accountability, and rehabilitation. PSJ agencies remain intentional by focusing on their basics. They were asked to be engaged, efficient, and effective at their core functions because our residents and visitors rightfully expect us to be excellent in these areas. Under my leadership and with the mayor's proposed fiscal year 25 budget, DMPSJ will continue to implement a framework focused on the necessary policies, partnerships, and policing to support crime reduction and the enhancement of the safety of our residents and visitors. This work requires cross-cluster interventions and whole-of-government coordination and strategies. DMPSJ remains committed to prioritizing coordination, collaboration, and transparency necessary to meet our residents' reasonable expectations of excellence in the delivery of our agency missions. DMPSJ provides operational and strategic support to agencies within our cluster and across government to reduce crime, Mayor Bowser's #1 priority. We are currently offering strategic and operational support through the day-to-day management of the Safe Commercial Corridors Grant Program, Safe Passage Safe Blocks, Multi-Agency Nightlife Task Force, Multi-Agency Public Safety Task Force, Safety Go Team activations, resource pop-ups, peace walks, public safety walks, and more. The mayor's proposed FY25 budget for DMPSJ is $15,548,000, which includes 26 FTEs. An overwhelming majority of DMPSJ's proposed fiscal year 25 budget is non-personnel services funding that includes $9.7 million for the Safe Passage Safe Blocks program and $2.3 million for Safe Commercial Corridors Grant Program. Safe Passage is designed to ensure students travel to and from school safely. A lack of safety increases absenteeism and impacts the students' overall learning. The Safe Commercial Corridors Grant Program is designed to promote public safety and public health through evidence-based activities for residents, workers, and visitors. In fiscal year 24, DMPSJ assumed operational management of the Safe Passage Safe Blocks program from the Office of the Deputy Mayor for Education. My team coordinates and manages the program, including the evaluation of its effectiveness and measuring outcomes. Through distribution of community grants, providers currently serve 8 priority areas that includes approximately 50 sites. In fiscal year 24, the Safe Passage Safe Blocks funding was a combination of one-time ARPA funding and local dollars. The fiscal year 25 budget reflects that the program will now be 100% funded from local dollars and adds roving teams to the Safe Passage portfolio. Roving teams will provide coverage in neighborhoods experiencing acute, short-term increases in crime that require targeted attention but do not warrant coverage for the entire school year. These teams can also support high-profile school events such as football and basketball games and coverage when needed outside metro stations. As with the transition of Safe Passage to DMPSJ, the executive continues to examine operations and programs to ensure a cohesive, coordinated continuum of prevention services and supports under the umbrella of PSJ. It's with that commitment to cohesive, coordinated services and supports that the fiscal year 25 budget transfers the Office of Neighborhood Safety and Engagement's Leadership Academy to DMPSJ. I'm confident in my team's ability to absorb this program and work with our education partners to assess the program outcomes and determine its best placement within the district's continuum of services. The transition of this school-based initiative to DMPSJ allows ONES to focus on its core missions, reducing shootings in the district by becoming excellent at coordinating violence intervention, managing the Pathways program, and providing critical family support services to those immediately impacted by gun violence. In addition to the investments in DMPSJ, public safety and justice highlights in the mayor's fiscal year 25 budget include maintaining a strong MPD by investing $8.7 million to add 40 new community safety officers and hire civilians to free up police officers for critical crime fighting tasks, supporting rehabilitation and reentry by adding $3.1 million staffing capacity at the Department of Youth Rehabilitation Services, creating public safety career pathways with $841,000 to continue the development of DC's paramedic school and $637,000 to support peer navigators for returning citizens. Preserving investments in prevention by maintaining $12.5 million for the violence interrupters and pathways programs and $11.7 million to continue SAVRA and victim services supports. and improving readiness, response, and resilience by investing $3.2 million for latent fingerprinting, drug and DNA sample testing, $358,000 for staffing and retention incentives to cover crime scene response, and $4.8 million for life-saving equipment for fire and EMS personnel. Finally, I want to thank the more than 10,000 public safety servants working in our cluster agencies that are dedicated and committing to improving the quality of life in our district neighborhoods. We recognize the tremendous work being done across the ecosystem to make reductions in crime a reality, and thank all of those who are working extremely hard to make our city safer and stronger. As of April 9th, 2024, homicides down 28%, assaults with dangerous weapons are down 31%, and total violent crime is down 22%. We remain committed to making our city one in which residents and visitors across all 8 wards can flourish and thrive. And Mayor Bowser's fiscal year 25 budget makes the right investments to support our agencies in this collective effort. Thank you for your time. I'll answer any questions you may have.
Great. Thank you so much, Deputy Mayor Apia, and thank you to your team who is here and continues to show up to these hearings, and to the many, many folks who work in your cluster agencies very hard to focus on what I believe is the biggest challenge facing our city right now, which is around public safety. And congratulations on the reductions in crime. That is certainly welcomed news to residents, and we look forward to continuing to work together to drive those down. So over the last year, we have had a effective partnership in focusing in large part on some of the legislative guardrails that need to be put in place to advance a system of safety and justice in the city more effectively. And so now that that legislation is passed in Secure DC, what is next? What are you thinking as the next most important area of your time and attention and focus to drive crime down?
So I think it's been sort of a both and. At the same time as we were making adjustments last year in policy, we had a lot of changes within the cluster. And so it was important to get, we still have a little work to do, but get stable leadership into place. We had a lot of agencies that had new leaders, from a new police chief to a new head of OUC to new leadership at DFS to now, continue to work on ones and HCMA. So really getting that framework in place. You heard me talk a lot about back to basics, and I think that's still critically important. The conversation that we're having is, I said it before, you provide oversight to our agencies, and our agencies need to be excellent. So our next work is making sure that in a tough fiscal budget year, or in any year, that we're being efficient with our resources, and also really looking at, for sustainability, what programs really are working. There's the core functions of agencies, which we talked about, the mayor's investing in the budget, the things that have to happen. And then there's a host of things that I've been in other jurisdictions this year. We're very, very fortunate in the district to have so many different programs, but we also have an opportunity now, as in this year and beyond, to work together to look at what are the outcomes. We can love a program, I say, but are we getting the outcomes, both in the short term and maybe in a long term, that we really need to continue to make the city safer? So I think that's our work together, really the expectation of, and I said transparency is one of the pillars here. I believe that in making sure that we're putting out and providing to you and to the public data that supports why we're doing what we're doing.
Okay, thank you. And as you think about the distinction between agencies being responsible for determining and laying out their own efficacy versus the deputy mayor's office for leading that work, as your agency budget is increasing, the proposal this year. And so how do you think about that balance between agency responsibility versus your office responsibility?
Sure. So there's the pieces where there's a lot of interagency and intercluster coordination that my office is responsible for. And that sometimes that may involve one of our individual agencies taking the lead, but oftentimes to work across cluster, we use juvenile crime as an issue, right? The DYRS is involved, MPD are involved, but there's a whole host of other agencies that really have to be involved in the conversation and operationally in order for us to drive down juvenile crime. It is my responsibility, my office's responsibility to serve as the coordinator and honestly, the continued convener and really the coach and the cheerleader and the sometimes taskmaster, right? Like whatever it takes to make sure that we're continuing to move effectively in those kind of larger systemic issues that take more than just one of my single or a couple of PSJ specific agencies. That is a function. And I think that's really evident too in like a safe passage or which was about continuum, making sure that we have a continuum that's all in PSJ, because coordination in a cluster is it is easier than across. But there's the both and of coordinating within the cluster and my office making sure that's happening and across government. The other piece you asked on setting kind of data points and how we determine, we did last year. Agencies have KPIs, right? They have key performance indicators they must meet. They also, and some of them like a fire EMS will be in here later, those are set by national standards, right? Like you must respond to fires in this amount of time, right? OUC, you must respond, or how often are you responding to 911 calls in 15 seconds? PSJ agencies have a lot of those like that. Then there are ones which are maybe more expectational of DC residents, right? Like, do you go to ANCs? Are you engaging with community? There are ones they themselves set. I talk with all of my directors about strategic priorities over the arc of time and really working with them to set those. And then there are expectations, that I might set based upon what research of other jurisdictions and national standards. So really we fold all of those into a reasonable amount so that they're not trying to meet kind of a crazy amount of metrics they never really can. So.
Okay, thank you for that context. So let's talk about Safe Passage, because this was the first year that the program was transitioned out of the Deputy Mayor for Education's portfolio. And we heard from a lot of public witnesses, both at the performance oversight hearing of DMPSJ, but also today at the budget hearing, and particularly from young people themselves talking about really what I'd summarize as their desire to have trusted adults who they can depend on, who are there for them and who are paying attention. And so how has the transition been going, and how does this budget put Safe Passage in a position that it can continue growing and expanding and supporting our school communities in a greater way?
So I think that any transition is like a work in progress. So, I mean, if I say good, you heard a bunch of people who are like, there are things we can do better. And so I always start at the outset and say, that's extremely valuable to us. Right now, what we have is about 180 Safe Passage workers, which is a relatively large program, right? So one of the things that we really worked this year, and you just heard me talk about it with our agencies, it's true of any program we run on infrastructure. And it's taken some time. We brought on Ciara Savoy, who was over at OVSJG, to really help us build a good grant structure internally, and also really with monitoring, because she had done monitoring for OVSJG's truancy program, and also had been a behavior tech for DCPS. So has a lot of familiarity in the space, but it took a little time, right? Like sort of for her to get her footing. We worked on SOPs, which, I'll be honest, the organizations weren't quite used to. Many of them have worked on the 2 previous years, but getting used to the fact that no, like these really are, we really do mean it, to be honest. Like, it's not just things that we've written, but that we are going to monitor and expect you to hold the workers accountable as well, taking a little time. But I think we're slowly but surely getting there. Like we just recently started having meetings, because we hear the communication piece. I met with a group of, with PAVE, with a group of like CEOs and people from the charter schools, and whether it's charter schools or DCPS, communication is a huge piece. So we've started these now monthly meetings with MPD, the Safe Passage folks, and principals, because there may be someone on the ground who like communicates with a Safe Passage worker, but we want to make sure that those in leadership really understand what's going on. And so I think that's kind of like, I feel like we have a framework in terms of SOPs and how we monitor the grants, but there's the operational pieces that we are continuing to look how to grow in. We've talked a lot with HCMA, who does a lot of coordination, about how we can build a framework of communication with our charter section, because there's so many more of them that it's always going to be more of a challenge than with DCPS. So that's kind of something we're working on. Is there a technology solution that we already have? Because they do alerting and things like that with HCMA that we can utilize to have better communication across. We've talked, when I met with them, we talked about training. What the school leaders said to me is, listen, put some responsibilities on us, because that's part of it is, well, instead of you trying to build trainings on social emotional learning and things that we've been trying to do, they're like, we have that. And it would help us integrate the workers into the school in a better and more cohesive fashion. If you said, please provide 6 hours of social emotional training to your cohort of safe passage workers. So there's that piece. And then there's the work we have to do on accountability. I heard people talk about when you have 200 people, nearly 200 people, there are going to be challenges, right? Like we do background checks, we do all of those things, but we also have to continue to do that ongoing, right? Like drug testing, and we do site visits, but continuing to grow in our ability to do pop-ups and spot checks and things that ensure that people are where they are. We do, and I'm talking a lot, but just so you know, like we did have to do training on, you can be caring, you can want to do this work, but we realized after doing sort of observations, not all of the safe passage workers know how to interact with kids. They just don't. And we were like, we need to do some work on some training to teach them how to interact, which is why we even talk about a continuum, right? That somewhat safe passage is the onboarding ramp in our prevention space, right? And then there's VIs. Then there's transformative mentors of credible messengers. Then there's those who can mediate disputes, because it takes time and like some growth and learning to do that. So that's some of the work that we've really been doing.
Okay. Well, thank you. And I appreciate the kind of complicated nature of this work, but those ideas are going to cost money, training, technology improvements, and it looks like the budget for safe passage is decreasing. So how are we, am I reading that wrong?
Yeah. So it actually increased. So it was not, I don't know what it was.
9.7.
I think it's 9.7 proposed, which is an increase of about, I think, $600,000 for this next fiscal year. We had money for training and all of those things this year. That really was built into but the additional 600 that was added, and we're really grateful. Like this is when people ask what's the right amount. Well, I feel very fortunate in this seat that leadership, including the mayor, really listens to what we say. So we said we need roving teams, right? Because one of the things is, we do data on what schools should be a part of the cohort, right? How incidents, sounds of gunshot, actual incidents in and around schools, and that's how we choose them. But sometimes I said this before, there are things happen. We know there's a lot going on in the Fort Totten Metro right now, or Brooklyn Metro, that are making young people feel unsafe. And it's not sustained, but it is enough where if we had a team for a short term or an acute intervention, that would allow us to help maybe bring down some of the temperature in some of those areas and address, hey, is there something going on where kids are fighting here? So the 600,000 will allow us to actually bring on roving teams, which are not location specific like the rest of the teams are, which part of safe passages is building relationship, which is why we do want people to be location specific. You can't build relationship if they're always like jumping around. But this team is like, hey, Potomac, there's things going on at Eastern Market. Digital Pioneers is letting us know that kids are congregating at Eastern Market and something's off. Let's put some people at Eastern Market for a bit so we can see what's going on, even though it's not sustained. It's not by data an area where we have sustained amounts of incidents.
Have we grown too disparate in the different programs and CBOs that we're working with? Like, just in thinking about even Metro Transit Police and their role on keeping people safe on their way to school, keeping kids safe, SROs, safe passage workers, roving leaders, VI, which we talked about last week. Like, how are we thinking about in this budget, not necessarily streamlining everything and collapsing it into one program, but using the lessons learned that we have from those various groups and recognizing that there are a lot of benefits I imagine, from some shared infrastructure
Yeah.
and communication.
So I think, I don't know that we've grown too large because you hear like the need is a lot, like, and how people feel is just as important as the practicals of, well, you know, like maybe there aren't really incidents there that warrant it. I think, you know, I'm always looking for efficiencies, which is why so much of this is in PSJ. But I do tell people, yesterday, the chief and I did, you know, in the announcing of an arrest in the homicide, the terrible homicide of Avion at Brooklyn Metro, that people don't understand. They even asked the chief, why aren't you on the Metro? Right? Like, and when I go to middle schools, I went to a Kramer, they're like, would you please put more safe passage people on the bus? Places where you're like, well, that isn't technically right. Like, but we do need this network of people, because if we can have more people kind of, maybe we do put people near, right? Like we did this at one point when there was the shooting in the Potomac Metro last year, right? We put people near the Potomac Avenue Metro to free up the police resources and Metro Transit to be able to really be in the Metro and otherwise. So the goal is yes, we need to be careful to not just like add more bodies all the time, right? More people, that, because that's untenable and not sustainable. But what we've really worked on is modes of communication. So every day we have a law enforcement call at 1 o'clock. That includes Metro Transit, DCPS police. I say that terribly, but yes, DCPS police and their head of security and MPD and safe passage, right? So because we're like, hey, what happened in the morning? Do we need to move resources this afternoon, right? Are there things going on that are police issues that the safe passage workers have identified that need to be addressed in that way? So I'm always going to say we should start with like communication and then see. I don't always, I think that like there's an experience of, I don't always propose just growing programs, because that always is, sometimes you're not dealing with the issue.
And let me just say, to be very clear,
Yeah.
I support these programs. I do not think we have too many bodies in them. My question is just about the streamlining of the working together pieces,
Yeah.
because that continues to seem as a gap.
I don't know if I would say that there isn't necessarily a gap. I would say there's a lot going on. That sometimes when you hear about sort of gaps, it's often, well, that isn't a safe passage location. So when people are like, well, why didn't safe passage communicate with the school or otherwise? Sometimes it's actually a knowledge issue versus a communication issue, because the level of communication that there is between Metro Transit, MPD, and safe passage is actually really high and constant. And I think if you, Chief Wright, who oversees the youth engagement the Youth and Family Engagement Bureau, would say that. Like, that's why we started the joint meetings with MPD with schools, so they understand all of that's happening throughout the day, to make sure that we're covering as much as possible and communicating and using those resources properly, right? Like safe passage isn't police. We might need police there, right? Like safe passages is and can take this so you guys can go down in the Metro. We can take this spot, right? Like,
Okay. I just have one more question on this, and then I'll turn to my colleague, Councilmember Lewis George, who's joined us. As this budget contemplates adding 40 new community safety specialists.
community safety ambassadors. They say officers, but they're community safety ambassadors.
Thank you.
Yeah.
Community safety ambassadors. One of the reasons that I am so excited about this proposal is, over the last several years, I hear from officers all the time of the amount of time it takes them to do paperwork or answering calls or writing reports that really can be supported by civilian functions.
Yep.
But are you contemplating any involvement between these ambassadors with the current safe passage workers or other programs that you manage?
100%. So one of the things that, because with the drawdown that had occurred was the school safety division, obviously we don't have as many SROs. And so one of the decisions that was made to expand that footprint was to take the community outreach officers from each district and add them to that complement. So they really are supporting the SROs, the community outreach officers. I believe that, and we believe that our community safety ambassadors can also help to expand that footprint as well, because we have a model with those community outreach officers where it's not necessarily specific police work that they're doing. And oftentimes that isn't necessarily even what the SRO is doing. It's a relationship building where you're like, they're not responding to a call. So 100% we believe that this is another layer of folks who will be trained in community engagement that can help us really cover down, and particularly where you hear so many schools wanting SROs, like working to cover all of the needs that we have. So I absolutely.
In the working to cover conversation, are you thinking about expanding the scope of safe passage kind of geography to accommodate some of what we continue to hear from kids of the entire route feeling unsafe for many of our students?
So what we try to do is, like, we did maps. So if you go to the Safe Passage website, we did mapping, and that took a little bit of time this year, literally walking with school leaders and Safe Passage workers to determine where on routes, like what are problem spots, where are areas where they need to be. And so, like, I would love to have people everywhere, but what I said, and like, this may be unpopular, is PAVE asked, I said, we welcome churches and, people who want to volunteer. There's so many people who want to be engaged to help us. We'll never be able to have, as a government, like, we're talking about a $9.7 million program. We would love to have all of the financial resources in the world to grow it. But you hear me talk a lot about partnership. Well, yes, if we're able to expand through, like, looking at how many we have, but I'm also looking to expand by really you said people want caring adults. There are caring adults in a lot of spaces who want to help. PAVE parents, right? Who are like, you're right. We can help walk kids to school here because that the kids need a feeling of safety from a caring adult. And we can do joint trainings of the chief has her faith network of faith leaders of all denomination, others who are like, you know what, that is something we can do. And everyone's asking what we can do. So I would say that growing our network looks like, yes, looking at how we can use our dollars, how we can stretch our dollars, but also growing our network of people who just might be like, I can be there for 2 hours in the afternoon right here to make sure that kids feel safe.
Thank you. I'm now going to turn to my Ward 4 colleague, Councilmember Janice Lewis-George, for a 15-minute round.
Thank you so much. I'll just start off where you were. We did start some of that work in Ward 4. We have a program called Let's Get Feet on the Street.
Yeah.
Julie Lawson, the PTOs at Coolidge High School, Ida B. Wells, and Whittier came together and said, we're going to have a Feet on the Street program weekdays. And they go out between 8 and 10 a.m. and 3 and 5 p.m. And this is just parents who have decided, and neighborhood community members who've decided to volunteer themselves to assist, add to additional. This is an area where we do have the Safe Passage program, but we needed to cover more ground because students walk all the way to Tacoma Station and then all the way to the schools at hand. And then we have students who go through North Capitol from the other side. And we also, in addition to those schools, have Capital City Charter School, who also said, we actually want to be in on this. So it's really a partnership between both. In that regard, I want to help those organizations who, those parent-teacher organizations who want to step up and do that kind of work like we're doing here. What are you all thinking about? Sort of, it came around informally. It's now sort of formal. It sounds like you all are willing to
100%.
support those organizations who are doing that. And so I wanted to just hear about how we can connect those parent-teacher organizations with your office and who they should connect with to get the further support that they want to do to volunteer here.
So I'll have Nicole connect with your office because, like, I get really excited about that because we often talk about the district is a local city, right? Like, so when I was coming up, you went to a neighborhood school and a parent or somebody would take turns walking kids to school, right? And so I'm like, yeah, we can do that here. And so, yes, we would love to, I think what I said to our charter schools is let's do joint training. Like, we'll pay for the training or we'll come up with a schedule so that people feel empowered. We'll make sure that whoever their like head or otherwise is linked into like our site leads and otherwise, so they're getting information, whether you're paid or volunteering, like we can find ways to communicate, cross-train, and we would love to do that.
Okay, great. We'll do that. So we can make that connection. They even got vests. We gave them vests and everything.
Hey, everybody, vests for all.
They're purple, obviously, but
we will have a rainbow or vest. Right now we've got green and blue. Let's add purple.
We ordered some purple ones.
We have our community safety people down with red down in Chinatown.
That's right. The vests are the colors are there. I wanted to ask, so, there's a request throughout the city. I am sure your office gets them all. Everybody wants safe passage programming.
That's right.
Our Ward 4 has two safe passage areas where we have a large amount of schools in both of those areas. My first question is, will the Ward 4 safe passage programs be sustained? Are they sustained in this budget?
Yes.
Okay, great. Now you all have the Leadership Academy.
Yes.
And as you know, last year I put
McFarland.
money in for the McFarland Leadership Academy. I just want to know, I know there's been a change of offices, but I wanted to just make sure that program just got started up and
yes.
running. And so
Yep.
I just want to make sure the One's Leadership Academy that's been established now at McFarland, I'm grateful for your office's work on that. It's something that will be sustained in this budget as well.
Yes.
Great. I want to, as we talk about safe passage, yesterday we were contacted about a constituent about an incident that happened at McFarland Middle School that led out where one child was jumped while on school grounds by 8 boys, they said, and that this occurred in front of MPD officers, and it also occurred in front of safe passage officers. And the principal is the one who had to break up the fight, and no one else assisted him in breaking up the fight. So Principal Cook apparently stepped in. Parents end up calling police. And so the police who were on scene got out the car and the ones who came. And so I guess how I want to know sort of how are safe passage workers and MPD officers trained to respond when they witness an incident like the one described?
Yeah, so what we say to them, and they get de-escalation training and engagement training, things like that. But we also are careful they're not police. And there is a line where it's somewhat of a judgment call, because some safe passage workers will really jump in there. And we recognize there's a duality. Young people can have weapons, which we know. Young people, situations there can incur liability if someone gets injured. And also that's not their role necessarily to fully be in there. And we have some who do. So it's hard, right? Because there is a line and a judgment call of like, can you de-escalate this? And if not, well, they are supposed to then immediately, like we have basically chats that give them direct access to leadership, to safe passage leadership, MPD, right? To be like, there's a problem here.
Okay.
And so when it comes to MPD, I mean, I certainly can't say about police training, but I would want to look into what happened in that incident.
Yeah.
Specifically, because MPD certainly does intervene and is there when there's assaultive behavior going on to intervene. So I'm happy to find out more, and I'm sure that Commander Lavenhouse has an expectation that.
Yeah, we honestly got it yesterday, and the parents were like, no one did anything. Can you add? And I said, yeah, I actually have a meeting with Deputy Mayor. It's not a meeting, it's an oversight hearing, but I'll ask her.
Yep.
As far as provider organizations, are we seeing, one thing we used to see in the past was sort of retention of workers within the partnering organizations. What are we seeing as far as retention of, say, passage workers within partnering organizations? Has that retention been, is it sustained at this point?
Yeah, by and large, we've been pretty good. There's always going to be some, like people get other jobs or otherwise, but we've been pretty steady. We haven't seen like that kind of jumping around from organization to organization. And some of that, I will say, like we worked this year on looking at pay scale and trying to standardize a little bit more of the pay scale amongst them.
Yeah, that was my next question.
Right? Because that was part of it. If they're paying $25 and they're paying $20, you're going to go over there because it's the same type of work. And so there is some flexibility within that the agencies had, but it was originally we were like, this is the range, right? Because we really do understand that across the continuum, one of the things that I've said is that we look at violence interruption or prevention work as a continuum, and we want to create pathways for people, which means you got to standardize pay amongst safe passage workers, VIs, credible messengers by position. And so it's a process, but that's helping retention some, because it's like, okay, there's a path.
Right. Okay. I believe in these programs wholeheartedly, and I want them to not only be sustained, but I want them to thrive, and I want the community to believe in them. And I don't believe the answer to this is, well, we heard that the safe passage workers were, texting on their phone and not doing anything, and so we don't need this program. No, the answer to that is better quality checks, better supervision, better training to make this work, because we're going to need all hands on deck. And so as we look forward, I think what my ask is just sort of as overall providers, that we do our due diligence to make sure providers are providing that training, providing that de-escalation, ensuring that they have quality people who are doing the job. And you all do some oversight of that by like doing pop-ins and check-ins.
Yeah, we are. So we are doing site visits and like and unannounced and
I was gonna say unannounced.
Right.
That's the best
Like
way to
just
do it.
popping up. But the other thing too, I would say is like, while I believe in our CBOs are partners, we did have to, it shouldn't be so inconsistent amongst CBOs because they're given so much autonomy to decide training and all of that. So by taking over oversight, we really have taken some of the, like, these are the trainings that will be provided.
Great.
And they can add if they want to or not, but I'm just letting you know, it's not that same where it's like the CBOs decide all the training. We can't have that. Like, that's an extra, but the basics of what everyone really must have, and monthly training requirements. During spring break, we have a whole host of, because it's a good week to do it, like a series of trainings over spring break for all of our safe passage workers, things like that.
Okay, so great. So you all are doing some of that training work
Yes.
over spring break and over different times periods.
Yes.
Great. And then as far as communication goes, what areas of improvement have we talked about this last year, improving the conversation between safe passage workers and the, assistant principals and the principals of the school, making sure that relationship is there and that they have somebody who they can connect with. What progress have we made on those things?
Yeah, so again, like I keep talking about standardization of expectation, but that really was part of it, is like some people decided who they talk to. They might talk to a like tech or like, you know what I mean? Like whoever they see on the street. So we really have tried to put in more formalized meetings and really saw, okay, next year we'll be better at this, right? Of the introduction meeting right at the beginning of all of the safe passage workers, right? Not just the supervisors, with the principals.
Okay.
The principals might not, some of them, when you meet with them, will be like, oh, I know my safe passage workers, right? Like I know them, I'm on the street with them, but some of them are like, I really don't. And so making sure that that happens. But we also, like I said, have set up a requirement of monthly meetings, right? Like with principal or designee, they can decide. They have to decide, who's doing that with safe passage leadership and MPD. And then there's just, we get a lot of, so Jasmine from my office is the operational lead, whereas Ciata also is the administrative lead. And we hear a lot from principals, right? Like if there's an issue or not, because we want to be able to address things on the spot where they can communicate with us. There's a safe passage email if things are going wrong. So we wanted lots of channels for both regular routinized communication, and then there's an issue, this is where you go and we'll get it addressed. Yeah.
Okay. It sounds like to the answer of expansion of safe passage, because every neighborhood, everybody's going to want a safe passage. What is going into your decision process for expansion versus, sustain?
I mean, it still has to be incidents. Like we still have to look at where is the most, like we still have some schools that have sustained amount of incidents around, right? And that's a reality. And like any amount for most people is too much, right? And is concerning. And so we recognize that, but that doesn't mean that, we have the resources to necessarily put teams everywhere. So we still have to look at that. Our goal, we really try to streamline a lot of the administrative things in the CBO contracts or otherwise, so that we could have more safe passage workers versus kind of administrative costs or any of those things. And so we'll continue with the 600,000 more to look at that this year to see, was it the right mix? Are there things we can strip down or take on our side, or with OVSJG, who's really helping us manage a lot of this, so that we can expand. But it's going to be part of the process that we start now for the RFP process to determine, is there a way to grow a little bit? But it is incidents and both kind of in school and in the area. Yeah.
Okay. School Connect, school transportation is a part of school safety.
Yeah.
Does this, we put funding in for a School Connect program for LaSalle Backus Elementary School. It was first funded in fiscal year 24, and it's taken some time to get off the ground, but we're working with the Department of For-Hire Vehicles. I just wanted to see if that was sustained in this budget. It'd be quite unfortunate to cut the site before it's actually been put to use.
I don't know because that's for hire vehicles, which is Deputy Mayor for Operations and Infrastructure. So I can't say for sure. I can check on it for you. I just don't know.
Right. I want to ask about sort of our favorite thing, the criminal code.
Yes.
I want to ask about a criminal with a few important exceptions. I know, with some important exceptions, Mayor Bowser supported a rewrite of the DC's criminal code in 2022, just because we have an archaic criminal code, no matter which way you look at it. In your opinion, is a wholesale revision of DC's criminal code still needed? And what are our thoughts on revising the criminal code?
So, I mean, we worked extensively in the process. And so, it came down to some provisions that we simply couldn't support. And the mayor made the choice that the right thing for the district and the safety of residents was to veto it. So we've been participants in the process. And I think we said at the time and in letters and everything that 95% of the updates were things we agreed with, or that we had, everyone's not going to agree to everything, but that we thought were kind of reasonable positions. It's been a couple of years, but we understand that any policy, like, always is going to need to be looked at, and certainly that's the case for a code from the 1901. So our position hasn't really changed on that.
Getting it. Yeah, we need to get it done.
Yeah.
Other things that sort of are under your cluster but not under your cluster, in the sense of it's just
It's all under my-
everything is under your cluster. You're responsible for everything. Sometimes people feel that way, as you know. An example would be Kennedy Street, for example, where we have done an extraordinary amount of work in all areas: intervention, prevention, and enforcement work. All three have been helpful. And one of the purviews is like sort of the work around vacant and blighted properties.
Yeah.
And nuisance properties, something as simple as graffiti and trash removal. Yes. Are you all sort of just trying to want to know what kind of coordination you're doing with the other agencies, like DOB to address vacant blighted properties, like DPW to address some of the graffiti, especially gang tags and different things like that, and trash and things of that nature that also contribute to unsafe neighborhoods.
So we really believe in that. Like, we really believe in, CPTEB, which is crime prevention through environmental design, through place-based interventions. And so this year, we've had sustained public safety task forces. I think last year we were in Ward 4 a lot. We were in Brightwood Park, and then we'd be in another part of the ward.
That's right.
Every single week. And so this year we thought that the chief looked at it and thought we really need to bring back our homicide reduction partnership initiative, which we had in 2022, which was very successful in driving down violent crime in our 6 PSA that accounted for a quarter of our homicides. So we have it in 3 areas this year: Rosedale, Anacostia, and Washington Highlands, based upon data. But it really is exactly that. It's right now they're out. You have DPW doing both ticketing, towing, trash pickup, noting areas where they would need to go back for graffiti removal. You have DOB, ABCA, DLCP out doing business checks and things like that. You have MPD out doing what they do. Really, this is not about police enforcement. It's about engagement. Our office leads those on Wednesdays and Thursdays. You also have, who else is the fire EMS is out. They do a lot of Narcan outreach and kind of the EMS side of the house, and also fire prevention. Who else is out there? DDOT, I don't want to forget DDOT, looking, lighting, things like that. Oh, DC Health goes out to do rodent abatement with us. So that's every Wednesday and Thursday. And so sometimes that will be always in those 3 areas, but we also speak to the commanders of each of the districts to be like, is there an area where you could really use it? And we're also working together with the city administrator's office and a broader range of agencies to really do like a spring cleanup, to go and really look at Office of Clean Cities, like, where do we need to do a graffiti out? And where do we really need to clean up and alley cleaning and all of that.
Yes.
Yeah.
Okay, great. Thank you. Thank you, Chairwoman.
Thank you, Councilmember Lewis George. So Deputy Mayor, I just want to turn back to the Safe Passage program for a moment. You were talking about some of the ways to address the realities of issues on the job, whether that be site visits or inspections. How often are those happening, and what does the follow-up look like if you do see someone sleeping on the job or texting or otherwise disengaged?
So, I think there was a principal who came, and so they have monthly site visits. But that issue was identified, and we worked with the provider, who then did a randomized drug testing of all of their people, so that to see, and nobody came back positive. So like I said, there's the routinized monthly site visits. Then there's also, we have several other individuals who are working as part of our DMPSJ team, who are doing pop-ups. And those are more informal. They're just kind of going to the sites and seeing where people are and seeing if they're there and observing. And so there's, I think, 3 members of my team that are doing that on kind of a daily basis. And the follow-up it's both formal and informal. So in the instance you heard earlier today, there was a meeting with the principal. They outlined, or Ciata, who is our really kind of administrative lead, outlined a plan, checks in with her, and she hasn't raised any issues since on that principal, on any of the things identified. But we also document, so it's a little formal in the grant side, where it's like, this issue has been identified. How are you going to address it? And then follow up to see if they have, because if they don't, this is a grant where there's kind of consequence, which is like a cure letter, a notice to cure, and then kind of moving through where we may not continue the grant.
Okay. And then you mentioned training. Is this something that's done across the board consistently, or up to each CBO?
It is not. So I was saying this to Council Member Lewis George, that in the past, the CBOs got a lot of autonomy, and like, we appreciate their partnership, but we need some standardization. So we've set a training curriculum that we take care of. Next week, there'll be a whole host of trainings during a spring break. And then the CBOs can add, and we kind of do a catalog, and if people want to go to different ones, they can. But the primary training, we take responsibility for, of the things that we really believe everyone needs to have. But like I said, the CBOs, like, there's some expectation that they will be doing additional trainings for their staff, but that's nice additions. Like the primaries where we did prior to the start of the school year, like a 3-day set of trainings for all of the safe passage workers. And then kind of have those at intervals, monthly trainings. Yeah.
Okay, thank you. And you talked about the kind of relationship with the school leaders, and sometimes the leaders in the school communities, have a specific expertise about what their community needs.
Yep.
What does that look like in practice, particularly getting safe passage workers in some school buildings, and the balancing dynamic of school leaders who are opposed to that, or who are open arms to that?
So we made a decision this year to not have them in school, because that component wasn't uniform across the board, and we wanted uniformity. And also because for clarity of role, like, there are some great safe passage workers that are kind of, offering behavioral support, but we're not clear if that's the role. And there are, like you hear, and we're working with DME, there are a lot of auxiliary adults in schools. And so whose role is what? Because the safe passage worker will be a caring adult who wants to help, but that may be outside of their contractual obligations, duties, and expertise, right? So there's that piece where people are like, yeah, but they're great in schools, but we needed to kind of add some structure to, this is your role. And we can go from there. So in some principals, and that's how we address some principals are like, well, I don't want all these people in my school. Right. And it was in their contract to be in there, but some of the principals are like, I don't even know who all these people in my school are. And that's a problem, because the mayor said, and it's true, principals are like mini mayors. Like, they have a lot of things, and they have to be able to kind of control their terrain. And so we thought, like, let's reset with what the role is. Some of the schools you'll hear in here, like, they may say it's safe passage, but no, they have credible messengers or OLA in the school. That's who's there, they're VIs or otherwise, and that's a totally different thing. But if we're going to have a continuum, we really do have to define the roles. And then the communication piece, like, schools, like, every relationship is a work in progress. So as they start their relationship with us, we are giving clarity of, this is what our expectation of people is. And if we get to a place where we're able to expand in school or not, like, I met with the CEOs, that's great, we can do that, but like, let's build
like good structure first, and then let's talk about like, well, what would be the value? Because everybody has a responsibility, and I am wary of safe passage workers becoming behavioral techs. If they want to be behavioral techs, let's get them in that position.
Okay. And in terms of the geographic border, then, if they're not going to be kind of in transit or in the schools, what do the conversations look like with them if there's a beef going on across the street, for instance?
Yeah, this is not as stark as, there's no way that it should be like, oh, over this is my area, I can only be here. That's all obviously foolish. Like when people say things like that, then they may not be the right people, because certainly like, or we need to clarify, like, this is not that rigid, because you hear those things and you're like, yeah, but they're right there. Come on. Right. Like, so it's our expectation that like you have an area, like, and it's not, this is my street and I can't go over there. So if that's happening, then we need to have a conversation so that there's like an understanding. You're not going to be like penalized. And there is also a proactive expectation. Like, it can't be like, I am here. That's actually not the role. You're supposed to be really, like, we don't want you fully out of the range of where you're supposed to be, like you're way over there and you can't even tell, right? Because those routes were mapped out with schools, right? To be like, this is really some of the spots. And one of the principals from Thurgood Marshall, he was talking about how he really walked it with them and like with his safe passage workers, and they looked together and it's like right here in this spot. So we want to make sure we're honoring that as well, but not being like rigid and silly.
And that's part of the training.
Yes.
Okay. So let's talk about One's Leadership Academy.
Yes.
What is the rationale for transferring the budget from the Office of Neighborhood Safety and Engagement for OLA into DMPSJ?
It's also the people. So it's transferring the people as well. So it's the positions and there's people in it. And it really is like, so this, it's great that like, and people like One's Leadership Academy, but One's really has a mission focused on reduction of gun violence, pathways program, critical incident response, restorative justice practices. And this was something that they're like, and let's also do this. And that's wonderful. But one of the things we're trying to do is really have appropriate alignment with safe. This is school-based violence intervention. That really is what it is, right? And so with safe passages, which also falls in that spectrum, in the beginning, when One's was started, if you recall, like their primary mission was to serve those 18 to 35 or otherwise, right? Like that was really the focus, because that was where gun violence was primarily focused. We've had to slide down a little bit, but like middle schools and all of that, there's a little bit of a mission drift, and it's really important that they're able to focus on their cores. So we're like, okay, this is a part of a school-based continuum where it's like, okay, well, there are some schools maybe where this internal model, like Anacostia High, really like their OLA folks, and we have safe passage. This can be a good tandem because there are any number of issues happening inside that can inform outside. And particularly with the loss of some SROs, it is another set of sort of trained people in the intervention space to be like, there's a beef, there's this going on, to add information. But that then becomes, we feed that into VIs versus they're now focused on here. So it was about appropriate alignment. You have these 10 people, right, in these 6 schools, and like, then let's make them a part of our kind of school-based safety continuum versus this kind of just sitting over here. And so that's really what it's about. Like, how do we make sure that everybody's in the right part of the continuum?
But then why not put them with schools themselves or with the Deputy Mayor for Education's budget?
Well, I mean, we took over safe passage, right? Like, so we could do that. We could put them in DME, like, but there's not really like this huge amount of daylight between us and DME when it comes to like these issues, because we're operational when it comes to like violence and unfortunately, right? Like that's really DMPSJ's role. DME though still oversees schools, right? Like they're still responsible for schools. So there's a lot of interconnectedness. We could have done that. I will be honest that in the discussions this year about efficiencies and otherwise, I said, okay, let's put OLA with my office. And I said that the leadership of, the city administrator and the mayor trust my judgment, right? As to what's going to help us operate best. And so that was why that decision was made.
I guess, and I hear that from Deputy Mayor you versus Deputy Mayor for Education, but I guess I'm still trying to understand the distinction between the operational and implementation responsibilities of agencies
Yep.
versus the deputy mayor's office, because this is really a violence prevention
Yes.
program. And so like, as I think about other clusters, you know, I don't know if this is not an exact equivalent, but it almost seems like the equivalent of saying, okay, let's put TSIs and the work of studying traffic safety improvements that DDOT handles under DEMWA. Like, we wouldn't really see that type of transfer.
You might not, but if you look at the other deputy mayor's offices, quite frankly, most of them are large and administer programs. You have Thrive by 5. You have all of these different program offices basically within DMHHS. You have DMPED that has a whole host of operational functions. You have DME that has the out of school time grants and all of these various areas. Quite frankly, DMPSJ is the only other one other than DeMois that isn't built that way, right? If you look at the deputy mayor's office. So the discussion was, well, I'll be honest, actually speaking with the city administrator, he was like, we should really build out an office of youth violence prevention, because there isn't really one in the government anywhere. And it's something we talk about that probably as we build out, that should be maybe a DYRS function, because, you know, they play the role of, they play a lot of that role. But one of the things that we acknowledge is right now that is a gap, right? Like that kind of youth violence prevention space and that expertise. And so while we're working on the right place, right? Like it's like, okay, well, this is the place. And so I would say that this really is more akin to actually positioning our office like the other deputy mayor's offices that do oversee a number of these programs, grants, et cetera.
I see. Okay, fair point. So kind of specific budget question, but it looks like in the one's budget, there is still a line item for the Leadership Academy of $748,000. And the one still has 7 FTEs in that line item.
Well, that might be, I don't know. So I think we tried to, they tried to pick up everything that was listed as ones, but it's possible that it was listed in multiple places. The goal was to move everything. So I think we would need to like check and see why I mean, this is kind of the thing with ones is budget. At some pieces, there's like different programs that a little confusing. So, so we can check on that to figure out what's going on there.
Okay. I don't know if you have, I'm so sorry, I forgot your
This is
last name.
John Nitz.
Mr. Nitz, I'm sorry. Of course.
He was taking notes to go back and find because he's not the AFO for.
Oh, okay,
Yeah.
great. Well, Mr. Nitz, I was just turning to you if you have more information about that line item and why that's in there, but
Actually, I don't. Office, so what I can do, at least we can take notes and get back to you.
okay. Okay, great. And we can certainly ask ones at their budget oversight
But we'll
hearing
find out
as
because
well,
they might
but
know. Like,
yeah.
honestly, like I think
Right.
there was, yeah. Like,
Right. And maybe it's just a duplication, but
Yep.
okay, sounds good. So safe commercial corridors.
Yes.
Thank you to you and your team for getting this program up and running and administering this grant. As you heard from some of our public witnesses today as well, there's a lot of enthusiasm for it. I know commercial corridors across the city are ready to apply for these grants. So this program has a proposed budget of 2.3 million with 2 FTEs. So what is your office's plan for the dispersal of those funds, and how many commercial corridors do you anticipate it will be able to serve?
So, I mean, it's hard for us to say. Like, I mean, Nicole did a lot of the administration this time. And so just so you know, with the FTE, like literally we wear many hats in the Office of Deputy Mayor. So Chief of Staff, also grants manager for this, for getting this out the door. And so I think we have 6 grantees this time. And so certainly I'll let her.
Yeah, council member, what I can share with you is I think that the demand will be high. So for this year, fiscal year 24, there was a $3 million application pot that we selected from for the 6 commercial corridor grants that we did end up issuing. So I anticipate now that it is broadened district-wide, the demand will be great. And then we will have to do the prioritization and scoring as we did this to get down to the targeted amount that's in the budget next year.
But we also want to make sure that we're like covering the city as much as possible. Like it's not always a one-to-one thing, but certainly we know there are commercial corridors and main streets
and others in many parts of our city. I heard you, and we certainly heard you that, this go around that it was maybe a little more onerous than we wanted it to be. And so we don't want there to be a barrier to entry like that for some of the smaller, main streets or otherwise. So we'll really work on that. We tried to kind of like spread it around, to be honest. And so we're excited on Monday, for instance, Ralph Boyd, who's the president of So Others May Eat, was with us at the Real Time Crime Center. And for us, it was a relatively small grant, but they were so excited, right? And then there's larger. We were yesterday with the Community Safety Ambassadors for Downtown bid, who were fantastic. And people were so excited. That was a larger. So I think we're going to really try. We'll work with your office, of course, and all the council members, because so many have commercial corridors, to really try and make sure that we're being fair and equitable as we can be in getting that get right this time.
So I appreciate your comments about making sure we're now looking at the smaller organizations too, and some of the out-of-pocket payments, as you know, have been a barrier. So are you anticipating that these may not be reimbursable grants and might just be direct grants?
So we'll see. Yeah. So we try, like we said, so part of the reason we did that is trying to use other models we had where it's like sometimes unable to recoup, but we have trusted relationships with many of these. So to the extent we can, we'll certainly look at that. Like the first go out, we didn't want like money out the door, and then we're like, oops, people didn't do anything when we can't get it back. Or right, like we were trying to be responsible, but happy to look at. I know maybe some of our other deputy mayors do here's just the money and go. And so we're happy to do that. It will help us to be able to do that, to have staff who are able to track, because we're kind of
right. So the additional funding for one more or two FTEs.
Yeah, because we have no one right now.
We'll do both the disbursement, but also the follow-up.
That's
and
right.
Tracking. And
That's
okay,
correct.
great.
Yep.
And so what I'm hearing is there's going to be a little flexibility as we see kind of the applications and make sure you're being thoughtful and inclusive across the city. But is there a general range that you're contemplating for the number of corridors that may be able to be served, or the range of the grant issued?
I think we'll have to look now, right? Like, because we have plenty of time now. We'll have some experience with it, because we now have grants out the door and people starting. That will really help to inform, and we're happy to continue having those conversations, because we actually have, like a little bit of time between.
Right.
So I don't know that there's a specific number. Again, like it's important to us to have coverage across the city. Like, yeah, that's what I would say. So we'll try to, in order to have coverage across the city, like some of the applications are big and small. So it's hard to say like, we'll have 10 where we always give this.
Right.
But maybe that is the fairest way to do it, but also maybe not.
I see. Okay. Well, we look forward to continuing to work with you all on that.
Yeah.
And then in terms of DMPSJ's budget, in 2022, your office had 9 FTEs funded, and this proposed budget includes 26 FTEs, which makes a lot of sense given a lot of the expansions that we've talked about and increased responsibility that you all have taken on. But how is that increase going to impact your operations and the duties and responsibilities that you already have within the agency?
I mean, I think it will help. I have to give a huge amount of credit. My staff is upstairs on the 5th floor, that we're like small but mighty, right? Like, and do a lot. I mean, I think I just say it, like I ask my senior policy advisors also like out with me at resource pop-ups, right? Like my community outreach person is also helping oversee VIs. Like they do it all, like, and I appreciate that deeply. That's kind of what we look for, is flexibility. We believe that as we gain and have gained and demonstrated the ability to take on increased responsibility, this will allow us to have a more appropriate structure. 10 of these, of course, right, are One's Leadership Academy, which we're not going to change. They need to be in schools, right? But this will allow us to add some, a couple of things. One is some program oversight. It's important to us that we're still maintaining our oversight and supportive, but also accountability function with our agencies, right? So I don't want to touch our core data people, our program analysts. So the additions are, apart from One's Leadership Academy, are for strategic initiatives like grant programs, like safe passages, like accountability. So it will help us to increase our ability to kind of do the both and of a deputy mayor's office.
Okay.
And just one thing I'll say, if you recall, like, you know, part of this is the Office of the Deputy Mayor, the Assistant City Administrator, Deputy Mayor, now City Administrator Donahue was Deputy Mayor and Assistant City Administrator for a long time. So both of these two staffs kind of came together to support both. And so as the office has been now separate, it's building up. It's been a process of really like right sizing in many respects, to match the responsibilities.
Gotcha. Thank you for that context. That's helpful. So there's just a couple questions about the kind of overall funding structure for various agencies. So I'm optimistic that a lot of the budgets of your agencies remain pretty stable this year. There was a replacement between ARPA dollars with local dollars. Can you talk about some of those decisions?
Sure. So when ARPA dollars originally, or so the American Rescue Plan Act dollars, which are the federal dollars, at the beginning, there were a whole host of programs that were funded with those dollars. And really what we said from the start, and I think it was FY21 or 2, when they came in, is over these next 3 years, like, let's evaluate what programs. We always knew that you were going to have to make some decisions about what went to local, right? Because it wasn't going to be sustainable to fund all. And so we really did a process, some of it with the Office of Budget and Performance Management, some of it with the lab, some of it just individually with the agencies to look at what are the outcomes. And you know, you heard me say at the beginning that, and the mayor say this last week, we had to think about our guiding principles and our values. And we, you know, kind of in the balance of equities, we believe in prevention. So we're like, okay, it's important for us. One of the big pieces of the ARPA funds with ones was pathways expansion. Well, we really believe in pathways. So we need to maintain that. We need to do some work to make sure the long-term outcomes are good, but that we believe that continues to be the right investment. As we adjusted, and you saw kind of adjustments across the ecosystem, we wanted to make sure that it was clear we still believe in prevention, that it's as important to us as accountability. And so, and we believe that we're seeing, honestly, a lot of I talked about on Friday, a lot of our decreases in gun crimes because of the work of our BI. So we need to make sure that one still has the money to not alter what we're doing there. So.
Thank you for that. And are the local dollars for ones one-time or recurring?
Oh, I don't know. I assume, or I'd have to check, because I don't know. I will check on one's budget all the way around for you.
Okay,
but.
thank you. That would be helpful just to kind of re-go over with you a deep dive of that budget.
Sure.
Some things on the OVSJG budget.
Yeah.
So we are very pleased to see support of our victim services,
Yes.
which we know are a huge need. But the proposed budget takes the access to justice funding back to 2019 levels.
Yes.
Which reflects a pretty significant cut of what they've had the last couple of years. So can you talk about your thinking on that budget?
Yeah, so we believe in access to justice, but we also recognize that in the budget, we had to make difficult decisions. We've actually made proposals about access to justice over several years, and council has added one-time fund each of those fiscal years to bring it up to the levels that it was, right? And that's a choice that council can make. We proposed a right around the same, I think it might be consistent. We've proposed that this is the level that we believe is the funding that allows us to fund all of these very important all of their important priorities, right, across government. And, you know, we've maintained it's not sustainable. Like, these were one-time funds that were added each year. And so our proposal is what we believe, just like you saw with all the worthy programs that we had to make decisions on to close a very significant budget gap.
So I guess, where do you think the discrepancy is between what Access to Justice believes they need to support residents and to prevent their role in prevention, versus what the executive kind of calculates that need to be?
So, I mean, I think one of the things is prevention encompasses a lot of things. it is our belief that making sure that people have housing, right? That they have housing assistance, that they have food assistance, that they have workforce development, that we have victim services, that all of those go into the, hopefully not needing to utilize the legal services that access to justice provides. So, I mean, it's quite frankly, like any of the calculations that we have to make about how are we balancing investments? So if you look outside of just PSJ, all of the investments that are made in housing, in ERAP and HPAP and in all of the various programs, we believe also is a part of prevention, and there has to be a balance maintained.
Thank you. So another piece from OVSJG's budget eliminates funding for one of our truancy programs, Stand Up,
Correct.
Stand Out.
Yes.
And so can you explain that decision and how it's going to affect our serious need in the city to tackle truancy and make sure that more of our kids can get to school?
Yeah, so one of the things that we really, really were looking at is efficiency and alignment, right? So truancy and chronic absenteeism is a huge issue, which is why you saw us make the mayor proposed uplift, right? Which is a whole scheme based upon conversations across the spectrum of what we believe is going to help both on truancy and chronic absenteeism side of the house, and also some of the kind of downstream juvenile justice issues. While it's, again, we believe that Show Up Stand Out is a great program. I believe it serves a very small number of schools. Whereas in order to fund what we believe will serve many, many more young people at DHS, a decision was made that, in fact, DHS was given funds to increase ACE, PASS, and some more initiatives in truancy and chronic absenteeism prevention there, right? And so really it was that decision of where are we going to get the most impact? That was a part of, in funding DHS in the truancy space, it was a part of a thoughtful process of policy, the right referral process, the right people to provide the types of services and supports that we think will then link them in if they need CFSA or any other DHS supports that might help the family, which we believe is a critical part of truancy prevention. So that's really what that decision was, is that there are many good programs, but how are we going to address the large corpus of issues? And that meant really having to make shifts.
Okay, thank you for that context. And how do you see DMPSJ and your cluster agency's role as it relates to truancy, which is another crossover issue that deals with a lot of agencies outside of your cluster, but that you have a role in?
Yeah, so I mean, these discussions when it comes to our young people are very, very intercluster. It's like DMHS, DME, and DMPSJ all very closely intertwined. So the whole process of even arriving at the uplift bill was really very much all the agency aligned in a very different way, even than, any other policy proposals you saw last year. It was really like they're not separate, right? So there's the piece where we run safe passage, right? Like that's a very visceral, like, okay, like let's put people here to make sure they get to school safely. Then there's the piece where DMPSJ oversees the Metropolitan Police Department, who does a lot of truancy work. They pick kids up, they drop the kids off, right? Like, and it's our expectation that that's part of it. Those are kind of very practical, right? We have credible messengers in some schools where there's more trouble. We are doing resource pop-ups where we really work with, we were at Baloo last week and I was talking with the principal, how can we help, right? Like making sure that kids are attached. We're coming to them with resources so that they're attached to after-school programming, that they're aware of DPR programming, that they're aware of SYP, all of that. That's part of the role that we play there. But then further down, kind of downstream when referrals are made, we really had a conversation. Should this go to DHS or should it go to DYRS, right? Like what's the right spot? Right? Like, because ACE and PASS are part of our continuum when it comes to the juvenile justice system or prevention. And so the one decision was made for things to go to DHS, and then further down, if a referral is made for DYRS to pick up those young people and their families that are either involved in serious crime or getting like serious referrals made. So we become like what we are, the deeper end of the continuum. And so it's my responsibility, all of the things that you said, but also participating with my deputy mayors and our agencies to really sit down and figure out the best way to be holistic when it comes to families and young people.
Thank you. So one of the, well, a few of the public witnesses we heard from today are from the domestic violence space.
Yep.
And we also heard this from one of the witnesses, I think last week at the violence interruption collaboration or merger hearing, about scheduling a training session.
Oh, yes.
To recognize. So what is the status there? What is the holdup of that?
So I'm
schedule?
happy to do it. Like I had met with one of our domestic violence organizations. I don't think it was one that was here about really integrating that. We're looking at what trainings our VIs need holistically. I don't think there's no like opposition. Like we've been kind of like, what are the acute trainings that they need, like recognizing, you know, gang violence. And honestly, like our primary focus has been on crew-based violence because that's sort of what traditional violence interruption is focused on. That does not mean it's a diminishment or a lack of acknowledgement of the importance of adding other types, but that really has been our focus to make sure that they're able to mitigate shooting, which the largest bulk in our city is usually crew-based or you know, some other interpersonal form of violence that isn't necessarily traditional domestic violence, but happy to explore making sure that our VIs and others have that type of training as well.
Okay. And I hear you on the majority, and sometimes we do have to stay focused on a particular issue. But when I think about sexual violence, domestic violence, and just the numbers reflected on the page are about 11% of our shootings are related to that. And I am persuaded that it is likely a much larger percentage because of the connection points that people have. They may be feuding with an ex-boyfriend and a current boyfriend that doesn't get categorized as domestic violence.
Yeah.
But it really is connected to it.
Sure. Yeah.
And there's this $5,000 grant from the federal government to do this training. And so the DC Coalition Against Domestic Violence is ready to go and they have the funding. And so if I can just ask you to get back to them on that training, they've are ready to do that. And I think it could be helpful.
Great. We're happy to do that.
Thank you very much. All right. Well, that concludes my questions for you today. Deputy Mayor, I want to give you a chance if you have any other points you want to make or something you want to highlight that we didn't have a chance to talk about today.
No, I say this every time. I'm really grateful and thank all of the 10,000 plus public servants that work literally 24/7 in public safety and justice. You're seeing a number of our agencies. I think fire and EMS is up next, and then Department of Corrections. And so like my deepest thanks to them for their commitment, for their like they stick in it and stick with it. It's really hard work that they do. And so we appreciate it. And all of our partners who we talk about reductions, like there's no way we're doing that. And it's hard to turn things around when they're not going well. And so it's taken everybody, and we really appreciate everyone's continued partnership, certainly your partnership and support, and holding us accountable as well. And so you have our commitment to continuing to work hard to make our city safer and stronger. So thank you.
Great. Well, thank you so much, Deputy Mayor. And as we think about this budget for your agency and for all of the agencies in our city, I do want to acknowledge that over the last 6 months or so, you and your team have been here with us, whether it's oversight hearings, budget hearings, or on dozens of pieces of legislation. You know, many, many times, probably over a dozen times in the last 6 months. And so I appreciate that partnership, and is really important as we continue to ensure that the budget investments that we all put into the budget are actualized and continue to be iterated so we can all get this right on what I know is very important work for all of us. So thank you. And thank you again to your entire team, and have a great rest of your day.
Thank you.
You too.
Wonderful. So we are now going to turn to our next agency on today's agenda, the Fire and Emergency Medical Services Department, or FEMS. We are going to follow our normal practice and hear from our public witnesses first. We have 3 public witnesses today, 2 of whom are joining us in person and 1 who is joining us virtually, David Hoagland, Amy Mauro, and Hillary Actor. Hi, thank you. President Hoagland, if you can sit on the right side of the table, and Ms. Mauro, I'm sorry, my right and your left, yep. Wherever you're comfortable, great. All right. Thanks, everybody. Okay, first up, David Hoagland, the president of the District of Columbia Firefighters Association, IAFF Local 36.
Good afternoon, Chairperson Pinto and members of the Committee on Judiciary and Public Safety. I'm David Hoagland, president of the District of Columbia Firefighters Association, local number 36 of the International Association of Firefighters, AFL-CIO. Thank you for the opportunity to testify today on the proposed FY 2025 budget of the Fire and Emergency Medical Services Department. I represent over 1,800 professionals that stand ready to serve whenever someone calls 911 here in the District of Columbia. As president of these professionals, it's my job to be there for them. Our focus as a union remains on the health, safety, and dignity of our members. To achieve that goal, considerable attention must remain in the areas of staffing, training, and resources. In the FY 25 budget, we appreciate the mayor's commitment to public safety and the safety of our members. The health and safety of our members will always be the number one priority of our organization, and I'm very pleased that this year's budget includes an enhancement for new structural firefighting PPE, along with personal escape systems for each of our members. Councilmember Pinto, I want to express our appreciation for your continued advocacy since we discussed this issue last budget cycle. These personal escape systems exist to save the lives of the district's firefighters. Today, I want to focus on not where we are today, but rather place a strong emphasis on the future. We've seen a continued increase in call volume, as Chief Donnelly has noted in previous testimony before this committee. I also provided testimony referencing a study that projects our city's population will continue to rise, which translates into higher demands for service. We must prepare for the future starting today. I'd like to paraphrase the remarks of City Administrator Kevin Donahue from last week's budget testimony, which I find incredibly insightful. Speaking in broad terms about the state of city agencies, many of the employees of these agencies are stretched thin and overworked, yet devoted to their mission. His words truly resonated with me and succinctly stated the reality of the DC Fire and EMS today, who's operating at staffing levels that were determined to be inadequate 10 years ago, let alone today. I strongly urge that we heed the insight of the city administrator and begin immediately to create a clear roadmap for the agency's future. This plan must first focus on solving our staffing stressors. This roadmap must include 4 elements: a target for how many units and how many providers per units are sufficient to meet the rising demands of service levels and call volume, an accurate staffing factor to ensure we have the adequate amount of agency FTEs to meet these levels without overburdening the workforce with excessive work, overtime, and mandatory shift holdovers, and a retention program to ensure we keep our most experienced employees and can more accurately predict attrition rates. Adequate time dedicated to training as well. We appreciate your commitment to getting our firefighter retention plan introduced to address this need to predict attrition rates for both the Fire and EMS Department and MPD. The city administrator also mentioned employee wellness. We are pleased that our robust program with the human performance company O2X remains in place to keep our members healthy and in good physical condition to do our very physical job. I'd like to highlight a current labor management initiative where we're applying for a federal SAFER grant that will provide FTE funding for 3 years to place Truck 1 back in service. The GIS study performed by this union using the fire department's data clearly demonstrated that the Fort Totten neighborhood is underserved specific to coverage of a trunk company, and the calls for service more than justifies this need. Intentional efforts such as these reinforce my belief that we can address our challenges if all parties are committed. Focusing on the capital budget, I want to thank the mayor for her continued commitment to the apparatus fleet. Funding for new apparatus keeps us on the trajectory of a replacement schedule that ensures we have safe fire trucks and ambulances in good operating condition. We continue to face challenges during the procurement process, specifically from the time a requisition is submitted until the time it becomes a purchase order for these apparatus. Management is working with OCP to streamline this process, but time is of the essence. These delays in procurement process, coupled with the post-pandemic build time of these emergency vehicles built for the District of Columbia, lead to a situation where we will not see much by the way of new apparatus until calendar year 2025. And these are purchases made from 2022 and 2023. Finally, related to the budget in our CBA, we negotiated a restored leave payout for our members who had excessive amount of leave left over since our members were here in the district working every day during the pandemic. Last year, the first portion of that restored leave payout was conducted, but this year, DCHR has not paid out the remaining restored leave. This will demonstrate a cost savings for the district as they will not need to pay overtime to fill the vacancies by these members taking leave. We hope that The city can honor this language in our CBA and pay our members out who have access levels of restored leave. Thank you for the opportunity to testify today, and thank you for your commitment to DC firefighters in a tight budget year. And I look forward to any questions you may have.
Thank you so much, President Hoagland. Excuse me, Amy Marrow, Executive Director of the DC Fire and EMS Foundation.
Good afternoon. My name is Amy Morrow, and I'm Executive Director of the DC Fire and EMS Foundation and a lifelong resident of the District of Columbia. I am pleased to testify today in support of Mayor Bowser's FY25 budget for the DC Fire and EMS Department. The mission of the foundation is to support the department and its heroic members by supporting their training, wellness, and recognition, equipment and facilities, and by educating the community about the department's life-saving mission. The residents of and visitors to the district are very fortunate to have a mayor and council who are as committed as they are to fully funding the life-saving services of this critical agency. I have worked in public safety in the district for over 25 years, including almost 8 years as chief of staff of the fire department. In the past, it has not always been appropriately funded, and that reality had life and death consequences. In 2015, the department ran out of ambulances on a daily basis, its apparatus broke down routinely, its members received little training, and the district's cardiac arrest survival rate was half the national average. Thanks to budget investment and brave policy decisions by the mayor and council, since then, the department has stayed on its apparatus replacement schedule, its members receive regular training, and its innovative programs like the Nurse Triage Line and Whole Blood initiatives are leading the way nationally. Most importantly, the district's cardiac arrest survival rate has increased to well above the national average. Attachment 8 of my testimony is a chart that demonstrates this amazing progress, with 2023 showing a record level of cardiac arrest survival in the district. On the foundation's website, there is a page called Meet Our Patients and Their Lifesavers. Without the department's recent progress, half of those cardiac arrest survivors would not be alive today. I remind our residents and policymakers of the past because it is both a cautionary tale and a powerful lesson. The lesson is that investing in the DC Fire and EMS department saves lives. The department's proposed budget maintains this important investment and progress. I am well aware of the financial challenges currently faced by the city and of the sacrifices that need to be made in other areas of the district's budget as a result. But the reality is that no matter how the local economy ebbs and flows, when our DC neighbors and visitors call 911 for a fire or EMS emergency, they expect our firefighters and EMS personnel to respond quickly, compassionately, and competently. This budget proposal allows them to continue to do so, and I urge the council to approve it without any reductions. One priority of the foundation is continuing to work toward building a new training academy campus for the department that meets the modern needs of the agency. The department has been able to make the progress I have summarized with a patchwork of old buildings and limited classroom space, including a falling apart building built in 1961, an upper building built in 2003, and 2 trailers that have supplemented instructor office space for decades. In recent months, we have had 145 recruits in the academy at one time. Aspiring first responders still want to become DC's bravest. They deserve a learning environment worthy of the incredibly challenging and honorable work that they undertake on a daily basis. I urge the council to not only approve the budget's funding for a new academy, but to prioritize keeping this project on track in the out years and as additional capital funds become available. Thank you for allowing me to testify today, and I look forward to any questions you may have.
Thank you, Ms. Morrow. We will now turn to Hillary K. Actor, public witness.
Good afternoon. I want to just thank you and introduce myself properly. So my name is Hillary Kaxer, and I be in deference to the recovery community, I just use my last initial K, but I am an actor and an advocate. I'm grateful for this opportunity to testify before you today. And I also want to say great thanks to Fire Chief Donnelly, whom I got to meet at a mayor's community event and who has been extremely responsive. And I also appreciate very much the emphasis today on prevention and investment saving lives. The behavioral health diagnosis defined as hoarding disorder, or HD, directly relates to FEMS because DBH, in my experience as this witness, lack of early intervention or any behavioral health intervention costs FEMS both in dollars and in life and limb. And you all are only too familiar with that, so I don't have to go into detail. I've had a lot of great response from the fire marshal, also the fire department medical mobile intervention health team. Fire marshal allowed me to share his comments, saying that they work closely with DBH and refer individuals to DBH that think that FEMS thinks could benefit from DBH services. The fire marshal says he's not aware of any gap in their services from the perspective of the fire department, but he's also not aware of all the services. So why I'm talking about another agency that's not under your purview to you today is because it directly affects FEMS, and this is a budget issue. So if DBH continues not to provide adequate early intervention to reduce harm, what can this committee do with your oversight over FEMS to help? And I have taken this to Councilmember Henderson, who chairs the Committee on Health with purview over DBH, and I'm grateful that Councilmember Henderson serves on this committee with oversight over FEMS. We need some collaboration here. I can tell you more of what the fire marshal said. He does say that in some cases, individuals are not receptive to either the fire marshals or DBH's assistance, and they must respect the individual's right to privacy. And I was very grateful that Chief Donnelly was also emphasizing legal solutions, because right now DBH refers people out to Department of Aging, which is Adult Protective Services, and that is a deterrent. There are many deterrents to people getting behavioral health care. We want person-centered, person-driven, trauma-informed care, but can you all help with any of this coordination? Because right now we are not addressing the early intervention that could abort a poor outcome.
Thank you very much, Ms. Kay. And thank you for the clarification of your name and profession, all the importance a comma can make. So appreciate that and appreciate your testimony today. And agree that it is very important that we focus on the early term and continued investments on behavioral health and support so that we don't have an overstrain on FEMS in a environment that hopefully many of which could be prevented earlier. So thank you very much. I want to ask you, Ms. Morrow, about the training academy and how much funding you believe is necessary as we move forward, not just this year, but over the next several years to really ensure that the academy is all that it was envisioned as.
Thanks for the question. I have to defer to Chief Donnelly on the amount that he believes is required. There's about $4.75 million in FY25. I understand the project's still in the planning and design phases. So in 25, that would go towards that process. But you'll also see that the out years are zeroed out for the project, as is the case with most of the department's capital budget. From my experience, that's just a function of limited resources citywide, and the mayor's office tries to fund the next fiscal year and to work from there. But my recommendation would be to make sure that those out years, when they're ready to start building, stay in the capital budget.
Thank you. And President Hoagland, you talked about focusing on what the future of FEMS will look like. What does that look like in your view from a budget perspective of things that we need to be investing in now to continue to support the department?
I think, like we were just discussing, the investments in the training academy, it's very important to make sure we have funding for a lot of these large capital projects in out years like that, like our new apparatus facility that we're trying to build. We need to start looking towards more FTEs as we need to train more members. And we made a lot of progress on that front, but a lot of times we use FTEs from operations to train new people, and then that just places a strain on operations. And as well as just start looking forward, we're doing a lot of really good preventative health programs in the preventative space and trying to diverge 911 calls that really shouldn't be going to 911. But we also need to think about the fact that the city is still growing. There's a lot of plans for development, and we need to figure out how we can enhance existing capacity in the in the form of more firehouses and units long-term, because as you see with these capital expenditures, it takes a long time to build a brand new firehouse or acquire a lot of these units as there's long build times.
Okay. And can you talk about from a operational perspective of FEMS staff, why new trucks are very important?
Yeah, because it's really, I mean, these are very specialized pieces of equipment. So when you're inside a fire, you don't want, you want an apparatus to be functioning effectively so you don't lose your supply of water, or that make sure your aerial ladder truck can actually remain right and is working functionally, and that you just have equipment in good working condition to do the job. And then also we're constantly operating in high temperatures. So if you're riding around in an older apparatus, just the temperatures inside the cab are heating up, especially in the summer months. And just from a safety standpoint, making sure it brakes well, it steers well, you can maneuver around whatever you need to move around when you're going on these emergency responses.
Okay, thank you. And lastly, you mentioned the kind of safety supports that you and your members continue to advocate for. Are there any components of this budget that get you closer to that goal?
I think there's a lot of stuff like we mentioned, these personal escape systems, which, as we've discussed, these are rope systems that our members can use to bail out of buildings. And previously we've gotten these issued by riding position, but now they'll be issued to the individual member with this enhancement, which is great. The technology is constantly evolving in terms of our structural firefighting PPE that protects us from heat and exposure to carcinogens and all of these other things. So I think it's really important that we're purchasing the most up-to-date PPE for our members. I was talking about temperature as well, right? This newer gear cools the members off faster when they leave a fire. We're talking about gear that's warm if you wear it in the wintertime outside. So imagine wearing that in the summer months and then going into a fire. Your body heat's going to go up, and that's going to put a lot of strain on a member's health. So it's important that we maintain good physical fitness and are able to deal with those issues.
Thank you so much. Thank you both, and thank you for all of the work that you do. And I want to extend my thanks to all of your members as well, and for their incredible service.
Thank you.
That concludes our public witnesses for FEMS. I'd now like to turn to our government witness, John Donnelly, the Chief of Fire and Emergency Medical Services. Welcome, Chief. And if you have any members of your team who will be offering answers or testimony, if I can ask you to turn your mic on and introduce yourself and your title.
Dan Proudfoot, Agency Fiscal Officer.
I'm sorry, can you see your last name again?
Proudfoot.
Thank you.
Jim Hansen, Assistant Fire Chief.
Great, thank you. And as the chief knows and is ready, it is the tradition of this committee to swear in all government witnesses who appear before it. If I can ask you to turn your microphones on. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you all. Please take a seat. I'd now like to invite you, Chief Donnelly, to make any opening statement you may have.
Good morning, Chairperson Pinto, council members, and staff. I am John Donnelly, Chief of the District of Columbia Fire and Emergency Medical Services Department, and I am pleased to testify in support of Mayor Muriel Bowser's fiscal year 2025 budget. For those of you watching from home, my testimony is available on our website at fems.dc.gov. The fiscal year 25 Fair Shot proposed budget and financial plan reflects many strategic investments and shared sacrifices across our government, with an emphasis on addressing a confluence of post-COVID factors and driving economic growth. The administration's FY25 investments were approached soberly and with financial prudence and guided by strategic principles to ensure we strike the right balance between investments and sacrifice. To this end, the Fire and EMS Department is aligned with the Mayor's vision to maintain and enhance core services, preserve investments that protect health and safety, and focus on new catalytic investments that center on public safety, education, and the downtown. We are fortunate that even in tight times, the district remains well-resourced and able to continue to deliver world-class programs and services. Before I begin, I would like to recognize and thank the committed employees of DC Fire and EMS for their care and diligence in delivering services to the residents and visitors of the District of Columbia. The hard work and dedication of the nearly 2,300 employees of DC's bravest, firefighters, EMTs, firefighter paramedics, and civilians has earned our department the trust that is the basis for the significant investments the mayor has proposed. The FY25 proposed gross operating budget for the department is a little over $369 million, which funds 2,268 and a half employees. This is a 12.9% increase over the fiscal year 24 approved gross budget of $327 million. The budget is comprised of $302 million in local funds and $67 million in federal resources. The proposed local funds budget includes an increase of $12.4 million in enhancements and $27.2 million to align personal services and fringe benefits with projected costs. It also includes one new FTE and a shift of 8 existing FTEs from federal to local resources. The following is a summary of our operating budget enhancements. The first one is for personal protective equipment, or $4.8 million. The mayor allocated a one-time enhancement of $4.8 million for personal protective equipment. This investment will enable the department to provide personnel with necessary safety gear and equipment to enter immediately dangerous to life and health environments and perform firefighting activities while protecting their personal safety. Firefighters are exposed to highly toxic substances, including a variety of carcinogens on the fire ground and more insidiously, an increasing range of infectious pathogens while caring for patients at different emergency incidents. Structural PPE is among the most critical element used by every firefighter, EMT, and firefighter paramedic, providing protection from thermal, physical, environmental, and bloodborne pathogen hazards encountered during structural and proximity firefighting operations and emergency medical situations. Structural PPE is also the primary physical protection for firefighters from exposure to cancer-causing products of combustion. Firefighting PPE is sized for each individual firefighter and must be replaced at regular intervals. Each firefighter is assigned 2 complete sets of PPE to allow for regular cleaning and to account for the possibility of catastrophic destruction of one set during or immediately after fire or terrorist operations. This investment in the purchase and replacement of structural firefighting gear is not only in accordance with the Local 36 collective bargaining agreement, but is also consistent with manufacturer and National Fire Protection Association standards. The second investment is the District of Columbia Paramedic School operating support for $842,000. The department continues to lead an effort to develop a District of Columbia Paramedic School. In fiscal year 25, Mayor Bowser invested additional operations support and 1 FTE to support this effort. This enhancement is an example of our city's commitment to prioritizing programs that advance equity by preparing residents for solid middle-class healthcare professional careers. The department began preparations for the paramedic school as part of the FY24 budget process, and since October 1, we have been able to develop a vision and create the building blocks toward this effort. A critical part of this process has been gaining a deeper understanding of the current paramedic landscape, both locally and nationally, along with greater appreciation of our local university partners' interests and experiences. We are collaborating with stakeholders to train the next generation of homegrown paramedics in the District of Columbia. In the interim to establishing a program, approximately 20 existing fire and EMS members have started or are about to start their paramedic training using funds provided by the mayor and council. Our effort is not limited to existing members, however, and a critical marker of success will be the training of district residents not currently part of fire and EMS. The third enhancement is the service to maintain fire hydrants of 6.7 million. The department's FY 25 budget submission also includes an additional payment to DC Water for fire protection fees to cover the service and maintenance of the district's fire hydrant water supply and use. DC Water assesses this fee based on a rate study. In our capital budget, the department's capital budget for FY 25 includes funding sufficient for apparatus purchases consistent with the department's apparatus replacement plan. The department continues to invest in fire apparatus engineered and built to provide maximum safety, longevity, and durability. These state-of-the-art vehicles allow us to provide maximum water flow for building fires and the ability of our ladders to reach 100 feet into our high-rise occupancies. The capital improvement plan continues to fund specialty vehicles such as a mobile command unit and mass decontamination units as well. The department has incorporated green idle reduction technology to conserve fuel, reduce operating costs, improve operating safety and comfort, and protect the environment in all new ambulance purchases since 2021. We are also pleased that the capital budget again funds the department's scheduled capital improvements program, which provides the basis for station improvements at existing firehouses. Our firehouses are operated on a 24/7 basis and are subject to significant wear and tear. This funding has been critical in ensuring our members are safe and comfortable in these stations. Chairperson Pinto, thank you for the opportunity to testify on the department's FY 25 proposed budget. The resources allocated by the mayor will enable us to continue the life-saving work of the fire and EMS department. The council and this committee are critical allies in this effort, and I appreciate the work that you do to ensure we operate a world-class department. I look forward to our continued collaboration as we do, and we are available to answer any questions you may have.
Wonderful. Thank you so much, Chief Donnelly, and thank you to you and your entire team for your continued partnership, and to all of the members of FEMS for your incredible public service. We're very grateful for all of you. I want to start with the paramedic training program, and this is something that last year in the budget was a big priority for you, was a big win for you all. And so I want to get a sense of kind of what progress has been made so far. And this proposal for the increase of 192,000 and an additional FTE to support the paramedic training school, how will that kind of aid in moving forward the plan?
Absolutely. So what we learned is that we want to move fast, and our university partners each of the universities is a bit of a monolith. We put out right after the new budget came in a request for proposals to each of the universities. We worked with each of them and found from our university partners that there's a lot of interest, but nobody submitted a proposal. Our timeline was too short for them. They also have to do strategic planning in terms of what this takes, and starting a new program from scratch is a heavy lift. So there's some challenges there. I think what we also got from the questions was they're going to need more support from us than we had originally proposed. I would say that that's not totally unexpected. We went in asking for everything, and they want more. And that makes sense, right? This program is going to have to work closely with DC Fire and EMS if it's going to be successful for the long term. So that's what this new investment is about. It's about making sure the resources are in place that we can accommodate working with them. What we did find is that there are two programs that are not starting from scratch, and we're working closely with both of them to see if we can move forward toward the finish line, and we really hope we can get there soon. In the meantime, we've found out how much interest we have on a very short turnaround. We have 41 employees apply to attend a program at George Washington University, which is part of a regional collaboration. And it's sort of a different work schedule for us. So to get 41 people real quick was interesting. We've also been getting a lot of interest from the community about how to do this. So we know the support, the need is there, and we're gonna keep pushing it to the finish line, but we need the money to do it.
Got it. Okay, thank you. And if I'm reading this correctly, the agency's FEMS and MPD Training Academy has a proposed funding increase of 1.6 million. but the paramedic training program has a proposed budget of 842,000. So what's the plan to spend that,
Which one are you looking at? I'm sorry.
the training academy funding? I have that as 1.6 million.
Dan. I'm gonna ask Dan to look at that.
Yeah, sure. Are you referring to the capital or operating budget on the training academy?
The capital.
So that would, yeah, the capital investment for the training academy redevelopment study is an increase. It's at 6.75 million in the mayor's proposed, which leaves it flat from the last capital budget. In terms of operating, that's separate. And the training academy funding for that is, as you referenced, 841,000 total, which includes about 640,000, I believe, for NPS and the remaining for PS for a paramedic school program director.
So the 1.6 in the MBD fire is part of that study, I believe, right? It's the study to fit that Ms. Moore was referencing, the changes that need to happen to bring both, it's really both MPD and Fires Academy up from the past and to a current well-funded, well-located place that we want to train our people in. And it's for the study to get that so we can get to what a price is for a longer-term investment.
How much is the study going to cost?
Yeah.
So we've actually already, we've already done the study. The next step is to submit a RFP, or a DGS is going to submit an RFP on our behalf and MPD to hire an architecture and an engineering firm, and they're going to be able to provide us with a price of what the project will cost.
So it's architectural work that's in that 1.6 million, and I think you're seeing that coupled with some more money from MPD. Is that what you're seeing? Right. That whole project is that work.
I don't totally follow, but we will, we can follow up to make sure I'm reading that correctly. So the proposed budget includes $4.8 million in the agency management program to support the purchase and replacement of PPE. How did you get to that number? What will that accommodate?
Jim, do you want to talk about that?
So a set of PPE costs approximately $5,400, and each firefighter is equipped with 2 sets of PPE. We have a 10-year life cycle that we follow. The NFPA is a requirement for firefighting PPE, and we track all of the PPE across the department, which is roughly 15,000 individual components. And so we've got a great team over at logistics. They're tracking all of the inventory, they're tracking the distribution, they're tracking the issuance. And based off of our numbers, we know that we've got between 500 and 600 sets worth of gear that we've got to replace. And then that's in addition to whatever gear is required for the new recruits.
And what gear may get destroyed during the course of the year, which happens. And also included in that 4.0 is the personal escape systems that the union president referenced. And those are harnesses and rope.
Right. Okay. So that's all part of that 4.8.
Yes, ma'am.
Okay. Well, I am thrilled to see that in there. I know that's something that members in the union have been hoping for quite some time. So that's great news. How many FTEs total do you have at FEMS?
I think we're at 2349 this year.
Okay. Thank you. So for some of the capital investments, can you elaborate on the MOU between DC Fire and EMS and DC Water and the $6.7 million enhancement for service and maintenance of fire hydrants?
So, yes, the MOU provides for testing and service replacement upgrades to water system. It's sort of a water system maintenance for the fire hydrants. And it's based on a cost study that DC Water does. And in a lot of ways, it's a pass-through in our budget to make sure that we have water system that supplies firefighting capabilities across the city. So it's critical infrastructure, it's capital type investment, but it's all about the hydrants.
Okay. And Does that differ from the arrangement that you currently have with DC Water?
So it does. The only difference is that it's going to cost more. This is reevaluated every 3 years, and that, just like we've seen prices and everything, there's a pretty significant jump in price of the difference there, $6 million.
Okay. So will that be a one-time?
I know that's moving forward.
That'll be every year. Okay. So in terms of revamping, remodeling, renovating, bless you, the existing firehouses and making sure that everybody is working in habitable and clean and warm and cool environments. I want to get an update on kind of the overall improvements that are coming to firehouses, but in particular, 1617 U Street is a location that is currently undergoing kind of zoning review for DMPSJ that is looking into other developments around housing for that site. But on the first floor is fire and MPD. And it's my understanding, and yesterday I asked Chief Smith about this, of if there were renovations to the building, where would fire and MPD go during the renovation plan? Because it is my expectation that fire and EMS would be there after the renovation. And MPD said that during the renovations of MPD, they would move into the fire location. So where would fire go in that case?
So we worked closely with DMPSJ. I think right now the project is on hold, but we gave them some locations that we could work with, and they provided them to us as well to move the firehouse, because we know this is going to be a long-term project. Some of the firehouse renovations we do are, short in a year, and we can shift, move them to another firehouse. In this case, it's probably a multi-year project. And so we wanted to find a semi-permanent home for them until the firehouse is rebuilt on the site.
Why would this project take so much longer than others?
It's a sizable project. I don't know, actually.
Okay.
So I'm going to retract that. I don't know how long it's going to take, but it seems like it's a big project.
So when you say a couple of years, we don't know if that means 24 months or 40 months or.
So I don't think we have a scope of the project that's going in there at this point.
Right.
So it's sort of conjecture, but assuming that it's a 10-story building, right? Like the fire department, the police department on the first floor and 5 stories of parking underneath or something like that. That's a pretty substantial project. I don't know how long that'd take, but we need to know more about it. And for planning, for the fire department's purposes, we want to make sure that we're able to provide services in the community from as close to the same location as we can, so there's not a real change in that. And that's what we're looking for. And we work with DMPSJ when they're doing the development to bear that cost by the builder, so that the cost isn't borne directly by the district.
Mm-hmm.
So that's something we're following, but we're not anywhere near close on that, as best I understand.
Got it. Okay. Well, with my Ward 2 hat on,
I understand.
let me just say it is extremely important to the community around there to maintain their proximity to you all. And that has been one of the most consistent pieces of feedback I've heard with the project, whether people are supportive of the project or not supportive of the project. What everybody agrees on is they want fire and MPD there or very close by and returning there following the renovation. So I just want to make sure we stay on top of that.
The location's important. It covers a very busy area. It is a busy firehouse. It does a lot of great work, and we agree we need to be there.
Okay, thank you. So any other updates you can share on other firehouses renovations?
Sure, I'm going to let Chief Hansen brag about the work they're doing.
Great.
So our facilities division has a small cap budget, and they're doing upgrades to firehouses, whether it's kitchen renovations, exhaust systems to remove the diesel exhaust from the fire department or from the firehouse. And we do them in different battalions throughout the year. Right now, I think we have engine 3, engine 12, and I can't think of the other one, but we're constantly doing about 3 firehouses a year when we're upgrading the kitchen equipment and making it up to code and things of that nature. Larger projects like engine 26 and engine 7, we're still working with architects on design. And then also with engine 26, we're working with DGS to put an RFP out for, actually an RFS for space. So something we did similar at Engine 27, which was working with existing landowners to find a suitable location that has a better response zone that covers more of the area that Engine 26 has right now. It's more centrally located. So we're working with DGS on that.
Okay, great. Thank you. So is the plan to have all of the firehouses updated, innovated over the next several years, or how?
So we actually, we use Salesforce, and we track every firehouse and every piece of equipment in each firehouse when it comes down to like a dishwasher and a serial number and how old it is and how many times it's been repaired. And that helps us sort of guide what we're going to spend our money on per year. And every year is different, but basically it's about 3 firehouses a year is what this current capital small cap supports. And then all of the smaller, whether it's apparatus stores, they need to be replaced because, you know, they're obviously opening and closing multiple times through the day, 24 hours a day. So things like that.
And we're doing, I think, important things when we're able to renovate a firehouse completely, like move people out, redo it, rebuild it. We're adding space for the future. Right now, all of our firehouses, all of our older firehouses are space constrained. So when we talk about expanding services, we don't necessarily have space to do that, at least in the way that we could. So we're building firehouses for the future that not only have the space we need, but they also take care of things like we want to have a workforce that has more women in it. So we need facilities that can accommodate a workforce that has a lot more women in it than our current facilities.
Thank you. I want to ask about staffing kind of more generally. So there's 17 new proposed FTEs in the fire rescue EMS operations division. How does that relate to any other reductions that we're seeing in FTEs in other departments? or
Yeah,
divisions?
I can help clarify that. So the table 4 in the budget book, which I know has lots of ins and outs, and I heard MPD's response yesterday, and I'll give a similar one, which is because they're snapshots in time, you know, you take data on October, November of one year, and then you're taking data October, November of the other. With both MPD and fire, you have folks going in and out of the training academy a lot. So that's what you see there. You'll see a big decrease in training. That's not really a decrease of 15 FTEs in training. You see almost the exact same increase to operations. And so it just depends on when the snapshot's taken, but folks' positions are always essentially moving between, you know, as soon as they come out of the training academy, they go into operations or somewhere else. If there's a vacancy in operations, and then we have a recruit class coming in, then that position gets shifted down to the training academy. So that's sort of mirroring MPD's response there.
Okay, and is that also true of the proposed reduction for hazmat and fireboat FTEs?
I think there's from moving sergeants.
Yeah, that could be the case are you talking under special operations?
Yes.
Yeah, that could be during the year. There could have been some potential FTE shifts within the department, and that would be captured as a reduction. It's not really a reduction to the overall FTE count. The FTEs increased this year by 1.5.
But in your example of the training academy, that makes sense going one way, but why would that be reflected as a snapshot once people are trained?
Because there's still shifts within the department. So different bureaus, departments, divisions, and they're reflected as programs here. But you know, there are shifts within the department that happen. They move FTEs like every 2 weeks. So
I'd say some of these are sort of echoes of the process. What I can say is that we're not cutting any positions in operations to move out of operations and then have to do that. We're trying to get all the people we can in operations so that we don't have mandatory overtime, which is a huge impact on our employees. We've seen about a 6% reduction this year in our overtime. That's mostly a product of the hiring we've been doing and the ability to fill the vacancies we have. So I understand what the budget book sometimes tells us, that we're not moving. We're not doing anything substantial.
Okay. Okay.
Yeah,
Thank
maybe a manager somewhere, but
how many vacancies do you currently have?
then you got it.
Total vacancies is 86, which is a 3.8% vacancy
As of what date?
rate. This is as of 2 weeks ago,
What percent did you say?
3.8%.
And we have another class starting in August, July and August with the adult class starting then, and we expect to fill those with.
Okay. And as we think about projecting overtime accurately, are fire trends consistent year over year? How can we kind of account for what we anticipate will happen and what the need will be to better staff and then reduce overtime spending?
So I think that what you said, right, is the answer, that clearing our vacancies helps a lot. That we have a pretty predictable overtime rate, and even though it may look like that in the past, or it may look like there was a big jump when the new union contract went into place, a lot of that's about compensation. So you know, we're working to reduce it. We're working to fill all our vacancies. In terms of responses, don't drive overtime necessarily. What drives it is having people in the seats where we need to have them. It takes a minimum number of people to operate a fire truck, and we can't operate below that safely.
But even those people in the seats, I imagine, can be projected out.
Yes, they are.
So where were we last year and what we projected for overtime versus what has actually been spent so far this year?
So I'm not quite following your question. Could you?
So how much did we project in fiscal year 24 for overtime spending?
You mean, did we budget or did we
Did we budget?
we
Think of
budgeted
those
22.5?
22.5
Correct.
million.
Correct.
Okay. And so we're about halfway through the fiscal year. How much have we spent?
So far this year, we've spent 17.4, although we plan on adjusting that and moving some off to Medicaid when we get additional revenue in from Medicaid.
Okay. So we're far more than halfway through what we budgeted for, and we're halfway through the year. So that's what I'm trying to understand is, as we think about this next year, are there ways that we can more accurately project what we need to budget for so that you don't have to deal with reprogrammings or other shifts during the course of the year?
Yeah, so as the chief, and I think Amy mentioned earlier, the best thing the fire department can do is just hire more people. It's always cheaper. And they've got, I think, 140 folks in right now that are going to be coming out at some point over the next year. In the short term, that actually increases over time, because as the gentleman earlier mentioned, you know, you have to detail folks down to the training academy for classes sometimes. And so that's on overtime. So it's sort of a short-term overtime hit. And then next fiscal year, I do anticipate a significant drop. I haven't run that specific number, but our goal really in working with recruiting and training is to get up all of the uniform vacancies. So that 86 number I gave you before is all vacancies. It's more like 53 for the uniform operations where we can fill those seats. We always have to hold about 20 for the cadet class that comes out. So that nets you about 30, but then we lose about 4 pay period as well. So the just talked to the training academy this morning. They said they can accommodate a class of, I think, around 70 or 80 if needed. Now, I don't think we're going to get that high. We're not going to have that many vacancies, but the department's in a unique and great position of being able to use up every vacancy they can. This is a new problem to have, if you will, that they're really looking under couch cushions for positions, and that has an immediate impact on overtime.
Okay.
Once they come out of the training academy.
Right. Why is the people coming from the department to help with training taken from overtime? Why isn't that accounted for in regular staff functions?
The staffing at so when you do recruits training, it isn't a year-round thing. It's a partial time frame. The other thing we do is we use a wide variety of instructors to teach class, meaning people are teaching in the areas that they have particular excellence in. So hiring essentially a bunch or of teachers, whether they're firefighter teachers or wouldn't necessarily give us the best training environment and the best outcomes that we want. So because you're training for 13 weeks at a time with a recruit class in fire school, you'll have a variety of people come in to teach that different portions of that. Same thing for the 20 weeks of EMS training. So in theory, you could just do it with professional type instructors. I don't think the reality is that that's the best way to do it.
Is that something that's negotiated as part of the union contract, that those being called upon for your additional expertise to participate in training will be considered overtime?
So any hours they work over their regular schedule are considered overtime. So that portion is negotiated in the contract.
Got it. Okay, thank you. So in terms of some other grants that may be available from the federal government, do we apply for grants, the firefighters grant or the federal SAFER grant?
So we historically, yes, we've applied for both of those
Okay.
at different times. We are currently working on a SAFER grant because that one's open. One of the important things to remember about the SAFER grant is that it is for new positions, right? It's not offloading current salaries. So, and it's not a forever funding pool. The current funding provision is for 3 years. So we're looking at that. We do AFG grants. We do in the AFG grants, the Assistance to Firefighters grants cover safety and health. And then there's another one for fire prevention. And depending on what the needs are and what the program priorities are, a lot of times those are things we're already doing. And SAFER's been a particular challenge in that. That grant is really about getting 4 people on a fire truck and getting an assembled firefighting force at a house fire in a suburban community. We well exceed those numbers every day.
Mm-hmm.
So it's a bit of a challenge for us. We have been successful in the past with a SAFER grant in getting those to add staffing, but it is challenging. We started out by saying we're well resourced, but there's other things we'd like to do. So we're looking at that angle in this year's SAFER grant to see if there's an opportunity. It's not a program priority though, so I don't want to overpromise.
Okay, so you said we're looking at it. That's not, you haven't applied for it?
It's still open. The
Okay.
closing date hasn't written yet, and I haven't seen the final product to make sure that it is something we can do. But we're working across our whole agency to put the pieces together. It's a complicated process.
Gotcha. Okay, thank you. Well, that concludes my questions for you all. As always, Chief, I want to give you a chance if you want to have any closing thoughts or want to highlight something we didn't get a chance to cover.
First, I'd like to say thank you for the opportunity. We have an amazing team that's working very hard across the agency to be out there every day. I think the quote from the CA was appropriate. When I heard that, it's an age, all of us are working very hard to be there. Most importantly, I'm proud of what the work our people are doing, and I'm proud of the efforts that over the last couple of years we've been able to make to support their health. And supporting their health isn't only making sure that they get the care they need when they're having a crisis, but the things we've done to build out peer support, to build out having some mental health professionals and access to that is really important. At the same time, we've got some funding to help them with their fitness. We use O2X for all of that. That core group of that sort of triad of mental health, of taking care of injuries and taking care of your fitness really is the most important thing we can do for our people. So I'm proud of that, and I'm proud that they're taking advantage of it.
Fantastic. Well, thank you very much, Chief Donnelly. Thank you everyone for being here today. And we are ready to move on to our next agency. Appreciate it all. Thank you. Okay, we are going to turn to our 4th agency of today, the Corrections Information Council. We are going to hear from our public witnesses first. We are joined in person today by Darby Hickey and online by Melissa Wasser. Darby is the only person in person today. Feel free to sit wherever you're comfortable. And Melissa Wasser, please accept the invitation to join as a panelist. All right, we will start with Darby Hickey, Policy Counsel from the DC Justice Lab.
Thank you, council member. I got it right. Good afternoon, Councilmember Pinto, members of the committee and staff. Thank you for the opportunity to testify today. As you stated, my name is Darby Hickey. I'm Policy Counsel for the DC Justice Lab and a resident of Ward 4. My testimony today, right now, will focus on the critical need for improving conditions for our neighbors at the DOC facilities by strengthening the Corrections Information Council's oversight. DC Justice Lab urges this committee to fully fund the Corrections Oversight Improvement Omnibus Amendment Act as per the law's fiscal impact statement. For this law to become fully effective, the budget for the CIC requires a $353,000 enhancement, and the DOC budget requires a $222,000 enhancement. This funding request is supported by the Fair Budget Coalition because safety is improving oversight of the jails. The Oversight Act was passed to expand oversight and strengthen the CIC's independence. Every personal story, government report, and lawsuit exposing the deplorable conditions of the DC jails reiterates the need for funding this law. The Oversight Act requires greater investigation and reporting by the CIC regarding deaths at the jails and correction officers' use of force. This is critical in light of the lack of transparency around jail deaths and the mishandling of grievances about officer violence documented by the Office of the Inspector General. The bill also requires more oversight of the use of safe cells and solitary confinement at DOC. This is critical because the DOC has historically used these practices at much higher rates than the national average and fails to provide the public with important information about them, as noted by the Council for Court Excellence earlier this year. Councilmember Pinto, by funding fully the Oversight Act, you will also continue your work to improve the food at the jails because the law requires the CIC to investigate the DOC food service program. As you know, residents of the DC jails have reported the food to be insufficient in quantity, rotten, vermin-infested, culturally and religiously incorrect, or even withheld as punishment. So funding this law would advance key goals of your Fresh Starts Act. We understand that CIC is undertaking some of this work under its current budget, but additional funding would accomplish the full promise of the Oversight Act. With funding, the law would result in more inspections by the CIC of DOC facilities, which will help improve conditions. But even absent the funding for the Act, the CIC should use its existing resources to conduct unannounced inspections. It is our understanding that CIC currently gives the DOC ample notice before an inspection, reducing the efficacy of this oversight tool. The conditions at the jails harm the residents physically and mentally, contributing to the criminogenic effects of incarceration. Please support improved public safety by funding greater oversight through the CIC. Thank you.
Thank you. Next, we'll hear from Melissa Wasser, ACLU DC.
Good afternoon, Chair Pinto and members of the committee. My name is Melissa Wasser. I use she, her pronouns, and I'm the policy counsel at the ACLU of DC. There are three issues that the council needs to address during this budget season. First, fully funding the Corrections Oversight Improvement Omnibus Amendment Act of 2022. Second, holding a hearing and passing the Erased Solitary Confinement Act of 2023. And three, fully passing and funding the Fresh Starts Act. We also urge this committee to fully fund CJCC to complete the pretrial detention efficacy study as mandated by Secure DC. And we also want this committee to create an inclusive process for directly impacted residents housed in DOC facilities to participate in these important council hearings year-round. While we're deeply disappointed that the Corrections Oversight Omnibus was not funded in the mayor's proposed budget, we strongly urge this committee to fund this bill so agencies can begin implementation in fiscal year 25. The council needs to fund DOC with an additional $225,000 and CIC with an additional $361,000 to ensure that these agencies can carry out their mandates effectively. ACLU DC is also a proud member of the Unlock the Box DC Coalition, part of a national advocacy campaign aimed at ending solitary confinement nationwide. The council has an opportunity to become a national leader in ending solitary confinement by holding a hearing, passing and funding the Erase Solitary Confinement Act of 2023. Introduced by Councilmember Nadeau and 7 council colleagues, Erase Solitary would prohibit nearly all forms of segregated confinement for individuals incarcerated at penal institutions owned, operated, and controlled by DOC. We urge this committee to hold a public hearing on Erase Solitary and pass this legislation before the end of the council period. Once passed, we urge that this bill should be fully funded. There's also widespread support for ending solitary confinement at the DC jail. ACLU DC recently conducted a survey of 500 likely 2024 DC general election voters and found a solid 55% majority of DC voters oppose the use of solitary confinement. That support increases to 62% when voters learn more about the experience of solitary confinement, and that support jumps to 70% when voters learn that, quote, it does nothing to rehabilitate people and exacerbates or creates mental illness. Erase Solitary is not just a legislative change, but is a moral imperative to address systemic injustices and create a more equitable and effective justice system in DC. We urge this committee to hold a hearing soon. We also urge the council to fully pass and fund the Fresh Starts legislation and ensure that there are unannounced inspections of the food service and a requirement of additional reporting on nutrition and specialty meals, religious and otherwise, being provided at the jail. Both provisions are not currently included within Secure DC. In conclusion, we urge this council to fully fund the Corrections Oversight Improvement Omnibus Amendment Act of 2022, hold a hearing, pass and fund the Erase Solitary bill, and pass and fund the remaining portions of the Fresh Starts bill. We're ready to work with you and alongside community partners to fight for the right of everyone held at the jail to be treated humanely. I look forward to any questions you may have. Thank you.
Great. Thank you very much. Thank you both for being here and for your testimony. I'm interested in the kind of interrelationship that of Fresh Starts and improving the food quality and then the oversight need. And so I'm wondering if you can both speak to that, if there are pieces of Fresh Starts to ensure that the food quality is improved and that people have enough food and more nutrient dense food at the jail, and how that can be coupled with some of the components of the Corrections Oversight Improvement Amendment Act for the inspections piece. We can start with you, Darby.
Sure. Thank you so much, Councilmember. That's a great question. And our point exactly is that particularly with what you included in Section 32 of Secure DC, the requirements for the new, better food, more nutritious food, that's really important. But we also know that we need to have inspections to make sure that that's actually happening and that what's being said is going to be happening is showing up on the plates and trays of residents over there. And so that's why we see them as very natural counterparts, interplaying, like you said.
And thank you, Councilmember Pinto, for the question. And we would totally agree. I mean, I think funding the Corrections Oversight Omnibus just strengthens the Fresh Starts legislation. The committee should ensure that DOC provides timely, unrestricted access to locations where food is being prepared, consumed, or disposed of for oversight purposes. And again, we know that we've gone a long way with Fresh Starts, but we really do need those unannounced inspections of the food service and to make sure that we're taking the data. I heard you mention to other agencies that you're looking for this data and to see what kind of reporting we have on nutrition and specialty meals, especially religious and other meals at the jail that we currently don't have in the current version with Secure DC.
Great, thank you. And I want to ask you to Ms. Wasser about the Erase Solitary Confinement bill. And I hear you in the challenges that you raise about the use of this practice and the long-term effects. And I just have a very practical question from your perspective, whether you've seen it in other jurisdictions, on what you think a more appropriate follow-up is if there is a fight between residents in the same cell or the same block, or risk of suicide. When there isn't, if there wasn't an option to separate an individual, what would that follow-up look like to keep them and their fellow residents safe?
Yes, thank you so much for the question. So just to point out in the erase solitary bill, again, it would prohibit nearly all forms of segregated confinement, but the bill does include narrow and time-limited exceptions for medical isolation. That was something that was very important to us that we had worked on, and also for people at risk of self-harm. And so, we know the studies have shown, solitary confinement amounts to psychological torture, and even associations that represent corrections administrators across the country have said prolonged isolation of individuals in jails and prisons is a grave problem. And so we're seeing this in our nation's capital, and we really do have the chance to become a national leader with moving this erase solitary bill forward. And we'd be happy to work with you and the committee, and especially Councilmember Nadeau, to move that legislation forward, especially as a member of the DC Unlock the Box Coalition. And again, there's support for this. There's support for ending solitary confinement. It's going to jeopardize public safety if we continue to use it. It wastes taxpayer dollars. And again, it's inhumane and traumatic to the individuals who endure it. And so we want to make sure that the council can move forward this bill to address these systemic injustices and create a more equitable and effective justice system here in the district.
And I appreciate that so much. I do. I guess I'm just, what is the alternative if there is a safety dispute, let's say, or a fight or threats of suicide?
Well, so there are exceptions. There are narrow time limited exceptions in the bill right now for medical isolation and self-harm. And again, we'd be happy to work with you and Councilmember Nadeau, hopefully once we get a hearing, to improve the bill and make sure that there are exceptions. But we just want to make sure that we are not subjecting folks to this 23 hours a day being in their cell by themselves. The bill also, it limits the use of safe cells. It mandates that all residents in a DOC facility would receive at least 8 hours of out of cell time per day. And so again, with those narrow and time limited exceptions, we believe that would address most of these issues. But again, we're happy to work with you as the bill moves forward.
Thank you very much. Thank you both. We are going to call one more virtual public witness for this. Oh, in-person public witness. Damon Donaldson Bay. Hi. Welcome, Mr. Bay.
Hello.
Hi, and your mic is on.
I'll be brief. Hello, everyone. Hello, Chairwoman Pinto and other members in attendance. I thank you all for the opportunity for allowing me to share my testimony. My name is Damon Donaldson Bay, and I'm an advocate for Unlock the Box, and that's DC's coalition struggle to end solitary confinement within the Department of Corrections, and I'm also a member of the Thrive Under 25 Coalition. I was housed in DC Department of Corrections as recently as March of this year. I was in the South 2 intake unit. Now, the only difference between the intake unit and solitary confinement is that there are 2 people in the cell instead of 1. The conditions are still the same. The harshness is still the same. The tiny confined space is still the same. But just like solitary confinement, we don't have access to rec, we don't have access to religious services, and we don't have access to programming. In fact, we were in our cell 21 hours, 23 hours, and out 1, just like solitary confinement. I mean, like, people on death row are getting more rec than the people in solitary confinement and intake in the DC Department of Corrections. So after 8 days of being housed there, I'm convinced that not only are conditions worse than are they as bad as we previously reported, but they are even worse. Right? It's like a third world country over there. I'm talking about mold infested cells, people getting moved around. They're taking mold infested cells, scraping mold off the wall and putting bleach on it and painting over it. Like, that's not going to work. Like, the jail has been there 48 years. It's got to be in the foundation, right? You had cells that were without hot water. You had some cells that didn't have water at all. It was like inhumane. It was like an indecent experience, right? Now, according to the DOC policy, they're supposed to give us 2 hot meals and 1 cold meal per day. But every meal that comes through the slide is cold because it's sitting in the hallway for hours. I mean, nobody's overseeing it. It's not being heated at the proper degrees. Like, it's a lot that's going on. And it's just sitting in the hallway, sitting there, right? And when we get a cold meal, it's like bologna, processed meal, and like a little blob of gloop. So like the quality and the quantity of it can't be up to standards, but we can't compare them because we don't have no list of what the standards are supposed to be. They're not even giving out handbooks over there. We're not getting no soap. They're not giving out no socks. They're not giving out no underwear. They're not trading no sheets. And when I got there, the people said they hadn't had them done in 2 weeks. I'm like, what's going on around here? I'm asking people, no books, no nothing. I'm like, it's a third world country over there. Like, we're not even getting the basic necessities. So it's not a matter of asking to improve something about the conditions, right? It's the basics aren't being pushed. First, they're not even doing what they're supposed to be doing first, much less improving the conditions. So that's something that we have to work on. This is why it's important for us to introduce the Erase Act. This is why it's important for us to have a hearing on it. This is why conditions at the solitary confinement space need to be improved. This is why the officers there should be wearing body cams so that we can have a monitoring of everything that's going on there, because they say one thing and then the person in the cell says something else and nobody's there to find out who's telling the truth if it's not recorded. So that should be a simple fix. And it's a lot of things, right? We would never offer none of these things. Access to staff, the grievance process is not being regarded. Like, there are people there that say we're waiting to get processed and you've been here 2 months. Like, how are you still on intake 2 months, right? So there's a lack of training among the staff. There's a high level of disrespect between the staff and the prisoners. And I think that the staff members should be made to attend some type of workshop or training session so they can be trained on how to properly conduct themselves, because they're very unprofessional. Some of the stuff that they said over there to me, I can't even say in the hearing, right? The conditions at DC jail have not changed much over the last 30, 35 years, and we need a more efficient and effective oversight of the Department of Corrections. So we're asking y'all to just force them to follow the rules and the guidelines that are already in place, and then help them to implement safe and more effective alternatives to solitary confinement. But regardless of the jurisdiction or under which the prisoner is housed, whether it's solitary confinement, whether it's intake, or whether it's this or whether it's that, torture is torture. I want to thank y'all for letting me share, and I want to thank y'all for your time, because time is very valuable. Peace.
Thank you very much, Mr. Bay. And thank you for sharing your experience. How long were you in the intake cell?
8 days, felt like 8 months.
And you were there with a roommate?
I was there with a roommate some of the time. So it was like the intake is interesting because it's revolving. So technically it's not solitary, but if you're there for 2 or 3 weeks, you'll probably have 3 or 4 different cellies. But majority of the time they're going back and forth to court, so you're there by yourself, you know? And it's constantly like, I'm talking about sleep deprivation. They're turning the lights on every 3 hours. Talking about, hey, we can't see what we count. Well, why are you turning the cell light on? You have overhead lights. Like sleep deprivation, they don't even let them do that in Guantanamo Bay no more. Like every 3 hours you're getting woke up, you're never going to get a good night's sleep. They said you got to have at least 6 hours of consecutive sleep. So I don't know what they're doing, but.
Did you ever complain to somebody there or ask for more services, necessities?
Verbal complaint, I'm talking about knocking on my door and then telling everything short of beating on my door. There is no grievance process because there's no paperwork to pass out. I keep pointing over there because this is how I was at the door. Hey, let me get a paper. And they never give you one. Or they say, hey, well, we're going to let somebody know. And then a different officer comes back. He's like, I don't know what you talk about. Like, who? And you in the cell. The only thing you can do is just bang on the door out of frustration, but nobody's going to come. The water don't work. Like, how can you even eat your meal with water? The water don't even work. They give you a little Kool-Aid pack. I can't even drink that. The water don't work. And it's just difficult. It's frustrating for the people under there. I could just feel their frustration. And I'm asking questions. Hey, so what's going on? I've been here 3 weeks. They haven't paid my time. And I'm like, calm down. First of all, people don't have passwords for the phone. They can't call their family. They can't get no money. Like, they starving over there. And then the CNP may come around once a week and say, oh, yeah, I'm going to classify some people today. It's 70 people to be classified. You seen 5 people today. Like, what's going on? If you go to South 2, cell 1 through 9, and go in there and look at them walls and say, hey, back in February, March, did they do something to this? You're going to see the mold probably growing back by now. It come back every 3, 4 months. If you wait about June, it's going to be there.
Oh, well, thank you very much for your testimony and sharing your perspective and experience. And we will certainly follow up with DOC when they join us about some of this.
And I think that we need all heads involved. I mean, we can have I don't think that all council people are going to be able to solve the problem for prisoners. They're going to have a collective of people with different minds and different approaches to solve this problem. It's not going to be a one fixed click, but there are things that need to be put into place. And I would love to work with y'all, helping y'all get it done. We have a team of people. I don't want to take up all y'all time though. Peace.
Thank you. Thank you very much. Thank you to all of our witnesses for the CIC. With that, I would like to call Donald Isaac, our government witness, who's the Executive Director of the Corrections Information Council. Welcome, Director Isaac. Thank you. And if you have members of your team joining you or answering questions, if I can ask that you both state your name and position for the record. Start with you. And
Hello.
make sure your microphone is on. Yep.
Hello, can you hear me?
Yes.
Okay, hello. I'm Nicole Ukebo, Deputy Executive Director.
Good afternoon, Chairwoman Ms. Pinto. I'm Archana Khare, Budget Officer, and I'm from the Office of Chief Financial Officer.
Great. Thank you all. It is the tradition of this committee to swear in all government witnesses who appear before it. So if I can ask you to raise your right hand. Do you swear or affirm under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth?
I do.
Thank you all. Please take a seat. And Director Isaac, I'd like to invite you to make any opening statement that you have.
Good afternoon, Chairwoman Pinto and other members of the Committee on the Judiciary and Public Safety. I am Donald Isaac, the Executive Director of the DC Corrections Information Council, commonly known as the CIC. Our current board members, Chairman Charles Thornton, Catherine Huffman, Nikichi Taafi, and Michelle Shannon, our newest addition, also join me in thanking you for your continued support. I want to make some comments that are a little different than the printed testimony that I've given you, so we will provide a revised testimony to you. And that is because of, as we heard in the last witnesses, we want to make a more compelling case for full funding for the implementation of the omnibus bill and the implications that it had on the CIC. The Corrections Information Council is an independent agency mandated by the federal and district legislation. The agency inspects, monitors, and reports on prisons, jails, and contract facilities that house District of Columbia residents who are under the jurisdiction of either the Bureau of Prisons or the Department of Corrections. We are required to travel and inspect facilities, which also perform daily functions such as researching, analyzing data, writing reports, disseminating information, and directly corresponding with incarcerated persons and their families. Our proposed budget for FY25 is $1,263,948. This budget supports 11 full-time employees, which is a reduction of one position. We're seeking a restoration of that position, which is $68,000. And the proposed budget also provides $48,000 in non-personal services, and we are requesting an additional $25,000 for the non-personal service budget. We are also, for the record, requesting the $361,000, which is a result of the fiscal impact for enhancements resulting from the fiscal impact performed by the fiscal analysis of the Omnibus Amendment Act of 2022. Our agency is small and does not have large-scale costs associated with capital budgets and programmatic operations. Our spending pressures are the result of new legislation when it is passed, and also the lean funding within our NPS budget. As of February 24th, for example, the agency has already spent $37,000 of the allocated $55,000. Comparatively, our proposed NPS budget for FY25 is $48,000. We are sensitive to the financial cuts throughout the entire district. However, this is an impactful reduction to an NPS budget that is already very conservative. With regard to the omnibus bill, the average daily population of incarcerated persons within DOC and the BOP have increased by 45% and 23% respectively, which undergirds the need for continuous oversight for monitoring. Such increases affect critical areas of the prison environment that are examined by the CIC, including but not limited to healthcare, food service, housing provisions, staffing requirements, and safety conditions. In order to adequately fulfill our federal and district mandate, which includes travel obligations, inspections, and report, the NPS budget would benefit by an additional $25,000. The CIC is requesting $68,000 to restore a position We are also requesting the $361,000 that has been identified through fiscal impact reviews about the fiscal impact on the office, which would result in a total increase of $454,000. With that, we thank you again for this opportunity to testify, and we are available for any questions that you might have for us as staff.
Great. Thank you so much, Director. And thank you to all you and your team do throughout the year. Let's start with the Omnibus Act and get a sense of kind of what that would mean in practice to implement. So what is the entire funding estimate for the implementation of that act?
$361,000.
Okay. And what would that mean in practice for your
In practice, I think it represented 2 full-time employees that would be additions to the staff. It would represent about $100,000 in consultant and professional fees that could be used to bring professional experts and expert witnesses into our inspection process. And I think a little small amount, maybe about $5,000 for the non-personal service budget. So that's $252, $104, and $5,000, which equals the total of $361.
Okay. And how would it affect your ability to most effectively carry out your mission in practice?
Well, as we indicated, the population inside of institutions is increasing, both on the local level and on the federal level. Therefore, with more people, many of the longstanding issues are increased in terms of their impact on those who are incarcerated, be it healthcare, be it food, be it other programming for reentry and other things of that nature. In addition to that, as we know within the District of Columbia, in addition to the issues about population and increase, there's just the issue of physical plant and the age of a physical plant and some of the challenges that creates, which kind of requires us to inspect on a more regular and consistent basis.
Mm-hmm. Okay. And over the course of the last year, how have your inspections been going? And as we think about this proposed budget, what does it equip you to do in furtherance of your mission?
Well, as we indicated in our performance hearing, we are very satisfied or gratified to at least say that we have operating MOUs with both the BOP and the DOC. We also have regular meetings with senior management in both the DOC and the BOP. We also have quarterly inspections that we are doing in both of those particular age, both on the federal level and also on the district level. In the federal level, just to give an indication, I think even this week we have a team that's in Atwater, which is all the way in California. So there's travel, logistics, and other things that are part of making sure that we cover the entire population of district residents who are in federal institutions. With regard to here locally, they're the same issues of medical care, issues of food. We just completed our most recent inspection with a focus on food based on concerns that we were hearing. We have interesting interaction with the new contractor there. I think the inspection prior to that, we made recommendations, and we're proud to say that to DOC about adjusting the lunch and dinner schedules and the meals that they were serving, which they graciously made those adjustments. So those are the kind of issues that we would like to see more continuation of the baseline that we've established, but also more increased interaction with both the persons who are inside the institutions, but also with the managers who run the institutions.
Thank you for that context. And what do you see as the key distinction between quarterly inspections versus unannounced visits?
Well, obviously, the best practice in the industry, you would want to have unannounced inspections. And we had a long and continuous tedious conversations with the DOC about implementing the law for unannounced inspections. We sort of come to a middle ground where we now are given a 12-hour notice. So of course, it offers for a more realistic assessment of what is going on. We were sensitive to the concerns expressed by the management about staffing and other logistics that they have to kind of take into account whenever we knock on the door. So we thought 12 hours. We started with unannounced. They started with 3 days, I think, and we ended somewhere for about 12 hours as a starting point, as we hopefully will move toward implementation of the law and the unannounced inspections.
So there's one additional FTE proposed in this budget. What effect will that have on your operations?
Well, that was a person, it would allow us to at least maintain the current level of operation. I should note, council member, that we have tried to the best of our ability to implement the requirements of the omnibus bill. As I said, the unannounced inspections, pushing to a more regular and consistent visitation schedules and all, inspection schedules and all with the existing staff. So any reduction in staff would certainly impact adversely our ability to just perform the legislative mandate that we have from both federal and district legislation.
Okay, and I want to clarify, I said increase, but it's a reduction right now of 1 FTE. Okay. In your testimony, you mentioned requesting additional $93,000 for this year. What is that request based on generally? And what is the requested increase of 25,000 for non-personnel to be used for?
Yeah. He wants to speak, so we'll let her speak.
I can speak. So to meet the mark they have.
And just to clarify, because we can of course hear each other, the microphones are so that the TV picks it up. Otherwise it won't pick up sound at all. Thank you.
Thank you. The one FT which has been reduced to meet the mark, that's what the agency is requesting for 68,000. And then on top of that, they are requesting 25,000 for their NPS. This is based on their historical spending for inspection and traveling.
And let me add to that for context. I'm glad we are really pulled up at that particular issue. The reason the position has gone unfilled, which has allowed it to be eliminated, was because we don't have enough money in our non-personal service budget to even do what we're mandated to do. So we actually, I think for the last 2 years, have had to try to use vacancy and lapses in the personal service budget to fund the non-personal service budget to do the very basic things that we have to do. I should have put that in the testimony.
Yeah, no, it's an important point. And when it comes to travel, how much money do you anticipate to accomplish and fulfill your mandate on a yearly basis?
Well, $100,000 would be a comfortable number, but I think we came in this year at about 70 with the additional 48 plus 25 would have just pushed us to 63, I believe, which was not even be adequate. That still is a bare bones budget, but I really think that closer to between $75,000 and $100,000 would be a good place for us in that particular category.
Doctor, have there been any additional steps towards progress of the MOU between the district and BOP to house people who are serving their time at BOP facilities to be within 500 miles or even closer of the District of Columbia?
No, not significantly. It has been an issue that we've discussed and brought up, and they kind of indicated that placements are based on classification and security of issues as well as preference of the district residents. Many times people might pick another facility because of its programming options, even though it might put them in a further distance away from the home base of the district. But that is an issue that we could bring up and begin to just revisit with the new director in a new administration.
Okay, thank you. Well, I would certainly appreciate that and would love to support you in that effort. I think it's really important for district residents and their families, for their dignity and also for their successful reentry and coming home to a place that is not across the country.
Absolutely.
So in terms of your quarterly inspections with DOC, what sorts of things have come up during those inspections and over the course of this past year? have there been improvements made to address some of the issues that you have raised?
I'll speak to that. Hello, can you hear me?
Yes.
Okay. So, when we hear concerns from constituents or people are calling in, we go in and we look at those areas. So, I know a concern had been like some of the maybe violence or things that were happening down at the facility that were undesirable. We've gone in, spoken to the DOC about measures that they've taken, and we've reported on those things in the inspection reports that we put out. Things that they're doing to kind of help curtail that violence include like different adjustments to their mail policies, like their mail secure policies, where they're implementing steps to help curtail, I guess, contraband coming in, and different technology, CellSense technology, that's kind of like a machine operated device that can kind of check people for presence of contraband, different cell shakedowns throughout the, the course of several times a week. We've also communicated different issues regarding people's concerns for a reduction in restrictive housing, and we've spoken to them about that. They've reported reductions in their restrictive housing population. There's also been some concerns in the past regarding the grievance procedures and policies. We've spoken with DOC about that and the different changes and adjustments that they're making. They're currently, at our last quarterly meeting, we spoke about that, and they're in the midst of making some adjustments to that so that they can be communicated to the population in a more widespread fashion.
Thank you. So just going back to this omnibus bill for a moment, I appreciate, Director, you laying out the kind of different cost estimates, but from your perspective of what would lead to the most improvements and what's most pressing, what is the most important piece if we had to only pick one or two components of the omnibus to fund that you think would make the biggest difference?
I think the staffing, I don't know, it's probably 6 of one and a half of another. The additional staffing would be helpful, but also the line item to allow for interaction with what we call experts and other persons in the industry, in pulling on their knowledge and expertise probably would be a missing piece that we don't have at the CIC. I'm proud to say that as we have fully staffed, or we have 20% or so of attorneys, 20% of data. There are persons who are, researchers and data oriented. We have people who are connected to the advocacy community in a real living way. And we have people who actually lived experience. So if I had to pick one area there that probably is one of the greatest areas for me to tap into, I would be to say expert witnesses, to begin to just develop this issue of best practices in this area of corrections. And as you know, we're one of few agencies who do inspections, so there's not a lot of it's not as much data to pull from as you find in other subject matter areas.
Mm-hmm. Okay, great. Well, thank you very much. And lastly, the testimony that we heard from Mr. Bay about his experience in intake. Have there been any efforts or any evidence that you all have found in your inspections around some of what he talked about, whether that's food being left out and cold, or failing to give DOC residents provision of basic necessities or sheets, socks, soap, water? Do you have a response to some of what he shared?
Of course, we hear complaints often, and very similar to that oftentimes as well. I can say that for a large part of first of all, having persons who have lived experience, I think gets us in a place where persons are willing to talk to us in a real way because they can identify with the persons who are doing the inspections. Two, I think that the lived experience also serves someone as a censor or screening process. Being incarcerated is not a pleasant procedure. And so there's a lot of different domains that can generate complaints. And then lastly, I can just say, and I've said this before, that for instance, one of our lead persons at for the Department of Corrections stands on the principle that once we identify a legitimate complaint, we immediately bring it to the direction of the agency. We don't wait to write a report. We don't go back and talk about it. And I can say, for the most part, we might have a different of approach, but for the most part, the agency has been very responsive in correcting or addressing immediate issues that we bring to their attention. Yeah, please do.
And I'd also like to add that our lead inspector on the DOC will be briefed with the concerns that we heard here today, because those were some of the issues that were examined during the last inspection, which was literally about 2 weeks ago. They went in, they looked at the food, looked at the kitchen. There were concerns communicated about the food coming back cold, and we were informed that, and our inspectors actually saw that they actually have trays that go onto the delivery cart, which are in fact heated and should keep the food warm if it's plugged in. And even if it's not plugged in, it should remain at a certain temperature just by nature of the materials from which it's constructed. So those are areas that we did take a look at, and we will have a report coming out and will be communicated to your office where we can kind of dive into that a little bit more deeply.
Thank you.
And we do plan to go deeper on the food issue. I've already talked to the director about wanting to conduct a survey where we begin to just solicit more information to begin to see what are the areas of improvement that we can find there.
Thank you so much, and would love to continue our work together on that. I think that food is so central to all of our needs. And in this environment, we have to make sure that we're feeding people nutritious and nutrient-dense food that will support their physical and mental well-being moving forward. So look forward to working with you all on that.
Absolutely.
That concludes my questions for you, Director, but I want to give you a chance if you have anything else you'd like to share that we didn't get to touch on or highlight for the record.
Not at this point, other than the fact that we will submit to you revised testimony, and we also will be attempting to stay in your ear about the CIC and its needs. We know you have a number of, competing elements, and we're sensitive to that, but we appreciate the attention and compassion and that sensitivity you've shown to this particular area.
Thank you, Director.
Absolutely.
Appreciate you and your team, and thank you again for all that you all do throughout the year to improve the DOC and BOP and make sure that all residents can live in dignity regardless of the circumstance they're in.
Absolutely.
Thank you.
Thank you so much.
Okay, we are moving on to our fifth and final agency of the day, the District Department of Corrections. We are first going to call Katarina Seminova, Special Counsel on Policy and Legislation for the Public Defender Service. We could do the full panel. We'll probably have some more questions for Ms. Seminova, but we can all sit. Darby Hickey, Rabbi Charles Feinberg, and Reggie Blackwood. Wonderful. Thank you all very much and welcome. We'll start with Katya Seminova, Special Counsel on Policy and Legislation for the Public Defender Service.
Good morning. I'm Katarina Seminova, Special Counsel to the Director on Policy and Legislation at the Public Defender Service. Thank you for the opportunity to testify today at this budget hearing for the Department of Corrections. Individuals in DOC custody continue to suffer abhorrent physical conditions: mold, rats, peeling paint, temperatures that are too cold or too hot, and abysmal food. They also suffer from the consequences of policy and budget decisions made by DOC. PDS's testimony will address some of these areas where these decisions are made. Legal visitation. Lawyers are spending hours waiting to see detained clients because for the first time in over 20 years, DOC has instituted a policy that clients can only be seen in the legal visitation area that is on the same floor as their housing unit. In the past, DOC residents were able to move escorted or unescorted between floors. Under the new policy, lawyers with clients who are housed on 3 different floors have to wait for a room on each of the floors. On a recent visit, one lawyer described hours of waiting while DOC officers stood around socializing in the visitation supervision area. DOC is letting legal visitation grind to a halt while more people are in detention and need to see their lawyers. The same problems that PDS identified in February persist for clients who are in disciplinary segregation. Clients in disciplinary segregation appear for legal visits in full shackles, including handcuffs, leg irons, a chain around their waist, meaning 5-point restraints to talk to a lawyer. This is physically painful. DOC's inhumane decision to shackle and handcuff residents also prevents them from reviewing documents and working with counsel. There are also not enough tablets available for DOC residents to review discovery in their cases. Some clients only get discovery tablets for a short period of time, and then their turn is up and they don't have another turn for discovery review again for weeks. This limited access deprives clients of a fair trial and of the information that they need to make informed decisions in their cases. With respect to programming, while DOC touts the availability of programming, that has not been the experience of many PDS clients. Many clients want to join programs, but due to their classification, their charge, or their disciplinary history, DOC says that they are not eligible for programming. For instance, individuals who are on a maximum custody level are not eligible to move to the programming blocks at CTF, such as Young Men Emerging. There are extensive delays in vetting DOC residents for placement on lead up and lead out, even after residents apply for those units. Individuals also report that they are being pushed to sign up for college-level classes as a performative step by DOC, but what many need and what is not being provided is a teacher for GED classes. Education tablets are only available on the high school education block at CTF. Due to a shortage of education tablets and connectivity issues, students frequently cannot access education tablets when they are moved from the high school block to restrictive housing. Some residents have access to entertainment tablets, but again, there are insufficient tablets for the number of residents in DOC custody, and those tablets do not provide educational programming. The only post-secondary distance learning opportunity is through Ashland University, but again, it is very difficult to get individuals enrolled in that programming due to Pell Grant requirements. The end result is that few people are able to participate in beneficial programming. Out of cell time. DOC residents are constantly denied out of cell time and spend the vast majority of their time locked in their cells. As a result of understaffing, the already low amount of out of cell time has been cut in half. Previously, half a unit could be outside of their cells for a total of 5 hours of out of cell time on most days. Now only 1/4 of a unit is released at a time, meaning 1 tier out of 4 tiers on a unit can be out for 2.5 hours a day. These 2.5 hours are the only time that individuals have to engage in in-person programming that is supposed to be available to them, to engage in physical activity, to use the showers, and to make phone calls to family. There's also a failure to treat mental health conditions. DOC staff routinely ignore residents who are in crisis because of withdrawal and mental illness. Clients report hearing individuals scream all night long while DOC staff ignore them. Individuals who need mental health treatment do not have regular access to psychiatrists and frequently are not prescribed medication. The inevitable and foreseeable result is that clients decompensate in DOC custody and become more ill. It is not clear how $21 million in this budget allocation in healthcare funding will address this. Grievances. At DOC's oversight hearing in February 2024, Director Faust testified that an overhaul of the grievance process would be ready shortly. To date, those changes to the grievance process have not been made. DOC's grievance process remains too long, too cumbersome, has too many steps, and by virtue of the timeline chosen by DOC, deprives almost the majority of detained men and more than the majority of detained women the opportunity to reach a resolution of their grievances during their length of stay. Reporting complaints to CIC is just insufficient because there's not the ability to constantly report the way that there should be with grievances. There's also a complete failure in the disciplinary adjudication process. DOC's system for adjudicating misconduct has entirely broken down, and the DOC has walked away from previously made reforms. For example, Director Faust previously communicated an intent to limit the use of pre-hearing disciplinary segregation for individuals who had not been adjudicated and who were waiting for their hearings. Now, DOC routinely holds individuals before any finding of culpability. DOC is doing this in violation of its own program manual, which requires an individualized determination as to whether pre-hearing detention is necessary to protect the individual or the security of the institution. Pre-hearing detention involves the same deplorable conditions and the lack of human contact. For instance, a lack of phone calls, The only meaningful difference is that, I'm sorry. Let me just back up. So it's pre-hearing detention involves the same deplorable conditions and lack of human contact as disciplinary restrictive housing, with the exception of retaining access to phone calls and commissary. The council should recall that these are the units used, that the units used for disciplinary restrictive housing are the ones where the U.S. Marshal Service found violation of basic human rights, including the punitive denial of food and water. The so-called disciplinary process implemented by DOC is also devoid of any real process. Inexplicably, disciplinary hearings are now conducted by video, despite being in person before and after the pandemic and as recently as January 2024. In video hearings, the decision makers who are part of DOC's adjustment board frequently cannot be seen or heard by the attorneys. Video hearings make it impossible for attorneys to communicate with their clients before or during hearings. Not surprisingly, video hearings have resulted in drastically increased rates of guilty findings. Further, when the adjustment board sustains disciplinary allegations, it does not follow its own regulations with respect to the type and length of sanctions imposed. DOC places individuals in restrictive housing for minor infractions, despite regulations that require DOC to use restrictive housing as a last resort. Despite the requirements to do so, the Adjustment Board also fails to consult with appropriate clinicians and personnel regarding sanctions for individuals struggling with mental illness. Even when disciplinary changes result in a dismissal, DOC is using the housing administrative process as an end run around the disciplinary process. DOC keeps clients in segregated housing indefinitely as a result of opaque decisions made by the Housing Board. For example, DOC has crafted policies that allow it to impose administrative segregation, meaning solitary confinement essentially, for anyone whose, quote, behavior or circumstances threaten the orderly operation of the institution. Those clients who have no sustained disciplinary infractions wait for months to be released from near constant lockdown in their cells. The use of force and the disturbing lack of transparency for a government agency. When PDS testified before this committee in February 2024, we explained that PDS has made FOIA requests for DOC's use of force and segregated housing policies, along with requests for data and information about when DOC has used force against residents. Just getting DOC to comply with the FOIA request took more than a year and required litigation. It should deeply concern the council that DOC fought against public disclosure of essential information. It is particularly concerning because residents in DOC custody have so few ways to communicate their distress. The council still does not allow residents to testify at hearings, like this budget oversight hearing and oversight hearings, and residents' access to phone calls is severely limited. And for residents in disciplinary segregation, that contact is cut off altogether. Last month, after a year of litigation, PDS finally received the DOC policies and some of the data that we have been requesting. Due to errors in the production of the data, PDS has only been able to look at the data from CTF. Even looking at CTF, which has a smaller population with a lower security rating, the data shows that DOC regularly uses force against residents. This affirms anecdotal reports by clients who are mostly at the DC jail that they are subjected to near constant use of chemical agents and other uses of force. The use of chemical agents is so toxic that DOC policy requires DOC staff to use protective equipment such as gas masks when deploying it. Some clients have discussed wanting to take pleas only to get away from the environment at DOC. This, like other DOC policies, practices, and decisions, requires intervention and action by the council. Thank you for the opportunity to testify, and I welcome any questions.
Thank you, Ms. Seminova. Darby Hickey, Policy Counsel at DC Justice Lab.
Thank you, Councilmember Pinto and staff for having us here today to provide testimony on the DOC budget. I'm Darby Hickey, Policy Counsel for the DC Justice Lab and a member of the Unlock the Box Coalition, as well as a resident of Ward 4. My testimony today focuses on critical needs for improving conditions for our neighbors at the DOC facilities by strengthening oversight, reforming food service, and ending solitary confinement, no matter its name. First, as I discussed in greater length in my testimony on the CIC, DC Justice Lab urges this committee to fully fund the Corrections Oversight Improvement Omnibus Amendment Act as per the law's fiscal impact statement. Second, DC Justice Lab hopes that this committee will fully fund Section 32 of the Security C Omnibus Amendment Act to enact the reforms to food service at DOC facilities. We thank you, Councilmember Pinto, and your staff for working to pass those important provisions to improve food service, for people at the jails and to create a robust culinary arts workforce development program. However, as you know, those changes are not enough, and we await your further actions on this issue. We are disappointed that the mayor's proposal does not include any funding for these changes. It is inhumane and undermines public safety to lock up more people but not properly feed or otherwise care for them. According to the fiscal impact statement for Section 32, the DOC needs $4 million to carry out the changes in the law. Implementing these provisions effectively will certainly take resources, but we and our partners remain skeptical of the price tag, as other jurisdictions have been able to make similar changes for far less money. We believe the DOC should be able to implement these changes with an enhancement of roughly $1.5 million. Further, we ask the committee to bring DOC to the table with experts to assist with the effective implementation of these new provisions. Returning citizens, nutritionists, and the hospitality sector can help DOC make these changes successfully and cost-effectively. Additionally, we applaud DOC for planning to include a training kitchen in the new jail annex. Finally, DC Justice Lab asks the committee to continue to focus on DOC's use of solitary confinement with the goal of ending this form of torture. Thank you, Councilmember Pinto, for asking questions of Director Faust about this topic during the DOC Performance Oversight hearing in February. However, some of the director's answers contradicted those in the agency's pre-hearing responses. And further, as we heard today, we continue to hear that solitary confinement practices are commonplace at DOC facilities, albeit under different names. Holding a person in a cell for 23 hours a day makes our city less safe no matter what label the DOC puts on it. Because solitary confinement is so damaging to those subjected to it, and it has been difficult to get a full picture of DOC's practices, we urge you to hold a hearing on the Erase Solitary Confinement Act of 2023. Importantly, this would allow the committee to hear from experts as well as practitioners in other jurisdictions that have implemented reforms to address the question that you have, Chairwoman Pinto, about what are the alternatives to using solitary in a variety of different circumstances. The conditions at the jails are a human rights issue, often violating the United Nations standard minimum rules for the treatment of prisoners. The conditions at the jails are a racial justice issue, as 91% of people in the jails are Black DC residents. And the conditions at the jails are a public safety issue, as the horrific conditions of incarceration increase recidivism. Thank you for your time. Happy to answer any questions.
Thank you, Darby. Rabbi Charles Feinberg, Executive Director of the Interfaith Action for Human Rights.
Thank you, Chairwoman Pinto, and I thank you for this opportunity to share my testimony. My name is Rabbi Charles Feinberg. I'm the Executive Director of Interfaith Action for Human Rights, which represents people of faith and allies who educate and advocate in Maryland, the District, and Virginia for correction systems to abolish unnecessarily punitive practices such as solitary confinement, and to instead focus on rehabilitation and successful reentry of our citizens. Interfaith Action advocates with the Unlocks the Box Coalition and its struggle to end solitary confinement within the DC Department of Corrections. Over the past 10 years, I've testified and attended hearings about conditions of confinement in area prisons in Maryland, the District, and Virginia. Many times I've listened to corrections officials say that they cannot maintain the safety and security of prisons without employing prolonged isolation or solitary confinement. And for the past 10 years, I've heard and read eloquent testimony from returning citizens about the destructive effects of isolation on their mental, spiritual, and physical health. Over the past 10 years, mental health professionals and researchers have documented how prolonged isolation creates many symptoms of mental illness, despair, depression, paranoia, and any sense of hope. Today, this panel has heard, I will possibly hear many voices describe the terrible effects of prolonged isolation. So how do we maintain the security of prisons without destroying the mental health of the incarcerated? Which is, I believe, the question the council member asked earlier today. Incarceration is the punishment. Destroying the health of the incarcerated should not be the punishment. That would be torture, and we should not be in the business of torturing people. Yet the fact remains that many prisons and jails in different states and communities have put an end to prolonged isolation. Correctional officials in these places have discovered that their institutions are safer and have less violence. Ending prolonged isolation has not endangered staff and incarcerated people. It has reduced the tension in the facility between staff and incarcerated people and among incarcerated people. So I urge the council to do two things. First, demand that the DC Department of Corrections provide regular, accurate data on how solitary is being employed in the DC jail. Recently, the Council of Court Excellence released a report that summarizes the limited data that was provided after more than 2 years of protracted negotiations and describes the inquiries that remain unanswered by the department. The council and the public should have accurate information about the average length of stay in isolation, how often it's deployed, how many people with mental illness are placed in isolation, and other important data about isolation. Second, I urge the council to hold a hearing on the Erase Act, introduced by Councilmember Dindot and 7 of your colleagues. Please hold this hearing as soon as possible, ideally before the council recess. And at this hearing, we should invite correctional officials from other jurisdictions to testify about how they maintain security in the prisons or jails without resorting to isolating people for more than 15 consecutive days or 23 hours a day. They will testify that with proper training, correctional officers can safely manage without resorting to solitary. The time is now for us to collectively improve conditions at the DC jail, including by ending the use of solitary confinement, prolonged isolation, except in rare cases. Thank you again.
Thank you, Rabbi Feinberg. Next, we'll hear from Reggie Blackwood, Community Jail Support.
Hi, thank you for your time. I'm Reggie Blackwood. I'm a resident of Ward 2, and I have a certain understanding of our city's post-arrest system that compels me to regularly render aid to my fellow residents of DC and to share some stories and questions today. I have 2 topics. One of them is about the fact that there's no legal metro access to people after property separation, despite some other things. But first, I really need to address medical neglect at Central Cell Block. On October 23rd, 5 months ago, I spoke to a dozen men who each told me that they listened to a man die in Central Cell Block. His name is Antonio Lee Dockery, age 39. He died alone in a metal-walled cell with a concrete floor, too narrow to accommodate a wheelchair. Several of the men detained said that Antonio shouted for his seizure medication and for medical assistance before he died in that cell that night. Antonio was arrested on a bench warrant for allegedly shoplifting and was killed by medical neglect in government custody before being charged or seeing a judge. He would have turned 40 years old in December, and I did not know him. But this is a tragedy that the government is responsible for. I am disgusted by Antonio's death, but I am not surprised. One day last week, 3 people told me without me asking them that they experienced medical neglect in Central Cell Block. Notably, they were deprived of insulin, mental health medication, and prenatal care. I am accustomed to DC residents reporting that they are deprived of water, life-preserving medication, mobility aids, and medical treatment for emergencies, including seizures, heart attack, and miscarriage. Councilmember Pinto may remember from 2021, a woman who survived multiple seizures in the same kind of cell that Antonio died in, but then at the hospital had cockroaches removed from her orifices from being unconscious in her cell after her seizures. I have 1 minute and I'm going to go to my bit on how when you are arrested and separated from your property, you cannot get on the metro. Previously, at oversight hearings, I have been told that it is, quote, up to the discretion of station management. A reminder for anyone who does not know, when you are released from the courthouse or Central Cell Block, you do not have your wallet, phone, keys, shoelaces, or any of those items, and you are allowed to ride the bus because you have a blue wristband. And allegedly, it is up to station managers' discretion. I have spoken to station managers, and not one of them is willing to say that a person is allowed to get on the metro. I followed a man who is an English language learner. He was talking to the station manager, and she said, "I can't say yes, but I won't do anything." And he was afraid. But what I clearly understood was that she is denied from her higher ups to say yes to anyone. More recently, I have a video of a metro employee that I videoed 3 Mondays ago, I think, when the enforcement of the metro went into effect. She said very clearly that according to her higher-ups, she is not allowed to say yes to anyone other than uniformed police officers. So plainclothes officers are not allowed to ride the metro, and certainly not people who've been deprived of their resources by the government who need to return home or back to those items. I would love to see some method for people to have enhanced ability to return to their property, including using the metro, and not just the bus. Thank you.
Well, thank you very much, and thank you to all of you for your moving testimony and remarks, and much of which is very troubling. So kind of a number of follow-ups that came to me as you all are sharing. The first I want to ask you, Ms. Seminova, about the food experience with your clients. What have you heard over the course of the last year or so, if anything, from your clients about the meals that they're being served, about accommodations that they may need, whether that be dietary, religious, or because they're hungry? And how can you kind of educate us on what you're hearing from your clients' perspective?
We've heard terrible things over many years, and I don't think that there's that the sort of the tenor of those things has really changed. I focused on those issues in some of the other oversight hearings. We had clients who were served consistently things that they were allergic to. For example, people with gluten allergies is my memory. There's also inadequate food, cold food, food being served at off hours, food that is rotten, food that has clear evidence of vermin. So that consistently over years, and I think it was in the 22 oversight hearing where clients' voices were heard, or residents' voices were heard. And many of them talked about how horrible the food was, how hungry they were, and how terrible that part of the situation was.
Thank you. And can you elaborate a little bit more on the access to lawyers? You've testified in the past about the closing down of this access on weekends and how that's impacted work. But have there been, again, any improvements over the course of the last year?
It has gotten worse. I think if I testified about weekends, that it might be the shutting of certain visitation floors. I don't think that the issue is primarily one of weekends. Though, correct, like if my own testimony focused on a weekend issue, I think the issue is, one, that there's an understaffing in visitation, and two, there's this new policy that you cannot see clients on different floors. Clients are held on 3 floors for their housing units. Residents are held on 3 different floors. Lawyers need to see their clients. And in the past, a lawyer could go to a visitation room. There are only about 5 visitation rooms on the floors with the most rooms. So a lawyer could wait in the room and clients would appear. And at the oversight hearing, CJA lawyers testified as well about how this system is now failing. The population has increased. And at the same time that the population has increased, the method of allowing people to go to legal visits has also changed and become drastically worse, with DOC saying that people can't walk between floors or be escorted between floors. So an individual sees a lawyer sees one client, has to leave that floor where they've waited for a room and go to another floor, wait for a room again. And so everybody's sort of in this process of waiting for rooms. Apart from that, there's a terrible situation happening with individuals who are on disciplinary segregation and in the segregated housing, the administrative segregation, disciplinary segregation, pre-hearing segregation. So everybody who's under some sort of disciplinary restriction in DOC and in the housing restrictions and basically in solitary confinement. They come to legal visitation in 5-point restraints with their hands chained to their waists with handcuffs. It is physically painful for them to be in legal visitation, and they have to keep these restraints on, according to DOC staff, even though they are sitting in a room with their lawyer and their lawyer wants the restraints removed. There's also limitations on when and where they can be seen, and sometimes they are forced to be seen. For a while, there was an issue where DOC was saying that they could only be seen in metal cages that are generally exposed to the rest of the visitation area. So there's no privacy. And a lawyer sits on one part of the cage and an individual and the individual sits inside. I mean, it's just, it's not a way to conduct a legal visit, and it's not a way for the DOC to provide humane care to people. It is absolutely inhumane for DOC to do this to individuals who have to meet with their lawyers.
Sorry, excuse me. Okay, thank you for that context. And then in terms of the programming that you talked about, that some of your clients were being told that they weren't eligible to access programming, as we contemplate the kind of new annex and new funding for additional programming, what should those barriers to entry be reduced to, or framed in a more positive way? How should we be envisioning ensuring that everybody who wants it can access programming?
So I think there's several ways of approaching it. One, there just needs to be more transparency and more direct access for every single resident to be able to say what they are doing and what they want to be doing. And when DOC says that a program is available, residents should be able to say whether this is truly available, how many of them have accessed it, how many times a week they have met. So there needs to be much more transparency on what is actually going on. And I think in that same process of gaining some transparency, there can also be surveying of individuals of what should be there. At a minimum, every single person should be able to access some level of programming that they would like. There should be a high school diploma available for everyone, regardless of whether they have an IEP. So every single person who is there who wants to gain a high school diploma should be able to have that track. A GED should be available to everyone who wants to have that track with in-person GED instruction. And then there should be layered offerings on top of that, including post-secondary and then vocational. And all of that should be really informed by residents and needs and availability. And there shouldn't be barriers to accessing these programs. And things that have been incredibly successful, like the Young Men Emerging Unit, which at its peak was a really great mentoring relationship between individuals who were on IRA writs and were home after many years of incarceration and younger individuals. Those opportunities should be expanded.
Thank you. And Darby, I want to ask you about something that you talked about the discrepancy between what was stated in performance oversight around the use of restrictive housing and what was in the testimony. Can you elaborate on what you meant by that?
Yeah, and we can follow up with the committee because we have took some detailed notes on where those were. And we think that following up with the department on that would be really good. As I recall, and I wish I'd brought those notes with me, but basically in one set of answers, and I'm forgetting whether it was the pre-hearing answers or the in the hearing answers, there was a statement that people in certain segregated housing units or otherwise labeled housing units that allegedly are not isolation had the same access as in general population, and then in the other context. So I think that was the statement made at the hearing, whereas in the pre-hearing questions, it said that people in all of these different housing circumstances actually did not have access to the same programming, visitation, commissary. I'm forgetting some of the other things that they were deprived of. That this goes back to the point that although we're focused on, we often talk about solitary confinement and we're thinking of it as being used to protect safety, but it's actually being used in all of these different circumstances under these different labels, but with the same deprivations, in addition to being locked in your cell for 23 hours a day, as we heard about today. And it's important for us to explore this more, in particular right now with the planning of the annex, because the design of these facilities goes directly to your question, Chairwoman, about what are the alternatives? How are the different approaches that can be taken? It goes to that question of design, and how are these facilities designed in a way to allow for more flexibility in different contexts?
Mm-hmm. Yeah, that's a really good point. Thank you very much. So Reggie, thank you for your testimony. And I'm very troubled by the examples that you highlighted, the extreme examples. But I want to ask you about this metro access component because it feels solvable, at least more quickly than some
Yeah.
of the other longstanding problems and the major renovations that are absolutely needed at Central Cell Block. And then I'm very disappointed are not in this budget proposal that I was expecting to be. But in terms of the metro access, so you talk about the kind of blue bracelet, so that's only allowable on Metro bus?
Correct.
Okay, and so if would you think a similar type of model with a blue bracelet gaining you access to Metro Rail could kind of help with that problem?
Yeah, in prior hearings, I have heard that it is up to the discretion of station management that the bus is guaranteed, but the metro is at discretion. But by talking to station managers, they do not feel as though they can discretionarily give permission to people with the blue band, even if they clearly identify themselves.
Okay, thank you very much. We can certainly follow up with Metro about that. Go ahead.
I worked on this issue in prior years and it has been all over the map. My understanding was that in the 2007, 2008, people would leave court with a wristband and they would be allowed onto the trains, they would be allowed onto the buses when they would leave from C10. Then over the years, Metro's position has been that no, not on buses, not on trains, that the bracelet doesn't do anything. I think it was in 22, there was funding through OVSJG for there was a grant funding that provided van service after court. I don't know if that has been renewed, but that was another way that it was addressed. But I think critically is also having WMATA always available to individuals and having that wristband that everybody has when they leave court really function in that way so that they have the freedom to, if they can walk to a district to pick a property, then they can still get on all the transit that's available.
Okay, thank you for that. And Ms. Seminova, in terms of issues that are brought to you by your clients about correctional officer behavior or misconduct, I know we've talked in the past about setting up a grievance process, but in your view, what is the best approach for a disciplinary process in place that would adequately address instances of officer misconduct?
I think that there's several missing pieces. So one really important missing piece is an agency that is dedicated to transparency. So an agency that says that they will provide information to counsel, they will provide to lawyers, meaning counsel, they will provide information to the individual, maybe body worn camera will be accessible. I think there are going to have to be ways that are individualized to address harms that happen. There is real training that needs to happen by DOC to prevent those things. But I think one of the first steps is transparency in terms of policy and in terms of what is happening and what has happened.
Thank you all very much. Appreciate it. To call our next panel of in-person public witnesses, Foster Sellers, Damon Jones, Joseph Washington, Tony Johnson, Herbert Robinson, Herbert Robinson here? Or are you Damon Jones? Okay, great. You can sit next to Mr. Sellers. That works. Okay, and then Joseph Washington. Okay, could you sit in the third seat if you don't mind? Okay, Tony Johnson. Herbert Robinson. Tracy Velasquez. All right, we will start with Foster Sellers, project coordinator at the National Reentry Network for Returning Citizens.
Good day, Chairwoman Pinto. Hope all is well. I appreciate the opportunity to speak at today's hearing. My name is Foster Sellers. I'm a project coordinator at the Reentry Network for Returning Citizens. I'll be testifying today in the needs to amend the Second Chance Amendment Act of 2022. My message is simple. The bill needs to include more felonies and misdemeanors for automatic record sealing and expungement. And here are my recommendations. Section 16 of the Act prohibits automatic and record sealing expungement for certain offenses instead of automatically sealing all records. The language should be changed to include misdemeanors and eligible felonies for automatic record sealing and expungement. In addition to that, section 16806 of the act prohibits the record sealing, the record sealing of criminal records by motion for a period of record that can be sealed for a misdemeanor and a felony. So here I'm talking about 5-year wait period for a misdemeanor and an 8-year wait period for a felony. And so I feel like this part of the actual amendment should be changed and eliminated from the actual bill. The concern is that criminal records, whether an individual or criminal is convicted of a severe crime or committed a crime and did time or was not convicted of the crime, should not have to face this as a life sentence. Without record sealing and expungement, returning citizens are hindered from obtaining housing, employment, and other social services needed to become a productive citizen in society. I urge you to amend the bill and make the changes of the language to allow for automatic record sealing and expungements to include all misdemeanors and eligible felonies, eliminate waiting periods, and increase eligibility for felony charges. I say that to say that the idea is that we don't want to see returning citizens come back over to DLC. We want to give them an opportunity. I feel like this bill is very progressive in doing that as far as record sealing and expungement is concerned.
Thank you, Mr. Sellers. Damon Jones, Outreach Specialist, National Reentry Network for Returning Citizens.
Network for Returning Citizens. I'm also an advocate for the Unlock the Box DC Coalition struggle to end solitary confinement within DC Departments of Correction. As of October of last year, I completed 28 years of incarceration. Roughly 10 of those 28 years was spent off and on in solitary confinement. The practice, well, you may ask, why did I do so many years in solitary confinement? The reason is because the practice is commonly used by the prisons and the DC jail staff as a punishment for any infractions, minor or major. Solitary confinement is also used as a first response mechanism to any disruption of the orderly running of the prison. The first thing they do is put the disruptants into solitary confinement. I myself was subjected to this torturous practice after being a victim of a stabbing while housed at DC jail. Fearing that I may retaliate, the jail officials had me spend almost 6 months in solitary confinement before being shipped off to the federal system. Now, it has been reported that the DC Department of Correction uses solitary confinement 3 times more than the national average. 3 times more than the national average. Now, what makes this so egregious is that the United Nations identifies prolonged solitary confinement as torture. And the DOC uses this 3 times more than the national average. Then the United Nations didn't define solitary confinement as uncomfortable or even inhumane. They didn't call it malign, they didn't call it malicious, even though I can tell you from experience that solitary confinement is all those things. But the United Nations defines solitary confinement as torture. And torture meaning the practice of inflicting severe pain on someone as a punishment. And synonyms for torture is abuse, torment, maltreatment, and persecution. Now, I'm not asking you to answer this directly, but why is ending human torture anywhere in the United States even up for discussion? If it's been identified as torture, what are we talking about? And the inmates normally act out because they're suffering from some type of mental malfunction. You know, you've been sent to prison. I don't care what you did or what they say you did. If you've been sent to prison, it's going to mentally affect you. So you may act out. Now, another question is, why would anyone think it is productive to subject someone you're aiming to rehabilitate to torture? So what I would ask this committee is to hold a hearing on the Erased Solitary Confinement Act introduced by Councilmember Nadeau and seven of your colleagues. And I'm asking that this hearing be held as soon as possible. And that's my ask. And what I would challenge you to do, Chairman Pinto, is to schedule a visit to the solitary confinement section of DC jail and talk to the residents there, see what's really going on. So let's get rid of this outdated, basically medieval practice. I could personally attest to you that it's torture. Thank you.
Thank you, Mr. Jones. Joseph Washington, Recovery Specialist, the National Reentry Network for Returning Citizens.
Thank you very much. Thank you very much, Councilmember Ms. Pintos and your staff. First and foremost, I want to thank God for this opportunity, my higher power, because if it wouldn't have been for him, I wouldn't be alive today. So I'm very grateful today. I spent 33 years of my life in the federal prisons and at DC jail. The 2 years I spent in DC jail was in solitary confinement. And during that time I was in solitary confinement, I was threatened repeatedly by correctional officers because of my charge. There were reserves working back then in DC jail, and they would give me plastic bags and an extra sheet and tell me I knew what I needed to do. And basically, they wanted me to kill myself. So I was 17 years old when I encountered the most inhumane condition of my life. Since my time is of the essence, let me say that I was afraid, inexperienced, and unsafe, and I felt unworthy. I was placed in solitary confinement because of a charge I didn't commit. I was threatened consistently, daily. I was allowed to shower 10 minutes every other day, shackled and handcuffed. I was given a plastic bag and a sheet, as I said earlier. 2 years, I've never had a hot meal. I never had a nutritious meal. I don't recall one. And the only type of fruit I got was unedible. In other words, it was either an apple that was too soft or an apple that was rotten. I've never had a hot meal the whole time I was in DC jail, ever. Once I left DC jail in '89, I went to the feds. I went to Talladega, Alabama, and spent 772 days in solitary confinement because of my charge. I attempted to kill myself on numerous occasions while in solitary confinement. I still suffer from mental health issues today. I came home in 2017. I suffer from post-traumatic stress disorder, manic depression, and suicidal tendencies. But I thank God I've been home for 6 years, and I'm doing the best I can at this day. I think it's inhumane and unsafe to house people in what they call solitary confinement. I think it's what my man said, it's torture. It's inhumane, it's not safe. Because then you release us into society or you release us back into population, and what do you expect? It hurts. And I don't want the next Joseph to go through what I went through. You understand? I came a long way and I'm very grateful. I was treated less than a human being. I was a number, and I've been treated like that since I'm 57. I'm 57 now until I was 51. I got released in 2017. My mother died 1 month before I came home, and I didn't even know about it. So I'm asking you today to take in consideration how the justice system, how the judiciary system treat young people in the prison system. You know, those young kids that came in here today, they really inspired. I sat over there crying because I don't want them to go through what I went through. I would hate to see that on another human being. So I thank you for your time and your patience. And I thank everybody that came before me. Thank you.
Thank you very much, Mr. Washington. Tracy Velasquez, Policy Director from the Council of Court Excellence.
Good afternoon, Chairperson Pinto and members of the committee and the public, and thank you for your testimony. My name is Tracy Velasquez, and I'm the Policy Director at the Council for Court Excellence. My testimony today concerns both the proposed operating budget for the Department of Corrections, as well as the proposed capital budget for the new jail facility, which is where I'll start. The fiscal year 2023 budget indicated a cost for the new jail facility of about $280 million, with the facility to be completed by fiscal year 29. The schedule for the first phase provided to the Task Force on Jails and Justice, which CCE facilitates. That first phase back in May of 2023 contained a number of deliverables, including advocacy and community engagement, which was to take place between May 2023 and now April 2024. The proposed capital budget for the new facility in the new budget is now $477 million, an increase of about $200 million, with the completion date pushed back a year to fiscal year 2030. It is unclear to what extent the new budget and timeline reflect changes to the original annex project plan as was presented. As conveners of the task force, last month CCE requested that DOC and DGS present to the task force on jail planning progress. The agencies responded that they would not provide an update at this time. As a result, we don't know which deliverables have in fact been completed, and we are unaware of what advocacy or community engagement, if any, has occurred to date. With a projected useful life of 50+ years, decisions on what jail DC builds will impact generations of Washingtonians. We hope that during these hearings, DOC staff will present more information on the planning, as well as how they will incorporate community voices and best practices from around the United States and beyond in the planning process moving forward. And CC is obviously willing to help in whatever ways we can with those steps. Regarding the operating budget, it was good to see that DOC's operating budget was not cut and the number of FTEs proposed is at the 2024 level. However, it is unclear whether the proposed budget is sufficient to maintain levels of services given current and anticipated increases in the jail population. The budget includes a one-time increase of $1.8 million to support the new Secure DC Act of 2024. This amount is less than 1% of the budget. DOC has provided no analysis indicating what this increase is based on. That is, how many more people do they expect to be admitted as a result of Secure DC? What custody level or services might they need? And how long do they anticipate their average length of stay? All of which will give you an average daily population increase. If this amount is inadequate, those who are incarcerated may see declines in services, and those working in the jail will face greater workloads. I know my time is short, but I did also wanted to note that there was a $19 million increase in inmate health services. I don't know, it doesn't really say what this is for or what it will go towards. And we hope that DOC will also provide more clarity around how this increase in healthcare spending will be used. Thank you very much.
Thank you very much, Ms. Velasquez. And we have the same question for DOC, and we'll be asking them about that spending and if there's a way to correlate it with what our goals set out to do in Fresh Starts around healthy food and improved programming, particularly in the hospitality industry, to set residents up for success. We'll also follow up with them about the need for additional community input and engagement about what the annex should look like. But I want to ask you, Mr. Jones and Mr. Washington, as two people who have spent time living at the DC jail, what do you think we should be considering for the new annex that would advance the goals of true rehabilitation and dignified habitability?
I would address it first, please, if you don't mind. So I got rearrested for lack of loss of contact. I lost my phone. My sister was murdered. So I wasn't, this was a year and a half ago. My sister was murdered and I lost my phone during the COVID. So I wasn't able to get in contact with my parole officer. So I got 3 months. When I went back to DC jail, nothing had changed. I went to, I think it was South 2. They had no books, no reading materials. There was one counselor or case manager, and he had to deal with everyone in the whole unit. Everyone was coming out for 5 hours a day, each tier. There was no type of educational system inside. There were guys or people, they were still using drugs. You're not doing anything to help mentally, to help the people mentally. You're not doing anything to help them with their substance abuse. And that's the key today. A lot of people having substance abuses. You got stuff out there that's killing people. And then once they get arrested, they come in with that and they still got a problem. So one of the key things with the new system that you're about to bring about is substance education. Substance education. Not accusing them of it, just give them some education, give them some resources, give them some job opportunities. When I got released, they just threw me in the street. When I got released after 33 years, they just put me in the street with nothing. I didn't know about the National Reentry Network or any other type of service. I was homeless when I got released. So that's another issue that needs to be addressed for people that's coming home or getting close to coming home. Give them some resources. And DC has a whole bunch of resources for people, but some people are ashamed to go look for it, or they're ashamed to ask for it. Where I'm at now, we have to aid and assist grown men and grown women. Man, here you go here, get some clothes. Go here, you can get some food. Go here, apply for housing. Go here, go here. I will hold your hand and go with you if you need me to, because I needed somebody to do that for me. So that's what the new system needs. It needs education. It needs resources. And that's the key. If you want to stop the crime, really, educate and give us some resources.
Thank you. Thank you. Mr. Jones?
What I would say is that we need more oversight. I mean, for the 28 years I was incarcerated, the one thing I know is DC jail, federal system, all that, it's a big buddy system. You know, the oversight for the correctional officers is supposed to be, you know, they call them lieutenants and sergeants and, you know, all the way up, I guess, to the warden. But it's a buddy system. You know, they're gonna do whatever to make it easiest for their job. And that's how solitary confinement gets used, because it makes it easier. You know, if me and this gentleman is having an issue and we loud, you know, we don't even have to get to a fight. But the correctional officers become aware they're going to grab us and they're going to put us in solitary confinement. That's the answer. And that needs to change, because that's not doing anything to address what we are going through emotionally. We need to be treated like humans. You know what I'm saying? And despite the fact that what our charges are, if the whole point is rehabilitation so we come back to society, then why are you not treating us like human beings? And like I say, it needs to be some oversight of the correctional officers. You know, with the new annex, make it more public. Make it where as though, stop making prison where as though it's somewhere that the inmates are locked away and never heard from again. You know what I'm saying? Make it more accessible to the public, so therefore it could be more oversight to see what's really going on. Because if you just leave it to the correctional officers, they're trying to do their 8 hours and go home. And so they're trying to make it as easy as possible. So instead of dealing with Mr. Washington and what issues, mental issues he may be going through, put him in a hole so I can go home. And when I say hole, I mean solitary confinement. That's the name we call it.
Mm-hmm. Okay.
And that needs to change.
Thank you. Thank you very much. And Mr. Sellers, I thank you for your testimony and comments about the importance of the Second Chance Amendment Act. And it's something we are certainly looking at and thinking about for this budget on how we can be helpful. So we will continue to stay focused on that need. Thank you. Thank you all very much. Okay. I'm going to call our next panel, James Dunn, Joel Smith, Angela Jones, Angela Jones, are you here? Mhm. Okay, thank you, Mr. Dunn. We can follow up with her about that as well. Okay, is there anyone else in the chambers today who has signed up to testify for DOC and has not yet? Okay, so we are going to hear from James Dunn and Joel Smith, and then we will turn to our virtual public witnesses for DOC. We will start with you, James Dunn, public witness.
Good evening, Chairperson Pinto and committee members. My name is James Dunn. and I am the advocacy chair of Thrive Under 25, a coalition which works to address the unique needs of youth who came in contact with the adult criminal legal system between the ages of 16 to 24. I am a passionate advocate for emerging adults because I experienced firsthand the lifelong harmful impact of growing up in a disinvested neighborhood lacking community resources, resulting in my incarceration for 30 years when I was only a teenager. Thrive Under 25 is part of a nationwide emerging adult justice collaborative with groups in Nebraska and Massachusetts. DC was selected to be a part of this group so that we can fully implement the supports mandated by the Youth Rehabilitation Act. There's a developmental framework that is proven to bring young adults positive development. However, these supports are not in place at the DC jail, and this needs to change. The following areas of deep concern were shared with our coalition from the DC community or people who are familiar with or directly impacted by DOC. First, the lack of quality mental health care. The mental health treatment is inadequate and is compounding trauma. The DOC must contract with specialists in emerging adult behavior development for one-on-one care and not assume that they have the same needs as adults. There needs to be support groups led by trained therapists dedicated to emerging adults. Second, there should be education for all. All emerging youth and adults at the jail need to be provided a quality education, not just those with IEPs. Next, the food. The food at DC jail is often cold, flavorless, and most importantly, not nutritious. One young adult said that if you don't have money to buy your own food at the commissary, you will basically starve. However, the commissary food is not much better. It is high in sodium and mostly empty calories. My high blood pressure was dangerously high when I was at DC jail because of the commissary food. Community members also report that it is very difficult to put in for a sick appointment and that they are going days without being able to see practitioners. That can be easily remedied. Finally, we hear continuously of the lack of outdoor recreation time due to staff shortages. We would like to know, when was the last time the DOC graduated a class at the training academy? Is that still happening? What are the recruiting efforts for professional correctional officers? Staff is the central component for a secure and humane environment, and we don't see evidence that there are active efforts to bring professional training and real accountability. Also, what is the training? We receive reports of either staff that are unnecessarily harsh or, for the majority of the time, unengaged, disrespectful, and with low morale. In conclusion, we urge the DOC to provide true youth-oriented programming, education, high-quality mental and physical health care, and the same healthy and humane environment that you would want for a young person in your family. Thank you.
Thank you very much, Mr. Dunn. Joel Smith, public witness.
Good afternoon, Chairman Ms. Pinto. I appreciate the opportunity to be here to speak. My name is Joel Smith. As you stated, I am a fourth generation Washingtonian, and I live in Ward 4. I'm also a returning citizen. Since December 22nd, I just got finished serving a 20-year prison sentence that I started in DC jail December 2004. Everybody before me spoke very eloquently, clearly, and concisely about the conditions over there. So I want to touch on a few other things. One thing being, there's a preconceived notion that you only go to solitary as a punitive measure. That's not the case. If you have what's considered a high-profile case, they will also put you there, as was my case, and friends of mine. So, and when you're there, a lot of young men who are in the jail right now, this is their first introduction to incarceration. So, you know, you can only imagine waking up one day being free, and then the next day you're not free, and then you're in captivity inside of incarceration. So psychologically, doctors way smarter than me have spoke to it. That it deteriorates you, right? So you have this sensory deprivation, and I think that creates this sympathy deprivation. You know, 90% of the people over the jail are going to be released to the community. 73% are going to reoffend. These numbers are just numbers until you actually live in there with individuals who are going to come back to the society. And solitary confinement makes you feel disassociated and disconnected from yourself and from other people, right? So people that I know are going to come back into my community, I want them to feel connected to the community, not disconnected, not less sympathetic and empathetic. We need them to be more sympathetic and empathetic, right? I had a lot of stuff written down, but this is so personal to me. And like I said, I just felt like going through that process and seeing people throw feces on each other, throw urine on each other, throw urine on staff. Like this is the things that happen, you know, when you find yourself in these environments where you feel forgotten, you feel thrown away. So of course the Erase Act, which is, you know, what we're here to argue about, and which I'm here to say, hold a hearing, allow people to speak their piece and to do away with it. I mean, there's nothing but punitive value in solitary confinement. There's no rehabilitative value. And at the end of the day, if it's only to punish, you know, punish people who do what? Act out. So I won't waste so much more time. I appreciate the opportunity. Thanks.
Well, thank you very much. Thank you both for that powerful testimony. I guess I'll ask you the same thing that I asked Ms. Wasser from the ACLU. And you talk about solitary confinement or moving to restrictive housing from the perspective of it doesn't rehabilitate, it's only for punishment. As people who've spent time there, in instances when there is a fight that breaks out, for instance, or somebody may be suicidal, what do you think the appropriate response is to keep that resident safe and their neighbor safe?
Me personally, one of the things that I did in the Federal Bureau of Prisons was I was a suicide companion. So if someone indicates that they're suicidal, solitary confinement isn't the answer. They have an actual unit in FBOP. And it's an observation where they'll put staff and they'll put other inmates like myself, you know, just to monitor them. Because I mean, that's not a permanent mental position for most people, right? Over 20-year sentences, if I'm gonna be honest, I've entertained that thought, right? Like you wake up and you like, man, this can't be it, right? But that's a temporary thought. So now if you throw me in the box, which is another word for the shoe, you throw me in the box, now I got literally, they say 23 and 1, but I never took rec, right? Because for one reason, it's crazy to say, but your day is already monotonous and you set this schedule, right? So you had this schedule that you construct your life around. And they come and they say, oh yeah, you ready for rec? Nah, I'm not ready for rec. No, I don't want to rec with who you want me to rec with. And you move me from one cage to another cage. At least I've made this cage comfortable. It's freezing cold. I don't have adequate clothing. I can't go buy a sweatsuit or a sweater like I can now, right? If it's cold, it's just cold. Right? I got slippers. So if it's cold, it's just cold. Like there's no way to alter that. So to answer that question, if there's a fight, like the brother said previously, if there's a conflict, the conflict could be resolved. Right? Like you throwing me, like I said, people are throwing feces and urine at each other because the conflict hasn't been resolved. The conflict doesn't go anywhere. You locking me, what is that? I mean, if you keep me safe from who? Like, who am I? It's impossible. Like there's 1901 D Street. That's what it is. Like I'm a DC, I'm going there, right? So if I don't address the issue on Monday, where I'm going, they gonna let me go. But I'm leaving. No, I got to address it Tuesday, Wednesday, Thursday, or next month. But now I'm full with hatred and pain and rage and trauma that I walked into jail with. I didn't come into jail healthy. I came into jail full of these things. So now you put me in this box that once again has no therapeutic, no rehabilitative talk to me. Allow me to come talk to them. If there's two young men, one of the things that I do at Peace Academy Core 6 is violence interruption. And you know, let someone that's qualified to speak to these young people, speak to the young people. To answer your question, not to be too long.
I would just add to that. I believe when people are first arrested and brought into the jail, a lot of times they're just ushered through without being properly assessed. So I think one of the key things that may need to be put in place is to properly assess the individuals upon entering the jail, and creating a unit for that, because a lot of people are coming into jail with mental health issues and they're not being diagnosed properly. And then that's why you have the ripple effects of that spilling over into other areas of the jail. Whereas though if they could have been properly assessed, they could have been treated, maybe could have been sent to a mental hospital, and been treated properly and not being misdiagnosed. And then, like he said, being thrown in a box, and it just traumatizes them more and hurt people. That's the reality of it. When most people who have been hurt don't know how to express themselves or don't have anybody who actually cares about what they're going through, they will lash out. And that's what you see a lot of times. So I just think, they need to put something in place up the jail where people are being properly assessed, like the first 48 hours that they're there. A lot of these people are coming in with drug habits. They are mentally ill and they were self-medicating to deal with their illnesses. And once they can't get the drug anymore, a lot of what we're seeing is just withdrawals and just people just acting out. So, I believe that could curtail a lot of what we see.
Mhm. Thank you.
Mhm.
Thank you both very much for your testimony and look forward to continuing the conversation. Thank you. Okay, we are going to call now a panel of virtual public witnesses for the Department of Corrections: Antoine Coleman, Brittany Vasquez, Marquita Steele, Jesse Silverman, Ivory Height, Jillian Buford, and Caitlin Holbrook. Reminder for public witnesses joining us virtually, please accept the invitation to join as a panelist. This is our last panel of public witnesses, and then we will turn to Department of Corrections and Director Faust. So we can get started with Antoine Coleman, public witness.
Okay, can you hear me?
Yes, we can.
Okay. Hello, Chairwoman Pinto and other members in attendance. Thank you for this opportunity to share my testimony. My name is Antoine Coleman. I'm a Ward 8 resident. I am an advocate for Free Minds Book Club and Thrive Under 25, as well as for the Unlock the Box DC Coalition's struggle to end solitary confinement. During my 22 years of incarceration in the BOP, no less than 7 years of that time was spent in a segregated housing unit, better known as the Hole. It is undoubtedly a conscious battle against insanity the second you're locked in that tiny cell by yourself. Not everyone is able to adjust to such dire circumstances, especially those who go into the cell already battling with mental health issues. Never mind, there is no reprieve provided for this agony. It is designed for the sole purpose of punishment, and there's evidence to show the overall effect lasts far longer than it should. For example, I know guys personally who were subjected to the Hole and came out of those situations having lost their ability to be around others in a healthy way. Their trust for people is destroyed by it. Again, research shows that solitary confinement doesn't even make a prison or jail safer at all. Most crime is rooted in mental capacity. The goal should always be to help people deal, then hopefully heal their mental health, not make it worse. The reality is over 95% of people in prison will go back home to their community, who will then have to deal with an even more aggravated individual. So they go in bad, come out worse, inevitably going back in. And so the cycle continues. Ill treatment in prison only makes it harder for you to acclimate back into society once you are released. People who are already dealing with mental health issues, the last thing they need is to be locked alone in a cell. Even with a cellmate, 23 hours inside of a disturbingly small room will undoubtedly cause lasting negative effects. Extensive research shows how solitary confinement leads to psychosis, neurological damage, severe anxiety, panic, paranoia, despair, depression, memory and concentration loss, and drug use. Research also shows that placing people in solitary confinement makes it more likely that they will die in the first year after release, especially from suicide or opioid overdose. The hold not only facilitates mental decline, but a physical decline and a spiritual decline. Your hair gets disheveled, you are served less food and will likely lose weight. Adequate hygiene is nearly impossible. You don't get a chance to congregate, to have spiritual fellowship, something many need. The issue of safety is often mentioned in justifying these conditions, but absolute deprivation of humanity should be more of a safety issue than any institutional infraction. If the overall goal is to lessen crime and make society safer, you have to start with something that is proven does not make society safer: solitary confinement and the conditions of confinement. For these very important reasons, I ask you to hold a hearing on the Erase Solitary Confinement Act introduced last year. Please hold this hearing as soon as possible, ideally before the council recess. To subject someone to months and years of isolation when we know that person most likely is returning to the community, that is not public safety. What DOC calls fixing the problem is only making the problem worse. I like to thank, the council, the opportunity to speak. And solitary confinement is definitely a issue that we should all pay more closer attention to, because these are all members of society and we are all members, and we should take care of each other, because it's only going to exacerbate the same problems that we continuously try to fix. So thank you.
Thank you, Mr. Coleman. Brittany Vasquez, public witness.
Good afternoon. My name is Brittany Vasquez, and I'm a forensic social worker who was previously employed by the Department of Corrections. In my time working for DOC, I witnessed the overuse of solitary confinement measures. Solitary confinement by DOC is used in response not only to harmful actions, but to minor infractions, safety concerns, gender identity, and mental health crises. Solitary confinement has been proven to negatively impact behavior, emotional regulation, and socialization, and exacerbates mental health conditions. The use of solitary measures such as punitive segregation, protective custody, special management, and safe cells has not made the jail any safer for the incarcerated people or the staff. We have an opportunity to become leaders toward the elimination of solitary measures by utilizing the budget to hire more correction officers, offer crisis response training, utilize the central treatment facility as a facility to provide behavioral health treatment, and have an increased presence of mental health professionals. And these professionals can care for those who have mental illness, facilitate appropriate reentry coordination, address concerns of the incarcerated people before they escalate to violence, and participate in crisis intervention. The ratio of correction officers to incarcerated people is severely skewed. Although correction officers will always be outnumbered, hiring more correction officers will allow for safety measures to be implemented in order to prevent and intervene in assaults. To attract more individuals to the position, incentives such as higher salaries and pensions can be implemented. In addition to this, more training can be adopted surrounding team building, communication, and crisis intervention. Specifically, crisis intervention team training can be required, especially for those staff who will be interacting with individuals who have mental illness. This training is commonly used nationwide, and it requires collaboration between law enforcement and behavioral health providers to ensure safe de-escalation of mental health crises. The central treatment facility lacks what it appears to promise, which is treatment. Currently, DOC has one male mental health unit and one female mental health unit. In evaluating the budget, we have a great opportunity to restructure and utilize units in CTF to offer more specialized care for our incarcerated people whose illnesses are at different levels of severity and who need different levels of care. These units can have mental health teams and CIT trained correction officers assigned to them to ensure everyone's mental health needs are appropriately treated. We can eliminate safe cells by offering 2 reserved beds on each mental health unit for individuals experiencing suicidal ideation to be placed on 24-hour suicide watch with peer support. I ask that you consider these suggestions in the budget and hold a hearing on the Erase Act introduced by your colleagues as soon as possible to move toward ending the use of solitary confinement in all of its forms. Thank you.
Thank you, Ms. Vasquez. Jesse Silverman, public witness.
Good afternoon, Councilmember Pinto. I'm actually testifying today on behalf of the Center for Science in the Public Interest, your food and health watchdog. My name is Jesse Silverman. I'm a registered dietitian and senior policy associate at CSPI, as well as a resident of Ward 2. I am testifying today to request that you allocate $1.5 million in FY25 for the Department of Corrections to implement Section 32 of the Secure DC Omnibus Amendment Act of 2024. Section 32 directs DOC to implement science-based nutrition standards, accommodate DOC residents' dietary restrictions, increase transparency around oversight of the food service program, and expand the hospitality and culinary career training program. Councilmember Pinto, we are very grateful for your leadership in calling for needed improvements to food in DC's jails and introducing the Fresh Starts Act of 2023, which paved the way for Section 32 of Secure DC. We urge the council to allocate funding to ensure these critical improvements are implemented. Within the total $1.5 million requested for implementation of Section 32, we estimate $1 million is needed for DOC to establish and optimally implement nutrition standards that meet the dietary guidelines for Americans. This estimate includes costs associated with 1 full-time staff equivalent to oversee the development and implementation of the nutrition standards and cover anticipated increased costs to add nutrient-dense and higher quality foods to the menu. The recommended food budget increase would cover an additional $1 per person per day, assuming DOC facilities are at maximum capacity. This is similar to the $1.11 per person per day increase in food budget that the Philadelphia Department of Prisons secured to implement the city's citywide nutrition standards, which are also based on the dietary guidelines for Americans. Any increase in the DOC food budget would help facilitate improvements to nutrition and food security for incarcerated individuals. And other jurisdictions have been able to improve prison and jail diet quality with less or no additional food costs. However, we believe Philadelphia is most comparable to DC in terms of the types of menu changes, the population size, and having contracted food service. Hence why we are requesting an additional $1 per person per day in custody. Please note that our request of $1.5 million is significantly lower than the fiscal impact statement estimate for Section 32, which was $4 million. The fiscal impact statement did not provide a breakdown of included costs, so it is unclear why it is inflated compared to CSPI's request. Funding Section 32 could also save the district money by reducing the risk of costly diet-related chronic diseases among DOC residents. In general, evidence indicates that improving diet quality is expected to lead to lower healthcare costs. We urge you to do the right thing and allocate $1.5 million to fully implement Section 32 and put an end to the unethical way we are currently feeding DOC residents. These changes are long overdue and will help set people up for success when they re-enter society. Please do not let Section 32 of Secure DC go unfunded in FY25. Thank you.
Thank you, Silverman. Next, we will turn to Caitlin Holbrook, public witness.
Hello, Councilmember Pinto and members of the Committee on the Judiciary and Public Safety. Thank you for the opportunity to speak. My name is Caitlin Holbrook. I'm a resident of Ward 6 and a local law student advocating for changes to the mayor's proposed fiscal year 25 budget regarding the conditions in the Department of Corrections. Prior to matriculating into law school, I spent 2.5 years with the Food in the DC Jails Working Group and at DC Justice Lab, researching and centering the community and transforming the conditions of confinement in the DC jails. Today, I'm here to urge the council to fund Section 32 of the Secure DC Omnibus, move forward with the rest of the provisions of the Fresh Starts Act not included in the omnibus, allocate funds for technology within the DOC budget towards allowing incarcerated people to testify virtually, and fund the previously passed Corrections Oversight Improvement Omnibus Act. Since leaving for school, I have not had the opportunity to say that I am horrified to see this council return to tough on crime policies, acting upon the emotions of predominantly white and rich members of this community, and placing in more harm's way the Black and brown members. In the proposed DOC budget for FY25, a note states that due to an increase of people, they require more resources. I have and will never advocate for improvement to the conditions in the DOC for the DC Council to incarcerate more people. I advocated for these conditions because they are the baseline for how any of us, but especially government employees, ought to treat people without contingencies based on what someone may or may not have done. And while I'm thankful that some provisions of the Fresh Starts Act were included in the Secure DC Omnibus, I'm disheartened that the entire bill was not passed and that those provisions that were included in the omnibus were not funded within the proposed budget. The least you, the DC Council, could do is not subject people to violence and malnutrition by the DOC while you figure out which side of history you would like to be on. The DOC's estimation of $4 million for the food section of the bill is overinflated. Instead, $1.5 million would cover the cost of the Fresh Starts provisions. As I have suggested before, there are ways to allocate resources within the large DOC budget to ensure proper health and nutrition are prioritized. Over half of the budget goes to institutional security and control, which I and many others have suggested could be reduced if there was investment in alternatives to incarceration and less horrific conditions that lead people to reactive behavior such as violence and brain fog. Moreover, we have presented before in the drafting of the Fresh Starts Act, other institutions have created substantially more healthy and nutritional food programs than our jails at less of a cost. Lastly, there is still a deficit in oversight of the DOC broadly due to the lack of funding to the Corrections Oversight Improvement Omnibus, particularly over the food service program, which, if funded, would ensure the success of the Fresh Starts provisions incorporated within the Secure DC Omnibus as much of the Fresh Starts Act reporting requirements were not included in that bill. All changes to the DOC, food or otherwise, must be done with the compensated expertise of formerly incarcerated DC people. People in the jails should be able to have their voices heard on legislation that affects them and the community they will return to after their time incarcerated. This want to participate by our incarcerated neighbors was evidenced by the overwhelming response to surveys regarding the food in the jails. I urge the council to work with the DOC to allocate resources to technology and education for incarcerated people and to enable them to participate in DC council hearings. I see that I'm out of time. May I please wrap up?
Sure, no problem.
Thank you. Well, I greatly support the inclusion of a training kitchen in the budget for the new jail annex. For this training program and the kitchen to be a success, the kitchen must be designed by a person who designs institutional kitchens, such as for hotels or schools, and not someone who designs carceral facilities. Dan Juicy, Brigade, and the main DOC leadership have repeatedly offered to be a resource in transforming the food service program here, and I embolden the council and the DOC to meet with them and gain their excellent expertise. Thank you for your time, and I'm available to answer any questions.
Thank you very much, Ms. Holbrook, and thank you to all of the witnesses on this panel. Ms. Holbrook, as you know, you were instrumental in the effort to lead to the introduction of Fresh Starts and to really educate me on a lot of the conditions of the food at the DC jail and bring people to the table with lived experience who can share kind of why these updates are so important. And so I'm curious from your perspective, when you estimate that the implementation of those provisions in Secure DC to improve food access and create a hospitality training program would cost closer to $1.5 million. How do you get that estimate?
Yeah, that's based off of the research done by the Food in the DC Jails Working Group. And they were, again, as Jesse Silverman pointed out, they were comparing to the Pennsylvania Department of Corrections. We also can look at the Maine Department of Corrections as examples, and I can put that in my written testimony. But I can let Jesse speak to that more. She continued on that research after I left to law school, if that's okay.
Of course, go ahead, Jesse.
Sure. Yeah. So as I mentioned in my testimony, we believe that 1 million of the 1.5 million would be enough to cover the implementation of nutrition standards, and about the remaining 500,000 would cover the expansion of the hospitality and culinary career training program for the next fiscal year. And the 1 million we estimated would be split between 1 FTE for overseeing the development and implementation of the nutrition standards, and the remainder would go to cover anticipated increased food costs of approximately $1 per person in custody per day, if assuming that the DOC facilities are at maximum capacity. And like Caitlin was just saying, that's based on the amount of food budget increase when Philadelphia's Department of Prisons did something similar.
And I will just add, I've been a little bit removed since I've been at law school, but since I left, I haven't seen the numbers of when Aramark is allocating funding towards ingredients versus labor. And so I'm sure that there's ways in the current budget as towards Aramark and changing those procurement standards that could help. We could help expand that budget within the current DOC budget as well. Not to say that we don't need the 1.5 million, but I think that there are ways to better serve the current budget in addition to that.
Agree. We could have had a much more informed estimate if we knew how the current Aramark contract funds were being spent among food costs and labor and other costs.
Understood. Okay, we will follow up with the DOC about this as well. Thank you. Thank you all so much.
Thank you.
Okay, that completes our public witnesses for today's hearing. Thank you all for your perspective and your time and testimony today. We really appreciate all of your perspectives. We are now going to turn to our government witness, Thomas Faust, who's the director of the DC Department of Corrections. Welcome, Director Faust. And for any team members joining you, if you can please turn the microphone on and introduce your name and title for the record. And if you need another chair, feel free to pull one up. Go ahead, Michelle. We could start with you. If you could say your name and title for the record, please. And make sure your microphone's on.
Good afternoon. It's red. Oh, I
Yep,
thought it was,
it's
okay.
on.
I thought it was green. Good afternoon, Michelle Wilson, Deputy Director of Administration, DC Department of Corrections.
Great.
Good afternoon, Giselle Ponder, District Department of Corrections.
Go ahead.
Good afternoon, Jacqueline Williams, DC Department of Corrections, Deputy Director.
Good afternoon, Anthony Norman, ACFO, OCFO.
Sorry, could you talk into the microphone? The TV won't pick
Yes,
it up
I'm
unless.
sorry. Anthony Norman, OCFO, AFO. Thank you.
Wonderful, thank you. Welcome to you all. And as you know, it's the tradition of this committee to swear in all government witnesses who appear before it. So if I can ask you to keep your microphones on and raise your right hand. And when it's red, then you know it's on. Michelle, yeah, with the little button on the bottom. There you go. Do you swear under penalty of law that the testimony you're about to provide before the Council of the District of Columbia and this committee is the truth, the whole truth, and nothing but the truth? Great, thank you all. Please take a seat. And Director Faust, I'd now like to invite you to make any opening statement that you may have.
Thank you. Good afternoon, Chairperson Pinto, members of the Committee on the Judiciary and Public Safety. I am Tom Faust, Director of the DC Department of Corrections. I want to begin by thanking Mayor Bowser and the Council for your recent commitment to the passage of Secure DC, a comprehensive legislative package that will positively impact public safety in the District of Columbia. DOC will continue to work with MPD and our other criminal justice partners to ensure the city's neighborhoods and communities stay safe for residents and visitors to our great city. The mayor's commitment to Secure DC and the mission of DOC is reflected in the fiscal 25 budget, which supports our secure facility population increase and the critical needs of our residents, including healthcare, nourishment, continued educational support for some of the district's most vulnerable students. It also supports our workforce through hiring and retention incentives and funding for continued hiring in critical areas. And within the mayor's capital budget, there is forward movement on the new jail annex construction, which will be a facility focused on resident programming and rehabilitation. As always, I acknowledge with gratitude the continued hard work and commitment of the DOC workforce. Their work, while challenging, must each day be carried out with a laser focus on optimizing safety and security. Our team serves with passion, pride, and professionalism to ensure those in our custody have safe and secure housing, access to health care, mental health and substance abuse services, education, workforce development, and reentry programming. DOC operates our facility with an average daily population today of 1,872 inmates. This total includes pretrial detainees, sentence misdemeanants, sentence felons, and parole violators. Our operation is supported by two primary correctional facilities, the Correctional Detention Facility and the Correctional Treatment Facility. DOC also operates and maintains the district's central cell block for temporary holding and contracts with Fairview, a privately operated halfway house serving women. Mayor Bowser has allocated a FY25 total gross operating budget of $222,434,789 for DOC, which is a 12.5% increase from the FY24 budget. This budget supports 1,231 FTEs, consisting of 948 uniform correctional officer positions and 283 non-uniform positions. The budget is composed of $204.2 million in local funds, $17.7 million in special purpose revenue funds, and $0.5 million in federal funding. Mayor Bowser's FY25 budget continued the investment of $29 million in capital funds in FY25 and $474 million in the 6-year plan that will be used to address the jail's annex, design, planning, and construction, general renovations for both CDF and CTF, and also emergency power projects. DOC is made up of 6 divisions that include agency fiscal operations, agency management, DC jail operations, inmate services, investigation operations, and post-release services. The proposed budget distribution within these divisions is as follows. Agency fiscal operations, $2.1 million or less than 1% of the total budget. Agency management, $28.8 million or approximately 13% of the budget. Jail operations, $101.7 million or approximately 46% of the total budget. Inmate services, $85.7 million or approximately 39% of the total budget. Investigative operations, $1.5 million, less than 1% of the budget. And post-release services, $2.6 million or approximately 1% of the budget. In direct response to district legislation aimed at curbing crime, DOC continues its commitment to public safety by providing safe and secure housing and services to the increased number of individuals being held pre-trial. Since July 2023, we have seen steady population growth within our facilities. Operationally, this means greater staff responsibility as they manage not only larger numbers of inmates, but also those who present with more serious and violent offenses and behaviors. These factors result in DOC having to operate additional housing units, manage additional inmate separations, oversee increases in internal and external movements, and focus on the safe and secure housing of a diverse and more challenging population. As our secure facility population continues to grow, it is difficult to determine exactly when the numbers should plateau. However, the mayor remains committed to addressing the multifaceted needs of those in our custody, and in fact has added $1.8 million in funding to address basic needs and services of the residents. We are also aware that our current population has an increased need for behavioral and mental health services. Therefore, the mayor's budget has increased support for the inmate health care contract by $21 million, which provides comprehensive health care as well as the behavioral and mental health care services referenced above. The budget also provides increased funding levels for consumables, including security supplies, resident clothing, grooming needs, and other necessary supplies. Our commitment to the DOC workforce is a critical component of our ability to provide a safe and secure environment. The mayor's budget has provided $400,000 to support retention and hiring efforts for correctional officer positions at the Department of Corrections. DOC also recognizes that retention of staff is critical, and retention is what allows the agency to keep our uniform staff numbers stable. Our newly hired wellness coordinator is interacting with employees at all levels, developing programming and creating committees to execute wellness programming throughout the agency. In conjunction with the activities described, the mayor's budget allows us to offer increased signing bonuses and referral incentives to current employees invested in growing our workforce. To remain competitive with neighboring jurisdictions, the mayor's budget will allow us to offer a $3,000 hiring incentive for newly hired correctional officers upon completion of their basic correctional training program, and an additional $3,000 upon the completion of their 18-month probationary period. Our current employees understand what is required to work, prosper, and grow within our agency. And often, our own employees are the best resources for identifying new talent to come and work for DOC. DOC will incentivize them to bring in new talent by offering current employees $2,000 for every referred recruit that satisfactorily completes the basic training academy, and an additional $1,000 for every referred recruit that makes it successfully through the 18-month probationary period. Lastly, DOC understands the need to be very intentional in stabilizing our vacancy rate, which is why we intend to find and fund within our current budget additional opportunities for targeted civilianization of some of our positions. So I'd like to just take a moment to do a little plug and say DOC now is hiring. So for anybody listening out there, please go to doc.dc.gov, and we have information on there on how to apply and have a great career with DOC. So please, again, doc.dc.gov, we are hiring. Regarding resident support, we continue to offer a range of program opportunities, including mandated and advanced educational opportunities, workforce development, and pre- and post-release reentry support. For example, from October 1, 2023 to the present, DOC's Ready Center has serviced over 3,100 individuals. Additionally, our tablet programs remain popular with residents, and we expand programming and educational options and work to make more of the facility available for wireless connectivity. Our commitment to providing educational services remains unwavering, even with financial resource challenges. DOC is committed to providing services to our entering resident students with IEPs through the assistance of a third party in fiscal year 25. The educational team continues to offer in-person learning opportunities, and we have hosted several graduation ceremonies. Student success speaks directly to personal perseverance and the willingness of our staff and partners to prepare students for release and successful reintegration. We will continue to build on that success. DOC remains engaged and excited about our ability to plan, construct, and deliver a new annex building on the DOC campus within the Mayor's Capital Plan. This project is in active development with the architectural planning contractor. A plan for a phased approach for the facility has been presented to senior leadership officials, and the mayor stands ready to support it in FY25 with $24 million in the capital budget. With the 6-year funding plan of $463 million. DOC remains on track for groundbreaking for phase 1 of the new facility in the first quarter of fiscal year 2027. DOC recognizes the importance of housing our residents safely, humanely, and with respect in a rehabilitative focused facility. And we appreciate the mayor's shared commitment to those foundational standards. This commitment provides a transformational investment for the district in corrections rehabilitation. The mayor's budget also addresses the emergency power project, which will support a new generator. The $3 million commitment will ensure DOC can continue to support critical infrastructure needs within CTF during times of emergency power outages. This new generator will also provide emergency support in times of commercial power disruptions for the new steam plant, which is currently in development. Mayor Bowser's FY25 budget supports the agency's mission and priorities as we continue our work toward becoming a benchmark corrections agency, elevating our workforce, and expanding programming and treatment opportunities for residents. I thank you, Chairperson Pinto, for the opportunity to testify and look forward to answering any questions you may have. Thank you.
Great. Thank you very much, Director Faust, and thank you to your team and all those who work hard at DOC throughout the year, those who are here and who are not here today. We will elevate your hiring notice to those who may be interested. It is extremely important that we fill those vacancies and get those positions hired. I want to just first ask you and give you an opportunity to respond to much of what we heard today from public witnesses. There were different topics, but I would describe most of them as quite disturbing. And so I'm curious if you have a response to some of those concerns that were raised as you listened to the testimony, whether that be around cold food served or punishment focused solitary or solitary over the course of many, many months, or conditions at CCB or people asking for medication and not receiving it, and kind of what you thought as you heard that testimony and what your response is.
Well, first, I mean, for the individuals that testified, I certainly feel for whatever experiences that they have had in correction systems in general. You know, those are very disturbing to hear their own personal stories. While it's hard or almost impossible for me to comment on specific individuals or specific instances, you know, I would say certainly one thing, and I'll just give a broad perspective on restrictive housing, because we do not practice solitary confinement. I think one of the things is that, and I absolutely agree, I would say, with a number of people who testified regarding their experiences in prisons. I think most, if not all of the individuals who testified did reference, for instance, the Federal Bureau of Prisons or other prison conditions. And I agree that it has been shown that prolonged isolation is extremely negative. And there have been many studies that have come out, and those studies are around, again, prolonged isolation in prison settings. And so I think many times it's somewhat gets conflated between prisons and what some of the historic practices have been in prison systems versus a local jail system. And that's just in a broad sense. For example, I know you asked at least one of the witnesses about talking about restrictive housing or disciplinary housing and asking, well, how would they handle, some certain small amount of individuals? And it just kept coming back to, well, we would carve out a few on medical exceptions and self-harm exceptions. But I didn't hear anything about how are you going to handle those few individuals, a small, very small percentage, who are absolutely violent and who absolutely are a danger to other residents in the facility. I would give a very tragic example that, as you know, Chairperson Pinto, we experienced in DOC not too long ago, where we had a very violent resident who had manufactured a homemade knife or a shank and viciously stabbed and murdered another resident in our facility. And that was extremely tragic. I will not ever put that person immediately back into a general population. That individual cannot be. So I would ask for some people, what is the answer for that? That's not a self-harm exception, and that's not a medical exception. That's someone who is a absolute stone cold killer. Now, having said that, we do not have prolonged isolation in the DC jail. Those individuals who are put into restrictive housing, it's no more than 30 days. So we do not have a situation of prolonged, I believe I heard one witness talk about being in a situation of a restrictive housing or disciplinary housing, I assume in a prison for something like 2 years. Absolutely, somebody who's, and there are many case studies of individuals in prison systems that have been put away into restrictive disciplinary housing for years on at a time. And as was mentioned, and I'm one of those people in terms of those national associations, the Correctional Leaders Association of America, made up of all the state directors and the director of District of Columbia, all 50 state directors. And we have come out as an association to say that long-term prolonged isolation is very much a negative and something as a professional association that we don't agree with and something that needs to continue to be addressed. But our philosophy and the way we work is that we will continue to work to reduce, we have to continue to work to reduce the use of restrictive housing only to those few that at some time, there's no option. One thing, just to finish up on that point, that I'm very proud of is about 2 years ago, when my first oversight hearing as director, we were running at about a 12% of our population that was being held in restrictive housing. We are now at about 3.5%. So we have worked on a drastic reduction of those individuals who are in restrictive housing.
Thank you very much for that, Director Faust. And we've talked in the past before, and this came up at an oversight hearing maybe 2 years ago at this point, of some of the examples that public witnesses were talking about from their experience with BOP facilities, and citing things that aren't, in some instances, aren't present at DOC or aren't part of the process. But today we heard testimony from someone talking about their intake experience at DC jail specifically, and being there, I believe he said, for 8 days, and that people weren't being given basic toiletries or sheets or socks. And so I do want to make sure that we distinguish that some of the testimony was specifically about the DC jail and experiences there.
Right.
Okay. So I guess kind of on that note, what is the follow-up process if there is an instance where somebody is not receiving basic necessities and it gets reported, or you hear her? How does the reporting system work, and how does the consequence work for correctional office staff?
Well, again, as far as intake, someone who comes into the intake area within 72 hours, they are seen, classified within that 72-hour period, and get initial medical screening, mental health screening. All that happens at initial intake. Again, without I can't speak to specifics, but I can assure you that we do provide daily necessities and supplies for the residents in the jail. We are, as was testified, I mean, CIC comes and inspects, the marshals come and inspects, the Department of Health comes and inspects. So the American Correctional Association comes and inspects, so we welcome inspections. We don't have any, so those things are provided, and I have an absolute commitment. I have a zero tolerance for if I find out that an item like that is not provided that should be. But again, in terms of your question, how is it handled? Anyone who would file a complaint through, whether it's through the grievance process or an intake when they have their initial interview with their case manager, there's a case manager available that would take any complaints. We have supervisory level staff that are available and within the facility. So, I mean, all those methods are available.
Thank you. So let's talk about the budget. So capital investments, there is a proposal of about $474 million over the next 6 years for the design and construction of the new correctional treatment facility annex. Your testimony mentioned that portions of this funding will also be used for general renovations for the central detention facility, CDF, and CTF and emergency power projects. How much of this annex funding is considered to be used for the temporary transition of individuals to 501 New York Avenue while construction takes place?
The budget, first off, the budget for the renovation and preparing the central cell block is in the DGS budget, if that's what you're referring to. DGS budget has capital money for the renovation of 501 New York Avenue.
Is it your understanding that there is no money in this year's budget for the renovation of the central cell block? Yeah.
You're talking about the current, the central cell
Yes.
block that we're.
I'm sorry, I was
Yeah,
unclear. Let's,
sorry.
we'll
Get it
separate them.
low.
First, central cell block. Is it your understanding, as it is mine, that there is no current funding for renovations of the central cell block?
Specifically for renovating the central cell block?
Right.
No, but we have ongoing capital money for maintenance and ongoing maintenance of the cell block, yes.
Okay, is that something that you believe needs to be renovated?
No, what I believe needs to happen is that we need to move to 501 New York Avenue as soon as possible.
Well, I hear you on the 501 New York Avenue. However, that is meant to be a temporary location only during the renovations. And so it's hard to imagine something will be, or ensure that something will be only temporary when there's not funding in place for the central cell block itself.
Well, again, the move, it's in, I believe, DOC's best interest and the district's best interest to hasten the move and finish the renovation of 501 New York Avenue so that we can, right now, I believe it's, or I know it's planned at this point that it would be ready for opening sometime in the spring of 2025. So I think the sooner we do that, the better.
I hear you. I guess I would just say the move, the part of the deal of the move was that it was temporary. And so we have to have full funding in place for the central cell block renovations before the temporary move, because otherwise a temporary move could turn into a permanent move.
Well, again, whether the current CCB, whenever that renovation of the current CCB takes place, whatever time period that is, right now, we need to address the current conditions as they are today, which I believe necessitates the move to 501 New York Avenue.
Okay, well, let's continue the conversation on this project so we can make sure we're get on the same page. So what stage are we of the project's, switching gears to the full renovation of the annex and build of the new annex? What stage are we with the design?
Well, we're still in the very early stages. There is not yet a design. So we're not even at that stage yet. Just to give you a little kind of brief background or bring up to date of where we are. So as you know, the district brought on CGL as an architectural program consultant. And they came on this past summer. And what they are doing currently is basically to develop concepts and essentially a roadmap for future actual architectural and engineering phases that have yet to come. So they are involved and have been involved now over these months since they came on board in what's called like pre-design work. So they also, part of their responsibility will be, as we go forward, to provide overall project direction or help us with overall project direction. But in terms of pre-design work, it's things like, updating population forecasts, user population profiles, who do we have in jail? Like particularly, some of the characteristics of our jail population have changed over the years. So it's looking at those, who are the population users and the profiles of those users? What are the users' needs? As you've heard, and certainly I think we all know, there's ever increasing need for more behavioral health programming. Things like adjacencies of programs and services. So, what needs, as we get later into an actual design, what needs to be co-located to something else? Where should medical be related to intake, or, those types of things. They've been conducting surveys of the resident population in terms of what they feel as users, what are their needs. They are doing things like documenting all the utilities. So it's preparing the basis for the actual design specs. And then the next phase would be actually, having a design, something you can look at. And that's something from the very beginning we have been, I've been very committed to, and we've been very direct about in working with CGL, is we've taken from the very beginning a lot of the things that the Council for Court Excellence in their paper back in 2020 and 2021, the Jails and Justice Task Force, where they laid out different tenets in terms of some of the things that should that a new jail should be. That we want a new jail that blends in with the community in the area in terms of design, that we want a new jail that is very heavy in programming and rehabilitative programming, that we want a new jail facility, for example, that again, innovative programming, reentry, comprehensive medical and mental health care, having a pod model for housing, all of those things. But at the end of the day, really a facility, again, in terms of being transformational, we have a chance to have a facility that really promotes rehabilitation and reentry. And so those those thought concepts, we continue to work with CGL to say, as we move forward, those are the types of things that we want to see
And Director,
in a design.
okay, and thank you. And I don't mean to cut you off, but are there plans for follow-up community engagement, particularly with the district's task force on jails and justice?
Yes, there is. In fact, in the contract, and that DGS holds the contract with CGL, but in that contract, and within the statement of work, and I thank the Council for Court Excellence, from the beginning, I had reached out to them and asked for input in terms of some suggestions they had for the statement of work. And so some of the things that are in the contract and will be coming, for example, they recommended surveys, which we have done, and CGL has done surveys with staff surveys and resident surveys about what would they like to see. Community feedback sessions are a requirement within the statement of work and within the contract. Providing an online mechanism for the public to submit comments, that's getting ready to go, so that there would be a web-based system set up so that the public can provide comments about a new jail facility. And then also within the contract, there is stipulated meetings that CGL is to meet with the task force on jails and justice. I know that just recently, there was probably some frustration that was expressed about a meeting in March. But essentially, that was a timing issue because the mayor's budget wasn't even out. So there was nothing that could be, met with in terms of having a meeting about the jail or funding around the jail when the mayor's budget hadn't even been out yet. But I do have very good working relationship with Dr. Shelley Broderick, who's the chair of Jails and Justice Task Force. We talk and I believe we have a good working relationship.
Okay. Well, thank you so much. And I think that's definitely promising all of the ways that the contract lays out community engagement. I find with these things that it is very helpful to start early to most effectively incorporate those design ideas where possible, because just thinking of a number of projects we're dealing with now and other in other areas that now the community is offering their design ideas and the agencies are saying, or the architects are saying it's too late. So just want to make sure we're proactive about that.
And again, just to repeat, that there is not yet a actual design.
Right.
What has happened is, again, CGL has taken all those things I mentioned about, what are users saying, what are this, and then all that information is going to be taken in along with a lot of the concepts that the Jails and Justice Task Force put in writing back in 2020 and 2021. And then they're taking all those concepts and then as a result of that, come up with a design.
I got you. Okay. Well, thank you. So last year in the budget, the cost estimated for the new correctional facility was $280 million through FY 2029, and it's currently at $477 million. So why the almost $200 million jump in the estimate?
Well, those numbers have now been, again, with once there became a program consultant that came on board and was actually able to look at the numbers. That initial, I would have to say that initial was identifying capital money that needed to be held or, a placeholder, so to speak, for capital budget for the facility. But then once we had a professional consultant on board, then they look at things, for example, what are the factors in terms of price increases going from year to year to year to year. It can't be static. In other words, what if you're in 2022 and your building is going to start in FY 27, groundbreaking, well, between 2022 and FY 27, there's going to be cost and inflationary costs. And that's just one example. But also looking at things like materials and, all the details that have to be looked at. And what the mayor has done and we're now insured is with the 25 million this year, right? The 24 million that's currently in FY 25, what that ensures is that there will be no slowdown in the process. So the process will continue to move forward as it's planned. That money will allow for DGS to move forward when the time comes to contract for the next phase for architectural and engineering services. So that 24 million that's placed in FY 25 right now ensures that the project won't slow down.
Gotcha. Thank you very much for that context. So I want to ask you about the provisions of Secure DC that affect the operations at DOC, particularly around the provision of healthier food and establishing a hospitality training program.
Okay.
So while there are elements of the mayor's proposal that say that those provisions are not funded. But then there are a few items in DOC budget that look like they could be partially funded. One of which says that section 32B of Secure DC is funded, which is the Fresh Starts component. That line item. That's at 1,817,000 to enhance section 32B to Secure DC for one-time funding. And then there's a enhancement of $21 million to ensure inmates are in good health and live in a good environment. So how should we be reading those numbers?
21 million is specifically for medical care services,
Okay.
medical contract.
So there, it is only for that purpose and none of that can be utilized for food.
Correct.
Has that contract already been kind of worked out, negotiated, estimated?
So we are, if you can hear me, we are currently in the process of negotiating a new contract or soliciting, sorry, thank you, soliciting a new contract for medical services. And so we are in the active process of it, but understanding that there are going to be I guess the simplest terms are some inflationary costs and some looking at population, where we are in terms of our population, where we are in terms of, because I just remind council that when this was funded, medical was funded in, bless you, in FY '24, it was based off of a population of 1,350. And so we are definitely not at that point at this point in time. And so understanding that there are going to be some adjustments that have to be made for the new contract, medical services contract, the needs, the changes within the population in terms of their needs, that money is specifically for the medical contract.
Got it. Okay. And then what about the $1.8 million to support, quote, section 32B of Secure DC?
The 1.8 million in FY '25 is to support increases in population, but in all areas such as consumable goods, toiletries, clothing, bedding, all those types of things. And I mean, as the director, I will say that DOC, particularly with a population that we continue to watch and hopefully it will kind of plateau at a point. But as we continue to look at the population, we need to have the flexibility within that 1.8 million to support those increases in population. So that 1.8 million will go toward things, again, due to the increases, or if they're continuing increases of population in FY '25, to support consumable goods, to support the need for toiletries, again, clothing, bedding. So all of those items on a needs basis.
Okay, so it's not funding to implement section 32B of Secure DC. It's funding to accommodate for the growing population and what their kind of basic needs are in the facility. Is that accurate? It's not funding to implement the provisions of 32B, which are around improved health standards, nutrition, and the hospitality training program. It's instead funding to just accommodate the basic needs of a growing population.
So section 33 is about the food service and the nutrition aspect, and section 32 is regarding the increased population and the needs of the increased population. And so the 1.8 million is to support the increased population within the facility. And so the needs of an increased population. So it's like the amount of money you spend when it's 2 people in a house changes when you invite all of your extended family over and they stay for 2 months. So to the needs of toiletries, food, food services, all of those things increase because of their additional people there. And so that's what it's supporting. It has not been earmarked for the food services increase as outlined in section, I believe, 33.
Okay, I think what we have is that the 32B was for around fresh starts and section 33 was around the YRA changes. But regardless, I think even if it's just a kind of section difference, that's helpful to understand the context of what you're thinking those funds are for, which makes sense as a need, certainly. But so it is a continued funding need and gap that we have to have those provisions be fully implemented. I want to ask you about how you came to the fiscal impact estimate for those provisions of Secure DC around food and hospitality training. I know we worked closely together throughout that to respond to some of the unique challenges that we have in DC, or I shouldn't say challenges, but differences we have in some of the other jurisdictions, whether that be farming or different issues with the climate. But how did you come to those estimates?
Well, in general, what we did, we sat down with and consulted with our food service vendor. And so the rates were derived from the vendor to address specific revisions. In other words, things such as when you get specific into the nutrient dense and the specific servings that are required, number of servings per day. But those rates again were derived in us working with the vendor.
Okay, and what sort of commitments can you make with the budget you currently have as proposed to improve food access to nutrient dense, rich food options?
Well, we do continue to look at ways that we can improve the menu. One of the things, we have some additional funds that are built into the food budget. I believe we have an increase in our base budget of about $1 million in the base budget for food. Right. 1.025 million. So again, whether some of that is, just population based, but we feel we have some wiggle room right now with that additional money and funding that we can at least start to work toward that. Now, it's not going to implement all the requirements of the legislation, but we can continue to start to make some improvements. One of the examples is, and because I think it's good to look at, from a comparative standpoint, we here in DC, I mean, we're right in line in terms of food and food service with all the other jurisdictions within the, within the DMV. Just our vendor itself has the same contract, that DOC has with City of Alexandria, Arlington County Jail, Fairfax County Jail, Anne Arundel County Jail, Prince George's County Jail, St. Mary's County Jail. We are, in comparison with 6 other jurisdictions, all within the DMV, we're right in line with that. I think that's important to note. But that being said, one of the things that I'm looking at and we're trying to do is look at healthy ways within our current budget to increase our calories so that we can address 2 things. One, increase some calories in terms of some of the comments we get around, fullness or lack of fullness, but increase those calories, how we can do it in a healthy way. And if we can, you know, one of our goals is we're looking at right now is what can we do? Because we have a 2,800 calorie menu right now, which, you know, which meets the federal Department of Agriculture, USDA guidelines. We're looking to see what we can do to tweak it to get it up to a couple hundred more to 3,000 calories. And again, and how can we do that and be cognizant of doing it in a more healthy way, you know, not, I mean, so that's one of the examples of things that we're continuing to look at. As I mentioned before, we've added a tremendous amount of healthy options on the commissary side too. So we
Can you talk about what some of those are?
Sure, on the commissary side, we've added, you know, all kinds of
Protein.
yeah,
and-
protein things like tuna fish, granola bars, protein bars. We have protein drinks. What else? Are there? A
so
lot of.
There's the proteins, which they've been asking for additional protein items. We've added again granola, some healthy snacks, some nuts, fruits, not fruits because they don't have the shelf life. So it's mainly nuts, things of that nature, things with lower calories, less sugar items have been added to the commissary menu.
So we've done a lot to, you know, get away from just chips and things like that on the commissary side. And I really think with what we're going to try to work with the vendor to up our calorie count by a couple hundred, which then again, out of all those jurisdictions that I mentioned, we'll be right up at the top. So I think, you know, we will continue to work but we need to work to make incremental improvements.
So regarding staffing, what's my page here? Am I reading this correctly that we have 264 vacant positions at CDF and CTF combined?
Are you're asking about total staffing or just correctional officer staffing?
I
just
guess
wanna be-
both.
So we have total approved positions are 1,231. And we currently have, of all our staff, we have 1,012 staff members. So total staff. And of that, 715 are correctional officers. And right now, 297 are non-uniform staff, civilian staff.
Okay, so that comes out
Oh, there.
more like 119 vacancies.
No, it's total of 219 vacancies. So 1,231 staff members total. And then we have.
No, you said 1,112.
1,012.
Oh, 1,012. Gotcha.
1,012. So that's 219 vacant positions. I will say that we have converted a few positions that were typically correctional officer positions to non-civilian positions in order to move as many of our correctional officers we're trying to move as many correctional officers onto the housing units as possible. And so some areas where we can maybe not have correctional officers working, like a radio room or something to that effect. So we're trying to civilianize some of those positions to just help with the need in that area.
Got it. Okay. And so I see a $400,000 increase to support retention and hiring efforts. So how is that going to be used, and how does what we're seeing now with staffing affect overtime pay?
I think I see it as two different things. So our ultimate goal is to increase our correctional officer staffing numbers so if we have more staff available to work and able to work, then we are able to reduce our overtime. So we're less likely to have to require officers to do additional overtime. and as we increase our staffing numbers. So that's our ultimate goal, is to have more staff on hand and to be able to decrease the number of hours of overtime that we are requiring our officers to have to work. And then as for the incentive, our goal is simply, quite honestly, to try to be more competitive with our neighbors and within the district as well. So a lot of our neighbors within, whether it's police officers, whether it's correctional officers in the district and in surrounding areas, are offering higher incentives to recruit and to bring in additional uniform staff. And so in order to be competitive, we want to be able to offer those type of incentives. And we also want to promote the Department of Corrections, which whether it be as a marketing strategy. So some of those funds will be used to create a marketing campaign so that people learn more about, I mean, if you listen to a hearing like today, you question the Department of Corrections, but it is actually our average staff stay about 10 years. And so most people, you would not get that from what you heard or what you hear in a hearing like this. And so it is a large extended family. And as I've said before, it is a city within a city. We are a city within a city. And so we need that support, and we need we need more officers and to come in and work in our facility. So we are actively promoting and trying to engage and get more uniformed staff within the facility.
And so again, that money, you spoke of the 400,000, would be us implementing what I mentioned in my testimony about having incentives, both for people coming in the front door, and then on the retention side is why we're setting up a plan for, or have set up a plan for, on the retention side, not only once they complete the training academy, but then 18 months later, after they successfully complete their probationary period, there's a second incentive, and that's more addressing the retention part of it. And then things like, we just recently brought on board for the first time ever a wellness coordinator. That also in the long term is going to, I truly believe, will help affect retention issues also.
What efforts are underway to protect staff safety?
Efforts on the way to protect staff safety. There's just a myriad of things in terms of protecting staff safety. One of the, I think, the best safety measures is that we now have all corrections staff with body-worn cameras. That I see that as protecting staff, actually. So we have body-worn cameras for staff. We've instituted a lot of new technologies throughout both facilities. We have a lot of new technologies in terms of screening devices, in terms of detection devices, in terms of screening incoming mail, documents, all of those sort of things to address the contraband issues, because if we successfully address contraband, we also successfully help improve the safety for our staff. So those are some of the areas.
Okay, thank you. And thank you so much for sharing the update on the body-worn camera. As you may have heard, I think 3 or 4 witnesses testified today that would be an important improvement. So that is a good PSA.
Yes,
that
our corrections officers all have body-worn cameras.
Okay, thank you very much. So I want to ask you a little bit about programming and reentry services available to residents. So I'm very pleased to see that there's an increase of $4.5 million to support the needs of students within the IEP program. Can you describe generally how your contract with Maya Angelou works and how it's going? We've heard from the school that their teachers do not qualify for additional charter funding because they're not considered charter teachers or DCPS teachers. And so will any of this funding be used to support the Maya Angelou teaching staff?
Well, I mean, the 4.5 million is specifically for the Maya contract. So I mean, through the contract, it's supporting staff.
We have a contract with See Forever Foundation, and as part of that contract, See Forever Foundation determines the rate of pay for their teachers and what is appropriate, the rate of pay for their teachers. We are actually, the $4.5 million is actually more than UPSFF funds. So receiving those funds is actually, I'm not really sure if we were locked into that, we would be at a significantly lower, they would be at a significantly lower rate than, so I'm not sure. We can't control. What we'll say is we contract with See Forever Foundation, and how they choose to pay and support their teachers. It's like any other contract for us. It's really up to that vendor to determine the rate of pay and how they pay their teachers. What we've seen is that their rates, when we are certainly competitive, because we are a correctional facility, and that is something that you're mindful of when they're trying to hire and bring people in, that they're bringing people in to teach within a correctional facility. But we wouldn't control those basic those rates. But we are mindful that if it was simply based off of UPSFF funds, that it would be at a very different rate than what it is right now.
Got it. Okay, thank you so much. That's helpful context. And we've also heard from some teachers concerns about having to divide up into different spaces and classrooms to teach, or different housing units rather, instead of instruction being provided to students jointly in a classroom. Have you heard of this concern, or is there anything that you all are doing to address this?
So we have four or five different classroom spaces, and that's based off of if a person is in general population versus if a person is in restrictive housing. So we have 2 general population units, and we have 3 spaces that we utilize for those that are in restrictive housing for teaching.
So what was that last part you said? 3 different ones?
Yes.
Okay. Are there any spaces available that would be able to accommodate a larger group of students together?
Not currently, no.
So is it a spacing issue mostly, or a?
So no, I'm sorry.
It's not a spacing issue. We are mindful of the fact that, again, we have a population of individuals who were taken from the entire District of Columbia community and various neighborhoods within that community, and they cannot necessarily be housed together. And so we have had to create spaces and places in order to be able to educate individuals who cannot necessarily be in the classroom space together. And so we are working through that. We've dedicated 4 housing units in order to accommodate the various needs of all of the student population. So while in the perfect world, it would be great to put all of the students together in one classroom or as needed, that's not always what is best for the students that we have in our care.
Okay, I hear you.
Yeah, we have about 35% of our population, we have keep separates on.
Oh, overall?
Overall, yeah.
Wow, okay. Thank you. So in terms of the culinary training program, how many residents are eligible to participate? And what percentage of residents begin the training but don't complete it?
So the eligibility criteria for the culinary program really is extremely basic. Those who don't have separations or separatees can participate in that program at the CTF, both male and female. I don't have the numbers of how many that haven't completed.
Is separatee the same concept that the director was just talking about?
Yes.
Okay.
Yes. So
what was the term of art you used, director?
Keep separate.
Keep separate.
Keep separate.
Keep separate.
Got it. Okay, sorry, deputy, continue.
Yes, so those who haven't had any level of disciplinary infractions over the last 120 days, and those who don't have keep separates are allowed to participate in that programming. We also looking to expand that programming over at the CDF side as well.
Okay. And who determines the keep separates?
there's a number of different factors that determines keep separates. You can have a court-ordered keep separate. You can have those who had any issues amongst themselves, crew or gang affiliated issues will all determine what keep separate would look like.
Okay, and so I know you can't speak for her, but the representative from the Public Defender Service who was talking about some people can't participate in programming because of what they're in for. Do you think that's what she was referring to? That there were some keep separates who then were, or people who were placed on a keep separate list who then were unable to participate in culinary?
So I think it's a very general statement because not everyone wants to participate in the culinary, and we have a variety of different programs and services that's offered to those who can and cannot participate because of a level of keep separates. There was a lot of discussion around those that are max custody residents getting programming and services. We have a number of tablet programs, over 620 tablet programs on the educational tablets, that those who cannot necessarily participate in an in-person program can also participate virtually in those programs as well. So we're trying to be very strategic in making sure that we have some level of offerings for those who can and cannot be in a classroom setting.
Thank you.
Can I just also say, I'm sorry, the lawyer in me is forced to respond to just a few of the comments that were made by the Public Defender Service that were not accurate as to DOC. Number one, we are one of the few jails and facilities, correctional facilities within the country that started and implemented a laptop-based discovery review program that in the country that has it. We started it during the pandemic with 8 laptops. We are now at over 20 laptops that allow residents 2 weeks at a time to review discovery and their discovery materials that their attorneys bring in for them. So they are able to meet with their attorneys and then get on our waiting list, however long that may be, and then have a laptop given to them and a flash drive where they're able to review their discovery at their leisure for up to 2 weeks at a time. And then if they still need additional time, they can go back on the list. Yeah, and so that's really, and we've checked throughout the pandemic to see what other places were doing, and very few other places, and I think there was only 1 or 2 others that even had a program anywhere near that. And so the fact that we allow that and have expanded it post-pandemic, I think speaks to some of the things that we do. In addition to that, it was the Public Defender Service during the pandemic that specifically requested that we implement video hearings for adjustment boards. We were doing it via the phone during the early part of the pandemic, and it was the Public Defender Service that pushed for video hearings. We've implemented them. We started them. We're doing them. And now that they're getting more guilties by having video hearings, that now today seems to present a problem, which was the first that we've heard about this problem that they're having, that they don't like the video system because it was their request. And we implemented it we've moved people around and made adjustments in order to have do this technology, which is not easy for us. And then today to say that they're not happy with something they requested, I thought was very interesting. The other thing I want to just comment on was when we talk about legal visits, we've heard the complaints. We have tightened up our restrictions when it comes to lawyers and anyone entering our facility. We've added cameras outside the facility. We've adjusted and updated our cameras within our facility as well. But we've also are holding the attorneys that come in to a higher standard and higher expectations. So yes, we are not allowing any type of item you want to bring in to come in. We're questioning, we're stopping people, and we're expecting our contractor at the door to stop people if they have an issue. And any attorney is welcome to request to speak to a supervisor if their item that they're seeking to bring in is not allowed in. So there are higher restrictions on us because we're trying to keep contraband out of the facility. That's what we're attempting to do. And so yes, and we've had to ban some attorneys because of the things that they have attempted to bring in. So it's not as easy. But what we've also done is we've increased the amount of, we've ensured that every visitation hall is open 24/7, anytime. I'm not saying to you that there's a correctional officer that's sitting there if it's empty, But if an attorney comes in and their client is on that floor and they need to speak to an attorney, we are opening that visitation hall. We are ensuring that that person can come in and see them, and we're doing that. The complaint from the Public Defender Service was that they didn't have privacy with their client who may be on restrictive housing. So what we've done is we've installed in private rooms, there are bars on the wall so that they can unhook and they can sit and speak to their attorney in a private space. I understand an attorney is going to say, I don't want my client to have any restrictions or take all the handcuffs on them and all of that off. But that's a safety and security issue. That's something that we have to be mindful of. And sometimes attorneys are delivering news that is not so great and people might not have positive reactions. As a defender, the director has said, we have a large population who have behavioral health, mental health issues, and substance abuse issues. And so we don't know what type of reaction they're going to have to news that may be delivered by their attorney and different things. So just unhooking someone at the demand of the Public Defender Service or any attorney who walks in is a safety and security hazard for that individual, for that attorney, and also potentially for other people who are on that floor and in those spaces. So we are always mindful of safety and security. And I think the Public Defender's Office needs to recognize and somewhat respect safety and security issues and why individuals are at the Department of Corrections to begin with. Whether right or wrong, guilty or not guilty, we have to respect that process. But we are always going to give access. And if there's any concern, we've always said, reach out to our general counsel's office. And we try to resolve as many issues as possible so that they don't have to be elevated and they don't have to be addressed at public hearings such as these. Thank you.
Well, thank you. I'm interested in a lot of what you said and totally hear you on the safety dynamic that we need to be mindful of, and safety to the attorneys and also safety to the other residents who are at the facility and to your staff. You mentioned people may be dealing with substance abuse challenges or mental health challenges. What sort of training does your staff get on whether someone's going through withdrawal their first couple days or weeks at the facility, or dealing with other mental health challenges that may lead to other behavioral changes?
We have training curriculum in our academy in those areas. And also we have recently also continued to provide additional training. We had, who I believe spoke as a witness possibly at the oversight hearing, but we had one of the national leaders in trauma-informed care, Joan Galeese, who has been providing training on site to our officers on trauma-informed care. So both through what we teach at the academy in terms of, dealing with individuals with mental health issues, and then specialized training that we're doing, such as trauma-informed care with experts such as Joan Galeese are a couple examples.
Thank you. What kind of data does DOC track regarding employment outcomes upon reentry? It's something I've talked to the Mayor's Office of Returning Citizens Affairs about for several years now of, it's one thing to have the program dollars, but how are we determining who has successfully been employed, who has successfully been housed, and has that persisted over the course of 6 months, 18 months, 5 years? So what role does DOC have in that smooth transition between the services that are offered upon reentry, but preparing people for them before they come home?
So we work directly with Department of Employment Services, who does a lot of the programming that we have at the Ready Center. They do track those who receive jobs. They go through their retention process 6 months after they are hired for full-time employment, as well as with our Lead Up, Lead Out program. So for the Lead Out program, we track those residents or those returning citizens once they return back to the community for 6 months after they get out. We provide 3 months of job coaching and retention services once they get a full-time employment. But most of that data would come through our partnership with Department of Employment Services.
Okay.
And DOES is one of our on-site partners at the Ready Center. So they they have staff there.
Okay. And is that what the post-release services funding goes towards? In the budget?
For the budget, that would be, that's part of the reentry. You're right, for reentry, lead up, lead out.
Okay, okay.
And I'm sorry, I got to add one thing. When
Sure.
you're just talking about reentry and I gave thought, you were talking about culinary training. One of the exciting things, I have to mention that the deputy director is looking at the Ready Center is she's working to renovate a kitchen that's actually in the Ready Center so that we can provide culinary training courses actually in the kitchen at the Ready Center for returning citizens. Talk more on that.
So we have a full kitchen inside the Ready Center that we're looking to do not only food distribution for the community, but to begin culinary arts programs as well. We do have a partnership with DC Central Kitchen that we're looking to expand into the Ready Center, as well as we've had a number of partners that have come to us and say, hey, what can we do to help you in this space and provide some culinary arts training programs? But I did want to clarify the post-release services is the halfway house. That's not workforce development.
I
That's the
see.
halfway
Okay,
house.
thank you.
Mhm.
Do you think that there are sufficient FTEs to support the work of the Ready Center?
So I do think that there is sufficient FTEs because we have so many partners. We have municipal, community-based, private, nonprofit partnerships. We have over 60 partners with the Ready Center, and people are continuing to come to try to engage us in that space. So I do believe we have the adequate amount of staff and employees, as well as volunteers, and community stakeholders that are really actively engaged with the Ready Center.
Yeah, so it does go well beyond just, our staff, as was mentioned. For instance, we have Howard University there now, providing classes there. We have Georgetown University providing classwork there at the Ready Center. We have Martha's Table that runs a clothing distribution out of the Ready Center. So we really depend on these wonderful partners within the community, both other district agencies, but also community agencies.
Kind of switching gears for a second, what is the starting salary for a correctional officer?
I wasn't expecting that one. 65. Including fringe.
With fringe.
With fringe is 65,000, with fringe, yes.
People love
It's
to leave off the
53,
thousands
yeah.
and
About
millions.
53
I
or
think
so.
it's
Around
53 without the fringe.
Plus fringe, okay, and is that competitive in the region?
Actually.
Well,
would
let
they-
me, it's certainly not on the high. I guess it's probably about mid, but one of the issues, again, competitive within this region is most of the other jurisdictions, be it in Maryland and certainly in Virginia, where most of your jails are run by sheriff's departments within the counties. But most of the people we're competing with specifically for correctional staff, a lot of the jurisdictions have defined benefit retirement systems. We don't have that, and that's something obviously the FOP union has been taking on for years. But so right there, that kind of puts us a little bit behind because we don't have a defined retirement system for our employees. So that's why we need to continue to do more in terms of, and beyond just the salary, but things like, because at the end of the day, certainly salary and benefits are important, but that's not what's going to keep someone here, is salary and benefits. It's too hard of a job, I think, that you're going to do it just for that. So that's why we are continuing to work on from the retention side, something like, again, starting for the first time wellness coordinator and those types of services so that, things like you mentioned, what can we do to continue to make our staff safer, body worn cameras, things like that, so that the environment that they're working in becomes more of a healthful environment for them, despite all the challenges that they have to meet every day. And that's another piece with looking down the road with a new facility and having how important it was to survey the staff about, not to forget them. Like what do you want to see? What are things that you can would like to experience?
Yeah, thank you. No, I think that's really important. And it may seem like a little thing, but I was just on a tour, I guess it was probably months ago, but feels like just happened, with the new fusion center with HCMA. And they were talking about the colors of the walls that they had painted that was responsive to staff asking for kind of just more spaces that were warmer colors, and even just the difference between blue and green walls versus white walls. And the
Another thing
effect
we
that it has
just,
on mental
again,
health.
just another example, but another thing we just recently did is we did a total renovation of and created for the staff in the jail facilities, a total workout room with exercise equipment and weights and all of that, which again, they didn't have before. And then we also have created or are creating two wellness rooms where, staff people can essentially take a break, in these wellness rooms. So we're trying to do more things with the wellness rooms, with the exercise workout rooms, to really pay attention as needed to the staff.
Okay, thank you for that. And you talked about you kind of loosely talked earlier how other agencies have bonuses. So what bonuses specifically are we offering this year out of that hiring and retention bucket to fill these vacancies?
We're going to offer a $3,000 bonus for, a $3,000 bonus for someone who is hired and successfully completes the training academy. They will get a $3,000 bonus. Then they will get yet another bonus of $3,000 at the successful completion of their 18-month probation. So altogether, with the academy and then completing your probation, which again, that's addressing more of sort of on the retention side down the end, they'll get a total bonus of $6,000, which is significant. Then we're on the other side for staff, current staff, we're going to offer a recruitment bonus so that if you bring someone in, because we do feel that our staff are some of the best sources, if you bring someone in and that person is hired and again successfully completes the training academy, then the current staff member will get a $2,000 bonus.
Well, I was just thinking about that as you were talking about the initial bonuses, so that's great.
Yeah, I think it's going to be a big help.
Yeah, yeah. Okay, a few more specific questions about the food, and then I think we can wrap up. Just about a current standard operation. So how many of your residents receive specialty meals, either for religious or medical reasons?
I'm not sure if we have the number right here. We can absolutely provide it for you, but we do have, we do provide religious diets. We do provide medically indicated, medically ordered diets. And we do provide, for instance, we provide halal meals. We provide kosher meals. We just finished Ramadan. We had several hundred, a large number that participated in Ramadan. and the special meals that we gave there.
The number of specialty meals that are requested and delivered.
Like an average, I
So
can
the
get it'll
number of
change,
people-
but
The number of
Have a-
people,
the
the
number
number
of
of people
people,
requesting
okay.
that, whether it's for medical needs or religious needs, or some other need that I don't know about.
sure.
Okay,
Just like a snapshot.
yeah,
basically.
snapshot's fine. It would just be helpful to have a sense of
Sure.
the current need as it's being requested.
Okay.
During the performance oversight hearing last month, you mentioned updating menus in response to resident feedback. How was that feedback received and how do you solicit that feedback?
So the changes that we made were in direct response to what they did-
Resident
what they resident survey. They don't like the hummus and they don't like, and a couple of other items they specifically said they did not like or were too watery. So we removed those items, from the menu, or lessened, I think a couple of items they said there was too much of certain things.
Yeah, there were
So-
certain things
Right.
there was like, we reduced, sliced deli meats, at lunch. We reduced that some. We increased hot breakfast cereals, because, so we increased those, I believe, from 1 cup to 1.5 cups. The halal menu, they asked for increased, variety of lunch portions, which we had, adjusted some there. Kosher, there were some comments about,
Like
too
peanut
much peanut butter, I think.
Yes. And then
So we reduced, peanut butter on kosher meals. We increased, hard cooked eggs. We increased the frequency of bagels that was requested. We also changed meal patterns, throughout so that there would be, the repetition would be more spaced out. So we changed the meal pattern. So those are some of the type of things that we did.
Can you remind us about the hours that you changed to starting breakfast service later in the morning?
Yes.
I think this was last year.
Yeah, it's been a while, more than a year ago.
I think
But,
it was something like
we set-
3 a.m.
Yeah,
to,
it started at it was 2:30 in the morning. Now they, start breakfast up in terms of getting it ready to go out at 4:30 in the morning is the first group. And that group are ones that have to get prepared for court, because they all have to, be prepared, go downstairs, transported and everything over to the courts. Usually we get them over there by 7:30, 8 o'clock in the morning. So that's the first early group. And then there's other groups that are served at, 6:30 later on. The other thing, that was done along with that, moving the breakfast later, is that we, changed this happened at the same time. We changed the, dinner meal used to be a cold meal. And the lunch meal was one of the hot meals. And so we switched that up based on input. Because typically, we're all more kind of used to a cold sandwich or whatever for lunch, and would rather have something more of a hot meal at dinner. So we changed that. And now the breakfast and the dinner meal are the two hot meals, and the lunch is the cold meal, which I believe is more normalized, so to speak.
thank you very much for that. And as you know by now, the food that we're offering and providing healthy options is extremely important to me. And so we're going to look forward to continue to work together to make sure that people have the nutrients that they need. And I really believe that it is not only important for dignity of people that we have in our care and custody, but that it will lead to improved outcomes with physical and mental health, with behavioral challenges, with violence, and that what we put into our bodies is extremely powerful. So thank you for your continued partnership in our efforts to see
We
improvement
continue to
there.
work on it.
Yes. Well, I want to thank you, Director. That concludes my questions for you. I want to give you a chance, as always, if you have something else you'd like to highlight or close out with.
No, I'd just like to say thank you also to your staff. They're very good to work with, and we continue to, as you said, discuss issues and try to continue to work together to improve things. Thank you.
Well, thank you very much, Director. I will add my thanks to my hardworking team who has been here all day with 5 different agencies, and really appreciate all of the hard work. And thank you to you and your staff. I know I am sometimes hard on you all, but we have a important responsibility in this government for the care and custody of human beings. And so we have to take that especially seriously given the power imbalance that we have in a correctional facility environment. And I also know that this is not easy work. These are not easy answers, and you and your team are extremely hardworking and forward-leaning with a lot of this, and I really appreciate that and look forward to continuing working together throughout this year. Thank you. Thank you. With that, the time is now 7:17 p.m.